Good
Mohit
afternoon,
Nadia.
everybody. We are live, right? Okay. So, good afternoon, everybody. Welcome to the NEET MDS Mega Counseling Session, the first of its kind ever done. And we are very proud here at DBMCI MDS to help you with the counseling process for the All India quota of NEET MDS government and private college seats. I am Dr. Himani Joshi, the academic director for DBMCI MDS and your original guru for oral and maxillofacial surgery. So, just to brief you, first we will discuss about the basics of NEET MDS counseling. Alright, I will tell you कि कैसे करना होता है, किन चीजों को ध्यान रखना होता है, कौन से डॉक्यूमेंट्स आपको रेडी करने होते हैं, टर्मिनोलॉजीज क्या हैं, कोटाज क्या हैं, कॉलेजेस क्या हैं. After we discuss about the basics of the NEET MDS counseling, then each of the 9 original gurus will come in one by one और वो अपने अपने सब्जेक्ट के बारे में आपको बताएंगे. Alright, they will tell you what are the advantages of a particular branch, what are the cons, if any, in their branch, what are the best colleges both in private and government, what is the kind of career that you're going to have. Everything related to counseling will be discussed here today in this live session for all of you. All right, so without wasting much time, let's begin this session. um, so this is the NEET MDS mega counseling session. To begin with, just a little brief about what is the counseling process, what are the terms, and who is doing what. All right, so the NEET MDS examination, as we all know, is being taken up by the National Board for Examinations of Medical Sciences. All right, there's a medical examination board which takes all the exams from NEET UG, NEET PG, NEET MDS, NEET FMG, and foreign dental graduate exams also. All right, the counseling, however, is done by the Medical Council Committee. All right, they are synchronized. They are both under the DGHS, but they are synchronized and separate bodies. So, Medical Counseling Committee under the Director General of Health Services is going to conduct the counseling process. It's a completely online process. पहले हम जाते थे सेंटर में अपनी ब्रांच चूज करते थे. Not like this anymore. Since the last few years, it's a completely online process. So you can sit in the comfort of your home. You don't have to get wet in the rains outside, and you can do the counseling yourself. All right. This counseling gives you an admission to all the government and private colleges of the country through the All India quota. Also, for the prioritized candidates, जिनकी प्रायोरिटी लिस्ट में ऊपर नाम है, उन कैंडिडेट्स को आर्म फोर्सेस मेडिकल सर्विसेज में भी एडमिशन इसी काउंसलिंग के थ्रू मिलेगा. ऑलराइट, 2 colleges, Army Dental College, AFMC Pune, and RNR Delhi. These are the 2 colleges where the armed forces, conducts the postgraduate courses. We will talk about that separately. All right. The counseling for Army Dental Corps will be discussed about separately. We will not talk about Army Dental Corps here because that is not a postgraduate seat. It's just a career in Army, and we are not talking about Army Dental Corps in this session. Also, the counseling for states and union territories is a separate thing. Okay, the rules for each state is different, the rules for each union territory is different. We will discuss in brief about the common rules. However, each state give their own rules one by one. Okay, so that we will see as the time comes. Today our main focus will be on the all India quota and the special university quotas for both government and private colleges. Okay, so first we will talk about the eligibility criteria. Who is eligible to sit for this counseling? Of course, you should have your BDS degree completed. You should be registered with the State Dental Council. All those who have not registered yet, please go and at least get a provisional registration done. Okay, provisional registration करवा लीजिए. Permanent registration may take some time. At least a provisional registration in whichever state you are. Every state of the country has a dental council, a state dental council. So please visit the office of a state dental council, submit your documents. They will take the basic documents, first to final year mark sheets, 10th standard mark sheet, internship completion certificate, maybe some more small documents, but these are the basic things you need. So please get yourselves registered with the State Dental Council. I'm sure most of you have done it while you are appearing, registering for the NEET, applying for the NEET form. So the NEET prospectus tells us that the internship should be completed by 31st of March. Okay. All those who have completed their internships by 31st March were eligible for taking this exam in the first place as per the prospectus of NEET MDS 2024. So we will consider this as the last date of internship completion. There are two exceptions. We all know about it. The students of 2007-8 बैच जिनकी 4.5 years की BDS है और सिर्फ 6 months की internship है, and Raja Motaya Dental College in the Annamalai University where the course itself is of 5 years. So these are the two exceptions. Other than that, everybody should have finished 1 year of internship by 31st March. Foreign students who have done their BDS from outside India, you should have cleared your FDST exams before taking this test. And whoever wants to sit for this counseling, you should have scored at least the minimum qualifying criteria to qualify you to sit for this counseling. Okay, आपका minimum cutoff score इतना होना चाहिए. For general and EWS, it should be 263. For SC, ST, OBC, it should be 230. And for general PWD, it should be 246. All right. If your score is below this, you are not eligible for all India quota. However, you may be still eligible for state counseling. All right. It is very difficult to get a rank, to get a seat with a score below this, but still you are eligible. Just to let you know, you are eligible for state counseling seat if your score is below this. All right. For all India counseling, you are not eligible. So this is the eligibility criteria. Now coming to the participating institutes and quotas. Okay, what all institutes are participating in the all India quota? So all the seats of the government college, 50% of them are reserved for the all India quota. State quota seats, the rest of the 50% are state quota seats that will be decided upon by the state merit, which is yet to come. All the MDS seats in private colleges, deemed universities across the country are going to be filled by the All India quota, will be filled by this counseling. All right. Like I said, Armed Forces Medical Institutions, 2 colleges, and Army Dental Corps also, but we are not talking about that. 3 institutes which are very, very premier but are not going to be included in this counseling are all the AIMS, PGI Chandigarh, and JIPMER. These institutes are open for counseling through a separate exam of INI-CET MDS. So there will be no counseling for these 3 institutes through this NEET MDS counseling. Most of us know about this fact. Okay, now quickly discussing about the categories. There are various different categories that are there in this All India quota. General category, the candidates who do not have any certificates, who are normally the general category people. Then the reserved category, which are OBC. There is a lot of confusion whether your state OBC list is valid or not. Only the central list of OBC, which is not under the creamy layer, will be accepted for OBC. If you have filled the OBC certificate and you don't fall in this list, automatically you will be upgraded to general category. Okay. Other than that, the categories are SC and ST. Beyond that, the other reserved categories are economically weak sections and persons with benchmark disabilities. All right. There is a separate certificate which is there. You all have filled it. Those who are there in these categories, you filled it during your application forms. All right. Then there is a category of Indian and non-Indian students. All right. Non-Indian students can belong to the NRI category, overseas citizens of India, people of Indian origin, or foreign candidates. All right. There is a separate category. The NRIs and OCIs are eligible for NRI seats also and for Indian national seats also under the All India quota. But in this quota, there will be no other caste quota applicable. All the NRIs and OCIs who are fighting for the seat, you will be fighting under the general category only. There will be no caste category, reserved category in the non-Indian quotas. All right. Whatever quotas you have selected in your application forms, that is final. In no way you can change your quotas during counseling. I have a lot of queries all the time that, ma'am, when I filled the form, I didn't have an OBC certificate. Now I have it. Can I change to it? I didn't have an EWS certificate. Now I have it. No, you can't change it. The answer is clear no. You cannot change your date of birth, your PWD status, your category, any of these things during counseling. Whatever you have filled during your application form is full and final. If your category is unaccepted, you're automatically changed to general category. All right. So this is about the quotas which are available. Now, the seat allocation quotas in the All India are the All India quota, which is 50% of all the seats, state quota, which is the remaining 50%. Okay. Now, in All India quota, there are various other quotas. There is a separate university quota also. Aligarh Muslim University, which has the Ziauddin Ahmad Dental College, Banaras Hindi University, which has the IMS BHU, and Delhi University, which has three colleges: LHMC, Lady Hardinge Medical College, Maulana Azad Medical College, and University College of Medical Sciences. They have their separate internal quota. That means all the students who have done their BDS from these institutes, they have a separate quota for PG seat in the same institutes. Okay, through the All India quota. All right, you will understand it a little better when I show you the matrix. So all the students, so LHMC does not have a BDS, UCMS does not have a BDS. Only MAMC has a BDS. So MAMC students have a little edge that they can compete for this separate Delhi University quota. Similarly, Z Ahmed College students and IMS BHU students have a little advantage because they are really old premier institutes and they have a little benefit for their BDS students. Apart from that, there are other quotas only for private colleges. Okay, till here the AMU, BHU, and DU quota. This is for the government college seats. Okay, whereas the other quotas like the Jain minority quota, there is a college called KM Shah Dental College in Baroda, which has a Jain minority quota. There is a Yenapoya Dental College down south, which has a Muslim minority quota. Then all the private colleges, many of them have a NRI quota. Many private colleges have a management or a payment seat quota. All right. So these are the quotas which are only there for private colleges. And of course, we know that the army quota is for the army colleges. Right. So if you are looking for a government college seat, please see the All India quota, the state quota, and if you belong to these institutes, see if you belong to these quota. Private college aspirants, you have to look out for these quotas. And army aspirants, look out if you have your name in the army priority list. All right. Okay. I will just turn on my YouTube so that if you have any queries, you can keep putting your queries here in the YouTube chat box, and I will be very happy to answer your queries. All right. So just telling you briefly about some quota, like this KM Shah Dental College has a Jain minority quota. All right. Okay. Okay, so Pranav Loya is asking me, when are we supposed to upload your caste certificate? You should have already done it during the application form. Okay, during the application form, you should have done it. You should have mentioned it. Rest, the checking of the caste certificate and all will be done by the institute. Okay, the institute will check whether your caste certificate is valid or not. Mentioning that I belong to this caste should be done in the application form. Checking of the certificate will be done in the institute when you go for joining. All right, Pranav, I hope that answers your question. Okay. Similarly, like I said, Enapoya Dental College in Mangaluru has a Muslim minority quota. Many colleges have an NRI quota. Almost all private colleges have a management seat quota. All right, so you can all look forward to if you belong to certain quotas. Quickly discussing about army. PG in Armed Forces Medical Services, only two colleges, AFMC Pune and RNR Delhi. And mostly the people who belong to priority 1 and priority 2, they are selected. Okay, if you're a civilian, or if you're an ex short service commission army dental corps officer, or if you're a paramilitary or a sponsored candidate, the chances of getting a seat is very, very low. All right, most of the seats are taken up by priority 1 and priority 2 candidates. There are hardly any seats left for civilian dental surgeons. All right, now I will just give you a brief on what the states decide. Okay, the states will decide, every state will decide its own state quota rank, its own state category rank, benefit for in service candidates. A lot of states have a benefit to those BDS candidates who have done some in service postings. A lot of states have a benefit for students who have done a rural posting. Okay, so whether you are a beneficiary or not will depend on your state, state rules. So look forward to your state rules and see if you are an in service candidate. That means if you're already a faculty or an in service person in the state service commission, in the state colleges, all right, there's a separate quota for that. Or if you have a benefit in rural postings, PGI Chandigarh and many other colleges have that advantages. Plus, what is the eligibility criteria? Some states have domicile as the eligibility criteria. Some states say that no, you should have done BDS from here. That is their eligibility criteria. So every state, these things are different. So whatever state you are looking forward to, please check your domicile state and check your BDS state wherever you have done your BDS. So check in either of the states or both of the states whether you are eligible or not. All right, that is how you have to decide the state counseling ranking and state counseling eligibility. Certain people who are doing their PG courses, again they have done NEET. So the university takes the decision. In that case, the university decide whether the students who are already doing PG, whether they can be given an MDS seat now or after completion of the course. So that is a university decision. It is not a center decision, it is not an NBDE decision, it is not an MCC decision, it is not a state decision. It is a purely university decision. So you have to check your university rules for all those who are not happy in their current MDS courses and have done NEET exam again and want a seat. So check your university criteria whether you are eligible for a course or not. All right. Now, the next part is the result. Okay, I'm sure you have all seen your results. You have your NEET overall rank, you have the 50% quota rank, which is almost the same as NEET 24 rank. They just screen out the people who are not eligible. And of course, the category ranks also. What is your OBC rank, your SC, ST, EWS, PWD rank? All these ranks are already there on the NBE website. I'm sure all of you have seen your ranks, seen your scores. Now, before the counseling process, what are the documents that are mandatory, which you have to have? Your admit card, when you have admit card and application form. More than the admit card, your application form. Okay, your application form, both I'm sure are available with you in soft copy. Just take a fresh printout whenever you're going to the institute to submit your documents. So you need your application form. Admit card is not mandatory, but keep it. Okay, just don't run here and there in the last moment. Keep it with you. Your scorecard, that will be given tomorrow. Tomorrow NBE is going to release the individual scorecards. 29th to 30th June, your individual scorecards will be coming. Okay, you can download your individual scorecards on 29th, 30th June. Just before counseling, this different colleges will give their seat matrix to NBE, to the MCC, and MCC will give you a scorecard telling you your score, your overall rank, your all India quota rank, and your category rank. So you will get a scorecard of all the details that you need tomorrow onwards. It will not be mailed to you. You will have to download it from the NBE website. All right, and the allotment letter which you get at the time of counseling. So keep these things downloaded and ready. Apart from that, of course, you have to have your first to final year mark sheets, your internship completion certificate, Your BDS degree certificate. Some colleges give the degrees immediately, so you have a permanent degree. Some colleges send the degrees later on, so you have a provisional degree. One of them you should have, all right? The 10th standard mark sheet, which is a your identity proof, your date of birth proof, and your council registrations, provisional or permanent, should be there. Your caste and quota certificates. Now, here is the answer to the question that was raised initially. The caste and quota certificates are not uploaded or checked in NBE. All right. You have just filled that you belong to this caste in the form. The checking will be done in the institute. All right. So you have to take it in a foolproof manner in the institute. As a personal advice, I also recommend that you take the copies of your PAN card, Aadhaar card, and your bank account details. Because when you go for joining, you will need all these, and take some photostats, take some self-attested photostats. That will be of really help to you in your, getting settled in the city, in the college. All right. I'm just hoping that I'm audible. Okay. Sorry for that glitch here. There are some network issues. Okay. So, what is exactly the meaning of seat matrix? Seat matrix means which category will have which seat in which college, in which branch. That will be released on tomorrow and day after tomorrow, 29th and 30th of June. So, start making your choices from tomorrow as soon as the seat matrix is released. We will help you in making these choices, but you start the process. All right. Okay. First to 7th July, you have to register for the counseling. Remember, this registration is separate from the registration that you have done for exam. You have to again register and pay a fee. All right. A part of this fee is refundable. That is the bond or the security amount that the colleges will take. Okay. And some of it is non-refundable. Non-refundable means it is the charge for counseling. It is not much. I think 1,000 rupees or something is the charge. So some fee is non-refundable, some fee is refundable. So keep your accounts ready. Make sure that you have enough amount in the account so that you can register for the counseling process. The fee is separate for private colleges, separate for government colleges. So keep a substantial amount, around 50,000 you should have in your accounts to pay the refundable amount. Okay, it's more than required, but you should be ensuring that you have some amount, some accounts ready. 2nd to 6th July, you can fill your choices. Okay, you can not just fill your choices, but you can also modify. आज लग रहा है कि oral surgery करना है, but मैम का सेशन देखने के बाद लग रहा है नहीं यार, oral surgery is too tough for me. All right, so what can you do? You can modify your choices. All right. Um, okay. Some glitch. The video will come back. Don't worry. So the choices can be modified over 6 days. You have 6 days to take a decision to modify your choice whenever you want to change. You have a window of 2, 3, 4, 5, 6. Okay, up till 7th also, till midday of 7th. All right, I'll just take a pause here because there is some streaming issues here. Okay, all right. So 7th July, by midday of 7th July, you will be locking your choices. If you don't lock it yourself, automatically they will be locked. Okay. So fill your choices and lock it so that there is no confusion. There is no, there is no confusion. You should lock it yourself. By 10th July, the results will be there along with the allocation letter. Whatever choices you have filled based on your merit, a branch will be allocated to you. If you are happy, if you want that branch, if you're okay with it, you should go and report to the college and join with the documents that I've already mentioned. And with your reporting, your residency begins. You are a resident in that college. All right. After the round one of All India Counseling, ideally, all the state counselings should happen. Ideally, okay, this is the ideal situation which should happen. After the first round of All India Counseling, the first round of state counseling should happen. All right. It is expected to happen between 10th to 20th July. All right. When the first round of All India is over, the states open their seats, the states release their matrix, release their, rank list, release their rules and regulations. So you expect it to be between 10th and 20th July. So you have to be very alert. You have to keep your eyes and ears open. Don't wander here and there on 10 states. Just make sure which state you are eligible. So सिर्फ अपने स्टेट को देखना है और ऑल इंडिया को देखना है. All right. After round one, there is a round two All India Counseling. All right. Same things. It will start from 20th July. Again, a new seat matrix will be released that will tell you the vacant seats. Whatever seats are vacant, if some students have taken up state seat, which is better than their All India seat, so those All India seats will get vacant. All right. So all these seat matrix will be released on 20th July. So those who are not happy with their first counseling result, you can all upgrade. You can all upgrade in the second counseling. Okay, same process. You have to register and pay, fill choices, modify, lock, and receive the allocation letter. I will quickly give you some examples from last year's counseling. Okay, All India rank 74. All right, he or she took GDC Trivandrum Prosthodontics in the first counseling. They surrendered the seat in the second round and they got GDC Chennai Orthodontic seat. Okay, maybe that was more, maybe that college was more preferred to him or her, or the branch was more preferred to him or her. So whatever is your, requirement based on your college, based on your branch, you can upgrade in the second counseling if it is available in your, if you've already filled the first, second, third choice and you're getting your first choice, you will not be eligible. If the first choice that you have filled, you're getting it, you will not be eligible. Only if it is not available to you, you will be eligible for the second round of counseling. Same thing, there will be a round two in the state also, which is expected to be between the first week of August. Okay. And after that, again, there will be a third round of All India Counseling. Okay. I will just pause here because, okay. Yeah, it is streaming properly. I hope you can all see. And all right. Okay. So these are the dates and steps for the third counseling. Okay, same steps, just the dates have changed. Okay. Now after that, there is a stray round. Stray round is usually for the private colleges. Usually, no government college seats are left in the stray round. They are all taken up in the first, second, and third round. Whatever seats are left in the private colleges, in the stray round, the private colleges can do their own counseling. They can take charge of the counseling and allot the seats as per the students who are approaching those colleges. All right, so that is known as a stray round. Obviously, no government colleges seats are left. It's only for the private colleges. All right. Now here we come to मुझे क्या मिलेगा. Okay. What will you get at your rank? Okay. Now the national boards or the MCC has given us only the 2023 data. Okay. So all these ranks are based on the 2023 data, which are the latest. Okay. Seats keep getting added or seats keep getting reduced, mainly from the some private colleges, keep getting added in both private and government colleges. So the latest matrix that we have till today is the 2023 matrix. Tomorrow, that is 29th of June, you will have a new matrix. Okay, based on that you can get an idea, but what choices you can fill, what you can get, that idea you will get only by the 23 matrix. So we have done that research for you, and I am going to tell you that if you want a clinical seat in government college in open category, your rank should be up to 250. Okay, I am giving a window of plus minus 20 ranks because that depends on which category goes up, which category goes down, but usually up to 250 rank. You, if you are an open category student, you will get a clinical seat in government college. Now what is clinical? Oral surgery, ortho, prostho, endo, pedo, and perio. These six branches I'm talking as clinical. Okay, what are non-clinical? Oral pathology, oral medicine and radiology, and community PhD. All right, these are the non-clinical seats that you can get if you are an open category student up to the ranks of 400. Okay, the range is 350 to 450, but broadly up to 400 you can get a government college non-clinical seat. Okay, now category seats in the government college can go up to 2700. Okay, last year 2693 was the last rank in which the last government college seat was picked up by a category student. Okay, so 2700 plus minus 300 is the range in which you can get a government college seat if you are belonging to any of the categories. Okay, private college ranks up to 14,000, you can get a seat in the private colleges. All right, so this is broadly what you will get at your rank. Okay, so how will you make a choice? Okay, this is the most important question, especially with our rankers. Especially, usually the scenario in dentistry is that there are hardly any jobs. Okay, after you finish your PG, you have to start your own career from zero. Okay, so how will you make a choice? First and foremost is today. Ideally, in your BDS, you should decide. But if you've not decided in your BDS, today you should decide how you want to shape your career. All right. Whether you want to start a clinic, whether you want to go for a consultation kind of practice, whether you want an academic career, like a tutor in a college, or some faculty in some college, or a teaching institute like what I do, or you can do everything like I am doing. And whether you have some funds or not, what is your funds, what is the capital that you have, or what is the capital that you will have at the end of your PG. Okay, so if you are doing PG from say Maulana Azad, you will have a stipend of around 1 lakh, more than a lakh rupee, like 1,15,000. So by the end of 3 years, even after paying all the taxes, you will have around 35 lakh rupees. All right, so what are the kind of funds that you will have, and with that funds, how can you shape your career? Based on the answers to this question, you will decide a branch. All right. All the 9 original gurus of 9 dental specialties are going to come to you after me, after this session, and they will tell you whether in this branch a clinic is better, consultation is better, academic career is better, joining a hospital is better. Okay, which is better. All right, so how do you want to shape your career? Please don't allow yourself to finish your PG and then you will decide. कई लोग ऐसा करते हैं कि PG पूरी फिनिश हो गई, फिर सोच रहे हैं कि यार क्लिनिक खोलूं कि कंसल्टेशन करूं. प्लीज, दैट इज नॉट द टाइम टू डिसाइड. This is the time to think. if you really want a useful career out of MDS, okay, if you want to really enter the market and start earning quickly, this is the time to decide how you want to shape your career. So that is the first thing. Like for example, I always wanted to be a surgeon, so I never thought of putting up a clinic. My best friend always wanted to be an endodontist, so she was clear that I have to have my own clinic and I will do smile designing and digital dentistry, and she's doing everything. So decide now. Second is, what is your dream branch? Okay, a lot of students ask me, ma'am, whether I should choose based on college or whether I should choose based on branch. All right, it's a very tough question to answer, although, but if I was in your place and considering the dental scenario, okay, the college stays with you for 3 years. The branch stays with you for all your life. All right, you're making a career out of your branch, not out of your college. Yes, there will be so many advantages of being from a good college, but there will be much more advantages of doing a branch which is your choice, which is your passion. So please follow your passion. Okay, if you get a college of your choice in that passionate branch, excellent. If you don't, you can let go of the college. That is my opinion. All right, you can always have multiple opinions on that, but this is how I see it. And this is how when we take topper interviews, when we take interviews from the past 12 years, this is how usually most of the toppers choose. Okay, they always prefer the branch unless they are getting a non-clinical in a college. So that's how they decide. The third is the college of choice. Of course, if you stay in the same city. Now here it's a very important practical aspect of life. If you're getting a very very big renowned college, it makes sense to relocate and do PG from there and come back. But if you are getting two similar status colleges, one is in your city and one is in another city, always choose the city where you are going to settle. Okay, some people, like some of my seniors, they did their PG from Ahmedabad and they settled in Ahmedabad. That makes a lot of sense because of lot of your follow up patients are going to visit your clinic. Okay, I did my PG from MAMC in Delhi, my SR-ship from AIMS in Delhi, and I have my clinic in Delhi. So a lot of my MAMC patients come back to me, my AIMS patient come back to me. A lot of family friends will come to you when you settle down in your own city, and that makes a hell lot of difference in the beginning of your career. Of course, eventually, if you're hardworking, if you're skilled, you will have a great career. But in the beginning, when there is a setback, if you settle in the same city where you have done your PG or where you are born and brought up, settlement becomes very very easy. Your community helps you to settle, your contacts help you to settle, your friends and families help you to settle. So please choose based on the city of choice also. Next, like I said, clinical versus non-clinical. Now, each of the faculties will discuss the pros and cons of each branch, and each branch is earning. All right, I will not say that this branch earns more than the other branch. Every single branch has equal earning potential. Depends on how you shape it. All right, so clinical in a private college versus non-clinical in a government college. I know this question is going to come to me many a times, but you have to decide based on question number one, how you want to shape it. Okay, if you want to shape it in a clinic, please take a clinical branch. If your interest or your passion lies in academics, even a non-clinical branch from a government college will take you closer to your academic goals. Getting an SR seat from a government college is much easier than getting an SR seat from a private college. So, depending on what your career goal is, you will make your choices. All right. Okay. Next is, how will you choose between government colleges and between private colleges? So, in government colleges, you can choose based on the procedures that are performed and the facilities that are available. Okay. So, if you are doing, say, PG in oral medicine, and there is no CBCT in the college. There is only OPG and IOPS facility. So that's a little less facility. Whereas the other college has an OPG, has a CBCT machine, okay, or has access to CT and MRI. So that's a better facility availability. So based on the procedures that are performed, like if I give an example of oral surgeries, then KGMC does clefts, does onco, does orthodontics, does distraction. It does everything. Whereas maybe some GDCs are not doing everything. So, depending on the procedures that are performed there and the facilities available, you have to decide. A lot of students also decide based on stipend. Yes, there is a very wide variation on the stipend of different colleges. Yes, you can make a choice based on stipend. The central colleges like MAMC, KGMC, LHMC, UCMS, they have a very high stipend of over a lakh rupees, 1,15,000. Whereas the state GDCs in Maharashtra, they are still around 50,000, 60,000 rupees. So stipend is a very big deciding factor. It's a very big economical factor also. So based on the stipend, yes, you can decide. And a very big factor also is the bond. A lot of colleges have a bond that you have to stay back and work for 2 years in this city, in this state. All right. That bond, please read the bond very, very carefully and take a choice. Very simple example again, I will give you. Like, if you have a very good rank and you are eligible for a seat in KGMC, but KGMC has a work bond for 2 years, you will be posted in different rural areas of UP and you will have to serve the state for 2 years. If you don't do it, you will have to pay a sum of around 40 lakh rupees as a bond, penalty. All right. Similarly, if you leave your PG, if you give away a seat, also there is a bond from 5 lakhs, 2.5 lakhs, 5 lakhs, 10 lakhs, up to 40 lakhs. So depending on which college has how much penalty bond for leaving the seat and how much work bond, please make a choice accordingly. Private colleges, there is no bond problem. Basically, you have to make a choice depending on what is the patient flow, how many patients are available. Okay, facilities also, of course, facilities, what are the facilities available, but facilities आप use किस में करोगे, patient में ही करोगे ना. So you should see how much is the patient flow of that college. That is, should be the first criteria. And second, of course, very very important, how much is the fees. Okay, sometimes fees is not much, but add-ons are very high. You have to buy each and every material yourself and all of those things. So what is the fees and what are the add-ons? What is the hostel fees, what is the PG fees, what is the food fees, and all of that. So based on that, you will make a choice of private colleges. So this is about the general counseling of the NEET MDS. We will now look at all your doubts. Is Dr. Saurabh with us? Yes. So for this doubt session, I also welcome with us our senior faculty and pharmacology guru, Dr. Saurabh Bhatia. Welcome, sir. Thank you so much for being with us in this session.
Yeah, thanks, Dr. Himani. Thanks. And it was really a wonderful session. I was also listening, like how to choose a good seat. And it was really enlightening for all the students and also for me also, like how to go about this seat selection and all. And whatever you suggested, it's exactly up to the mark. Like whatever my experience is, like I have experience of around 14, 15 years. This is the best way of choose the medicine. And I'm really thankful to the DBMCI to arrange such kind of sessions for students. So, Dr. Himani, how to go about this? Like, shall we
So
take?
now I'll just read the questions that we have from our students in the live chat. And
Okay.
if we have already answered it, we'll skip those questions. And if you have not answered it, I'll request you to please help our students.
Okay.
Okay, so caste certificate, when we are supposed to upload, Pranav, we have already told you. If we are not eligible now, will we be eligible for All India counseling after the cut off drops? Uh, yes, Jerry, like we have already answered this question that the state counseling is still open if the cutoffs drop. If the category seat cutoffs drop, yes, you will be eligible. Okay, usually this happens for the private college quota, usually doesn't happen for the government college quota. Sir, this one is for you. Kabir Jaiswal is asking that if we participate in state first round and get a college allotted, can we sit in All India second round with the state college seat retained?
No, no, no. Actually, what happens every year they will issue some guidelines, and every time they can change the rules.
Yeah.
Usual pattern is like in a previous few years counseling, like if I talk about the medical counseling, they always tell you to give up the seat first. So you have to resign from that seat and then only you are eligible for the next round. So, I mean, if the pattern, if the trend will remain same, then the student has to resign and give up that seat, then only he will be eligible.
All right. I hope that answers your question, Kabir. It's a little unfortunate that this is happening, but you cannot have ghee in both the hands. Just the matrix will help you here. I think you can look at the seat matrix, and based on the matrix, you can have an idea that with your state rank, what seat you will get. Okay. So just by looking at the matrix smartly, you can decide whether you will leave that All India seat for the state counseling or not. Am I right, sir? Is that the right way?
Yeah, surely. Because the practically, if you think if a student will give up the seats, only then that seat will appear in the next counseling.
Yes.
If you will
Yes.
not give up the seats, how the government will come to know that how many seats are vacant? So we
Yeah.
cannot keep both the seats in our hand. We have to give up first, then only the list will be prepared. And they will give you also the cutoff date, like up till which date you have to give up the seats. Then the list will be prepared, and you would be eligible for the second counseling. So it's not only one student, like it will be applicable to all. So like if students are giving up the seats, you will automatically come to know that are you going to get this better seats or not. So I mean we have to leave basically.
Believe, yeah, right. Okay. Vajni and Ranju Malika are asking me about Karnataka counseling and rural posting. We will have to sit and see for each and every state, beta. We cannot discuss about every state here. Whenever the notifications are released, we'll have to sit and discuss about each and every state separately. Okay, Jerry, if we've already answered your question, uh, Aesthetesty is asking me, ma'am, will category rank taken into account for All India counseling? Yes, of course. Sir, I think you can answer here.
Yeah, can you please pardon the question? What did they
Sir,
ask?
will category rank be taken into account for All India counseling?
Category rank taken for yes, yes. Like,
Separate list, no?
but my
Separate
understanding is if the student belongs to a category and he or she wants to pick up the seats from the general category also, then the person is eligible. Person is eligible to pick up that seat. Yeah.
yeah. If at your rank the general seat is available, you will have to take the general seat. If at your rank the category seat is available and you have that rank, then you will have to take the category seat.
Yeah. Generally, what happens with the student belongs to category and he or she will get a particular rank. Usually, in their own category, they will get a better seat. Like this is the usual trend. So most of the time, they don't have to go for the general category. But in case they want to pick up this, they can go for that.
Can go for, yeah. Okay. Amish is asking, sir, after the cutoffs drop, are we eligible for deemed and state counseling? So I have already told you that state counseling, you're already eligible depending on the state merit, whether the state says that this is the cutoff. So that will depend on the state counseling. And deemed, you are anyways eligible, sir. What is your idea on the deemed universities, deemed colleges?
Yeah, eligible for that. Like in case they're eligible for state counseling also, as well
Yes.
as for deemed universities. Yeah.
So, Amish, in case you are asking if your rank is way below 14,000 and you think you will not be getting the seat through All India quota, there is always a stray round that we said. There's a stray round of counseling after the third round where you can directly approach the institute, whichever institute you're interested in. And if they have seats available, they can offer that seat to you. All right. Aman Arora, ma'am, also do the INI-CT counseling procedure. Yes, Aman, we will do that when INI-CT comes up. Uh, all right. What is the age for Armed Forces Medical Services Counseling? So, Joy, if you are in the priority list of 1 and 2, only then you have to think about the age. There are a lot of criteria for Armed Forces Medical Services. There is a physical fitness criteria, there is a medical criteria, ophthalmological tests are done, weight tests are done, fitness tests are done. There's a lot of criteria. We will not get into it because that's a separate thing. Sir, if you want to shed some light on the Armed Forces Medical Services, like what is the age and what is the counseling criteria?
See, age I exactly don't remember. That must be mentioned in the brochure, like what is the maximum limit. But as far as the medical things are concerned, they are not very rigid about this medical things in the doctor's field. Like if they're recruiting a doctor, they're recruiting a dental surgeon. Then the important thing is your exam rank, like your exam score, your rank, and like how your interviews go about it. So the fitness level is not that much important. Like they don't ask to undergo this fitness test. So like the question is like the medical thing is important. So if you're lagging somewhere in the medical grounds, then you would be eligible. Like you will be considered as a qualified person to get that particular seat in that armed forces. So, like for soldiers and other things, they can ask for these medical things, but not for the doctors. Even I got selected in the FMG, like during my school, then during my UG days. So even I went for these interviews. I gave these 2 3 interviews. I cleared those interviews, but they never asked for these medical things. So the same thing applies here also. So medical is not a big issue for the doctor to get selected over there.
All right. I hope that answers your question, Sujoy. Okay. Is category rank taken into account? Of course, there is a separate category list, and that is taken into account. Talasri Divyasri is asking, what is DCI registration? So, whenever, sir, if you can tell, that will be better. Council registration के बारे में पूछ रहे हैं. What is council registration? MCI or DCI?
Actually, DCI ka Dr. Himani, you can better guide
Okay.
them. Yeah.
Okay, so just like medical council, there is a dental council in India. It's a central council body which registered all the practicing or all the dentists who have completed their BDS. All right, it's a central body, and apart from that, every state has a state dental council. So as soon as you finish your BDS, as soon as you complete your internship, you are supposed to register yourself as a practicing or as a eligible candidate, as an eligible dental surgeon under the dental council. Okay, it can be the state dental council in whichever state you are, or it can be the dental council of India directly. Usually it is done under the state councils. Okay, so that is the DCI registration. As soon as you finish your BDS, your internship is completed, you have your internship completion certificate. Obviously, you have your first to final mark sheets. Go to the state dental council and register yourself as a person who has finished BDS. That's a basic criteria to get into PG, to get into army, to get into practice. That is the basic. आपको गवर्नमेंट को बताना है कि आपने BDS कर ली है और आप एक क्वालिफाइड डॉक्टर हो, तो गवर्नमेंट आपका नाम उस रजिस्टर्ड डॉक्टर्स की लिस्ट में डाल देगा. दैट इज व्हाट रजिस्ट्रेशन इज.
And one thing more, I think the students are confused about, like in case they will change the seat, then how will this registration process will be migrated? Because the main concern about the students who are undergoing this counseling thing.
Yeah, yeah.
So the basically, like whenever you people get registered under any body, so you will get a receipt from them. Like your certificate will be issued in 10 or 15 days, but there's a 1 day procedure only. You just submit your documents and you will get a receipt over there. So if you get a seat in medical counseling, like if you get any seat in a particular college in this counseling, and you're going to join that college, that you have to just submit that acknowledgement receipt. Like it's not necessary that you should have that certificate all the time with you, right? So you can just submit that acknowledgement receipt that you have applied for the certificate, and that will be considered as a good enough proof that you are eligible for the seat. And tomorrow, in case you will resign from a particular seat, like you want to take seat some other state, then in that case also you have to apply for the migration, and again you will get a acknowledgement receipt from them, and that is sufficient proof for the migration also. So basically this registration process is not a hurdle for you, like in case you want to switch the seat from one state to the state, so that the paperwork is sufficient enough, and that these people, government people and private people, consider this as a document proof. Because now the students, Dr. Himani, they have to resign from one seat and they will go to other states. Then
Right.
the problem comes that what we have to do
Documents come.
migration. Yeah.
Yeah, yeah, yeah. So, like Sir has said, it is just a formality that you have to do and follow the steps that Sir has told. And the counseling, the colleges or institutes will also guide you, like how the procedure has to be done. So don't worry about that. A lot of students are asking about the second round, third round, mop up round. Look, the seats in government colleges in India in dentistry are already very limited. So don't expect that a lot of seats will be open for you in the second, third rounds or in the stray rounds. Yes, a lot of private college seats will be available and you can always go for it. But I will not expect the cutoffs to drop for the government college seats because so many students have qualified, but the seats are limited. So, yes, the cutoffs can drop for the stray round. All right, so you can keep an eye on that. Okay. NIRF ranking of any college is deciding. It's not a clear question. Um, so all the others are the Okay, so Jerry is asking ineligible students will be eligible for state round. I've already answered this, Jerry. You have to look at the state rules. Whenever the state leaves, takes out its registration rules, you have to see whether you are eligible or not. For MCC, you are eligible for state counseling, but every state will also give its guidelines, and based on that, you have to check whether you are eligible or not. All right. And DCI registration is not a separate registration. If you are registered with the me is asking this question. If you are registered with the state dental counseling, that is already enough. You don't have to separately register for DCI. The
Yeah.
state dental council registration is the registration that we are talking about. All right. How to join Army College? We've already talked about it in the session. If you are in the priority 1 and 2, you are eligible. Okay, now the doubts are mostly about sir मेरे को किस rank पे क्या college मिलेगा and all of that. Migration sir has already answered. Sir, I think we've answered most of the doubts related to counseling in general. Anything you want to help the students with or tell the students?
Yeah, Dr. Himani, actually, I just want to say that the session is just an amazing because this is what the student wants right now. I mean, like when they were UG, when they were choosing for this BDS, at that time they were not mature enough to take a decision. But this is the right time to take the proper decision because BDS is just a general degree which everybody is holding. But MDS or the master degree is something that will always remain with you for rest of your life. So whatever decision you will make is going to stick with you for rest of your life. So guys, please be a part of this counseling and always keep on touch with us and keep on having the guidance of Dr. Himani with you. And always, I will suggest that try to choose the bestest seat for yourself because this is going to really shape your future. And I really thanks DBMC team to arrange such a great sessions for the student. And I also invite all the students to join our premier group. Like we have a Telegram MDS premier group. So I know that we have tried to answer most of the queries, but still there are many questions who are many students who are asking the questions, and many students will see this particular videos on YouTube after this session. So guys, if you're listening this right now, so you can join our Telegram MDS premier group. This group is free for all. Like anybody can join and anybody can put a message over there. So we all 19 gurus are there for you to guide you. So in case you have any doubt, any problem, any kind of query regarding your career, regarding your exam, because we are also going to start the new batches for your preparation, and also we will follow the same routine that we followed in our last batch, and many students have got cleared this exam. So guys, please join the DBMC PML group for any other queries because we have a limitation also here also in YouTube. We cannot continue the session for a long. So guys, take care, and I hope you will take a bestest decision for yourself and for your career. Thanks, Dr. Mani. Thanks for inviting me for here.
Sir, I will just take one more minute of yours. Thank you so much for those insightful words. But I think Dr. Saurabh is a very very good example of how he chose a career before starting PG. I think sir आपको sure था कि you wanted to always teach, and you always wanted to have an academic career in your life.
Uh, uh, yeah, to some extent, yes, you can say yes, because
Yes. So
yeah. So when
So
I chose this field of
in spite of getting a lot of options, including all the clinical branches and medicine and everything, Dr. Saurabh has chosen pharmacology for the passion of teaching. All right, and sir is a very very established senior pharmacology guru. Very very, matlab, he's made a career out of teaching. So don't think that any branch, if it is clinical or non-clinical, whether I will be able to make a career. Sir is one of the perfect examples in front of you that any branch can give you name, fame, money, prosperity, satisfaction, just if you are sure of what you want from that branch and if you are willing to work hard. So sir अपने मुंह से नहीं बता रहे usually ये चीजें,
no, no, this
right?
is absolutely true. Actually, once you get your seat of your choice, everything follows automatically. Like whether it's money, fame, and respect, everything automatically follows. And guys, like these days, because the competition is growing up and it's a throat cut competition, and I suggest you like whatever branch you will take after having this counseling sessions or after a lot of discussions with other faculties and other senior members. My suggestion is while doing your MDS, guys, try to have some short course of management, like MBA type of things. so that like this will also give you a chances like how to establish your clinic, how to how to be financially better in the future. Because these days we doctors are concentrating on the studies, but the one thing we are lacking, that we are not having a knack of that financial knowledge. So my
Yes.
suggestion is like you have 3 years of your MDS, so at least spend 2 or 3 months of getting or doing some online course for the finances, so that you can plan yourself in a better way. You can plan and you can invest your money, whatever stipend you will get, how to invest that money, so that once you complete the 3 years, you will have a that much sufficient amount of capital in your hand that you can establish your clinics and you can start your dream kind of a dream clinic or dream hospital. So, and any branch you will take, like Dr. Himani has mentioned, every branch has a scope. Every branch may you can settle down. The only thing is that you should have that clear path in your mind, like how to go about this thing. So, this is what my suggestion is.
So very, very important 2 points you've said, sir. This financial, getting literate, financially literate is very, very important. Thank you so much, sir, for those very, very important and beautiful words. Um, Thank you, sir. Thank you for your time.
Thank you, Dr. Himani. Yes.
All right. Okay. So now we begin with our individual subject sessions. We begin with oral surgery one by one. Every original guru is going to come here with you and discuss about the prospects in their own branch. All right. So I am beginning here with oral and maxillofacial surgery. So all those who are willing to take up oral surgery can stay in the session and raise whatever doubts you have. Okay. So first thing is we will talk about what exactly is an oral and maxillofacial surgeon going to do. करता क्या है oral surgeon? All right. So institute में क्या करता है और अपनी private practice में क्या करता है? What does he do in the institute when you are doing your PG, and what do you do in your private practice? So just to list it out, exodontia, trauma, pathology, and infections. These are the four things that every maxillofacial surgeon is going to see while they are in the institute, any institute, whether it's a government college, whether it's a private college, whether it's very, very old institute, whether it's a new institute. Most of the institute, eh, I mean the decent ones, those who have some patient footfall, these are the things that all the colleges will give you an exposure to. हर गवर्नमेंट कॉलेज और हर डिसेंट प्राइवेट कॉलेज आपको ये चार चीजें सिखाएगा ही सिखाएगा. Okay, you will learn these four things, and believe me, these four things is what is going to be your bread and butter as an oral surgeon. All right, I will just add implants here in the practice section, because some colleges teach implants in oral surgery, some colleges teach it in prosto, perio, maybe not in oral surgery. But अगर आपको फ्रैक्चर में प्लेट में स्क्रू लगाना आता है तो आप इम्प्लांट लगा ही लोगे. ऑलराइट, सो दीज आर द 5 things which you are going to do 90% of the time as a oral and maxillofacial surgeon. Okay, so your focus when you are doing your PG, your focus should be learning these 5 things in the best possible way. हम क्या करते हैं ना, हम ऑर्थोग्नाटिक सर्जरी के पीछे भागते हैं, हम क्लेफ्ट के पीछे भागते हैं. Yes, they are careers, but to what percentage of people are they careers? Okay, so the next set of things that we learn, I will just write it down, are clefts, oral cancer including reconstruction, that is the microvascular surgery aspect of it, orthognathic surgeries, distraction osteogenesis, and facial cosmetic surgeries. All right, broadly speaking, these are the things that any oral surgeon is going to learn during his PG, after his PG, in courses from here, there, from mentors, from godfathers, from wherever you are. Okay, but these 5 things जो हमें almost हर institute सिखाता है, they make up around 80% of your bread and butter as an oral surgeon. Okay, whether you want to have your consultation practice, whether you want to get attached to a hospital, whether you want to get attached. Of course, I forgot about joint here, the TM joint procedures. Okay, minor procedures will be here. TM joint minor procedures will be in the minor list. The major procedures are going to be in the major list. All right. So ये आपकी प्रैक्टिस का 80% हिस्सा है. So when you are doing your PG or when you are searching for a college, प्लीज इंश्योर कि एटलीस्ट ये 4-5 चीजें आपके कॉलेज में सिखाई जा रही हैं कि नहीं. All government colleges will have these things. Not all private colleges will have it. So find it out. Patient flow है कि नहीं, ये सब चीजें सीख रहे हैं कि नहीं. All right. Clefts, cancers, orthodontics, distraction, facial cosmetics, joint procedures, few colleges are doing. Not all colleges are performing these surgeries at the institute level. If you want to really learn them, you can always go and do fellowships. You can learn them separately. You can learn them from your periphery postings, plastic surgery postings, general surgery postings, ENT postings. As oral surgeons, in your first and second years of PG, you will be sent to a lot of periphery postings. If your institute or your department is not doing these surgeries, you can still learn these surgeries from your peripheral postings. Okay, so whenever you are searching for a college, make sure that the college is sending the postgraduate to the peripheral postings. Okay, and their peripheral postings should be good, because a lot of these things you can learn from other departments also. Okay, so that is what exactly an oral surgeon is going to do. Remember, as a private practitioner, bulk of your career will be oral surgery. Very little part of it will be maxillofacial surgery. So I'm not saying you should not learn cleft, you should not learn cancer or orthodontics. No, it is very passionate. I mean, it's very, very thrilling to learn clefts. It is thrilling to learn cancers, orthodontics, distraction. Please learn it in the best possible way. But at the same time, do not forget that your bread and butter is going to be this 80% things. So, skill wise, train yourself in these 3 years to be the best possible surgeon who can extract a tooth. It's not easy. Be the best possible surgeon to do an IMF or do an ORF. Be the best possible surgeon to enucleate or excise a pathology. All right. These basic things, may you should be so confident in your skills, not theory, not just theory, but your skills. That when you finish your PG, you can confidently perform a procedure without any roadblocks. Okay, so your focus in choosing a college should be 80% of this and 20% of rest of the things. So that is my first advice to all of you. Okay, second thing is, what are the career options after MDS in oral and maxillofacial surgery? So I forgot to mention the academic career here. So you can start consultations. All right. You can make a card. You can write Dr. Himani Joshi, oral maxillofacial surgeon. You can drop in the various clinics where you stay around that. So if there is an oral surgery case, please remember me. Please call me. So you can begin your career with consultations. Not many people will put their hand into surgeries. People need oral surgeons. All right. So please make your cards and please start dropping them after you finish your PG in the vicinity, and they will start calling you for surgical cases. If you do a few cases initially nicely without any problems to the patient smoothly, you will be their favorite surgeon. If you do the first few cases badly, they will never call you back. So get your skill training right and you can start your career with consultations. Few people who have enough capital that they have gathered during PG, or they have capital from their family, you can also plan to start your own clinic. Okay. We will discuss the pros and cons, but in a clinic, even if you're not doing every procedure, you can keep people with you. You can take help from your juniors, from your colleagues, and you can run a multi speciality clinic. It is on you. All right. As an oral surgeon, if you want to perform other procedures or not, you can do it because you've learned everything in BDS, but it's your will. Okay, so suppose I am an oral surgeon and I never want to do anything beyond oral surgery. I never perform. I have a clinic, but I don't perform anything other than oral surgery in my clinic. I will do OPD and I will give the case to the specialist who is also visiting the clinic, who is sitting there full time. So I sublet the cases, but at the same time, I have equally competent oral surgery colleagues, my friends who have their clinics, and they don't have any problems in doing RCTs and doing crown cuttings. It depends on what you want to do. Okay, I love to teach, so I teach. They don't like to teach, they like to do RCTs, so they are still doing RCTs. Okay, maybe not as good as an endodontist, but an emergency access opening can be, a very big help to a patient. So depends on you. If you start your clinic, what all procedures you want to do, you want to relearn and do, and what all procedures you don't want to do, it's totally on you. You can also go for hospital attachments. The problem or the difficulty in hospital attachments is it is difficult to get in tier 1 cities. It is not at all difficult to get in tier 2, tier 3 cities. In smaller cities, in smaller towns, you can get attached with hospitals who will call you for trauma cases, for pathologies, who will call you for emergencies, for TMJ joint dislocation reductions, mainly for trauma cases. Okay, so you can get attached to hospitals. You can also get attached to teaching institutes, to teaching hospitals. They will involve you as faculties, as oral surgery tutor, lecturer, assistant professor, and slowly, slowly you can upgrade yourselves in the hospitals as an academic career. All right. So that is another kind of career that you can look forward to if you have a very academic kind of aptitude. Okay, if you love to teach and learn. Another thing that you can do after oral surgery are the various fellowships. In India and abroad, there are various beautiful fellowships in oral surgery in things like clefts, trauma, orthodontic surgery includes distraction and TM joint. And of course, there is oral cancer also and reconstruction. I'm very proud to say that even my co-PG, who was done PG with me in MAMC, has done his fellowship in oral cancer, and now he's sitting there in East India doing a lot of cancer resections and vascular rehabilitations for patients. My seniors from MAMC have done their fellowships in clefts, in trauma, in oral cancer, and they're all enjoying the benefits of these fellowships. But let me tell you here, these fellowships do not guarantee a job. They will never ever guarantee a job. I can see all your questions coming up here, but I will answer them after I finish the session. Most of your questions will be answered in the session only. All right. So none of the fellowships will guarantee you a job. All right. It is your wish. It's a long road. Okay. All these fellowships are long, very profitable roads, but long roads. You have to keep attached to the same institute or some institute where the same procedures are performing. Okay. क्लेफ्ट अगर आपने फेलोशिप करी है तो आपको क्लेफ्ट के किसी ऐसे इंस्टीट्यूट से अटैच होना पड़ेगा जहां पर क्लेफ्ट प्रोसीजर्स होती हैं. So you continue performing cleft procedures there and you take your cleft practice forward. If you come back from your cleft practice and start zero, you are again to ground one where you finished from PG. So fellowships आप बहुत सोच समझ के करिए. तभी करिए जब आप उसको करियर की तरह लेंगे. आप क्लेफ्ट को अगर करियर की तरह देखना चाहते हैं, it's a long road. Again, I'm telling you, it's not a 1 or 2 year job. It will take at least 3 or 4 years for you to settle down after your PG. If you're ready for that, go ahead with fellowships, beautiful fellowships in different branches available to there. Settled आपको खुद होना है, jobs available नहीं होती हैं. All right. So that is about the career options that you have in oral surgery after MDS. Also, keep in mind that you can do multiple things together. All right. An oral surgeon, जब आप पीजी करते ओरल सर्जरी में, ओके, यू आर डूइंग योर ओपीडी ऑल्सो, you are doing your ward round also, you are taking care of the OT also, you are going to the emergency also. So you are already learning to multitask. Remember, I am very proudly saying that any oral surgeon, if you have done your PG properly from a good place, you are learned enough to multitask. So, as an oral surgeon, you can do everything together also. You can do your consultations with your clinic, with a hospital attachment, and with a small academic career also. I am very beautifully managing all these things together. and trying to get the most benefit, maximum, financial benefit, maximum, every kind of satisfaction that I can get from this branch. Okay, so you can also do many of these things together. You can have your own clinic at one part of the city and do consultations in the nearby villages or towns. All right, or even in the nearby areas in your own city. All right, so these are the career options after MDS in oral surgery. All right, now Pavneet is asking me, do we need to pay for the fellowships or do we get a stipend? If it is a entrance based fellowship, like AOMSI takes out many scholarships. Okay, the Association of Oral and Maxillofacial Surgeons of India is a body of oral surgeons. If it's an AOMSI fellowship, it's a paid fellowship. That means you don't have to pay anything. You give an entrance exam for that fellowship, just like a PG entrance or an SR entrance exam. If you are selected in that exam, in the theory and interview, you are awarded that fellowship and you get a stipend also. All right. If it is an AOMSI fellowship or a paying fellowships, some fellowships are not paying, you have to pay and take those fellowships. Okay, so it's a mix. The best kind of fellowships in oral surgery in India are the AOMSI fellowships. Okay, and these are paid. You don't have to pay anything, you will be given a stipend. All right, I hope that answers your question, Pavneet. Okay, yes, we are coming to all your questions, me and Zubi. We will come to it. So, what are the advantages or pros of being an oral surgeon? The best advantage that I feel is quick, big money. You perform a procedure that not many people are going to do, as simple as a third molar extraction, a wisdom tooth which was impacted. You do a procedure one time, the next time you only have to remove sutures. It's not a very big thing, and anybody can do it for you. So, one big procedure, even a small procedure like a transalveolar extraction, and you quickly earn big money. All right, I can easily earn 7, 8, 9, 10, 11, 12,000 for an impacted third molar, depending on which city you are in, which town you are in. All right, it begins from as less as 3, 4,000 to as much as, like I said, the surgical satiety. Okay, if you've always dreamt of being a cardiovascular surgeon or a plastic surgeon and you could not get into MBBS and you got into BDS, you want that surgical thirst in you to be quenched. वो एक डॉक्टर वाली जो फीलिंग होती है, कभी कभी हमको लगता है कि डेंटिस्ट्री से नहीं आएगी, विच इज अ रॉन्ग फीलिंग. वो एक एंडोडोंटिस्ट को भी उतनी ही आती है जितनी ओरल सर्जन को आती है. बट अगर आपके मन में वो कीड़ा है कि भाई मुझे ओरल सर्जरी ही करनी है, तो जब हाथ में खून लगता है और जब इंजेक्शन लगते हैं और सूचर्स लगते हैं, तो दैट सर्जिकल सेटाइटी इज अ वेरी बिग factor to give you a satisfactory career. All right, for that surgical satiety is a very big advantage of being an oral surgeon. Ability to learn other facial procedures. There's a lot of trend going on about cosmetic procedures like Botox and facelifts and derma fillers and collagen fillers and these kind of trendy procedures, lip fillings and all those facial cosmetic related procedures. It's very easy for an oral surgeon to learn them. They are allowed to do it, and it becomes very easy for an oral surgeon to learn it as compared to other branches. I'm not saying that they cannot learn it. Learn it. Anybody can learn it. If you are eligible, you can learn it and you can practice it also. But for an oral surgeon, it gets very easy because you have learned the face in and out. You've done trauma, you've done pathology from ear to ear, sometimes maybe into the skull, and you know how to handle facial tissues. So, cosmetic procedures can be done and learnt very, very easily by an oral surgeon. And the most important thing is implants. Okay, as per the current trend, although implants is a prosthodontic rehabilitative thing, but since a part of implants is surgical, the first phase of implants is a surgical phase, so a lot of money is involved in implants. Okay, whether you are doing your own clinic, whether you have consultations, implants is a very good way to earn by any dental surgeon. And the pre-prosthetic surgeries, yes, a prosthodontist can do it, an oral surgeon can do it, sometimes even periodontist can do it, but an oral surgeon can do it the best and the easiest way. All right, so if you have to do a sinus lift, if you have to do a ridge split, if you have to do a ridge augmentation, if you have to do a distraction induced alveolar ridge augmentation, an oral surgeon is the best person who can do the pre-prosthetic surgeries and the surgical implant cases. All right, so that is one big Advantage or pros of being an oral surgeon. Quickly, let us also discuss the limitations of being an oral surgeon. Like I said, when you do specialization, or this is actually super specialization in any subject, your knowledge of other subjects goes to a backseat. Okay, so there is a little. So, suppose if you are doing endo, you will still know how to do RCT, you will still know how to do a crown cutting, you will still know how to do veneer, and you will know the basics of dentistry also. But as oral surgeon, you can know impression making, you can know cast making, but you might not remember that beautifully how to do a crown cutting, how to do a proper re-RCT, or how to negotiate with a broken file. Yes, you can relearn it. Anybody can relearn it because you've all done your BDS. A lot of my colleagues are doing other subject work also from their BDS knowledge or from their revision of BDS knowledge. But generally, broadly speaking, it's a little difficult for a surgeon to go back to the general dentistry procedures. So that's a little limitation there. And for that reason, sometimes oral surgeons take a lot of time to set up their own clinic. They are not confident every time that if I open a clinic, yeah, if the patient comes with toothache, I can't do an extraction, I will have to do an access opening. Still, you can work around it. You can work around keeping some BDS graduate or keeping an endodontist under you or with you, and work around for the dental procedures. There is a way around it, but these are the small limitations that I see in the branch of oral surgery. Having said that, uh, before we begin with what rank you will get what, something from my heart, I will want to say oral surgery is the best branch. Okay, no offense to any other branches, but it's the most beautiful and the most rewarding branch that I feel. And I couldn't have imagined myself into any other branch. All right, so बहुत ज़्यादा partiality हो गई towards oral surgery. I am sure every faculty will do it for their own branch. Okay, coming to the statistics. किस रैंक पे आपको कहां पर ओरल सर्जरी की सीट मिलेगी? वेरी क्विकली वी विल वाइंड दिस अप. Talking about the last 10 years trend. Okay, initially there was a trend of ortho. There was a lot of trend of ortho कि भाई ortho सबसे top में pick up होती है. But if you see the trend of the last 10 years, oral surgery has been the hottest pick. Okay, four branches: OS, prostho, endo, and ortho. They have always been the hot picks. Initially girls didn't take oral surgery. Now most of the colleges there are girls who are there in oral surgery. All right, so that has been the hot pick in the last 10 years. Open category, if you want a government college oral surgery seat, you can get it up to a rank of 180 plus minus 20. Okay, this is according to the trends that we have seen in 2023. If the branches, if the seats increase this time, or if the matrix changes to a drastic amount, there is a scope of plus minus 20 ranks here. But broadly, there is a scope of getting an open category government college seat up to a rank of 180. If you are OBC, you can get a government college seats up to a rank of 250. Okay, plus minus that range is always there. For EWS, last year the rank went up to 330. But since the matrix keeps rotating, you will always have a scope of plus minus 50 here. For SC, 1300 rank तक आपको government college में oral surgery मिल सकता है. ST, last year there was no seat in government college, but up to 1800 ranks you can get an ST seat in oral surgery in a government college. For the persons with benchmark disabilities in open category, up to the ranks of 4900, you can get an oral surgery seat in the government colleges. Okay, so this is the rank based government college seats that you can get. Quickly showing you the matrix and allotment of 2023. In 2023, rank 1, 2, 6, 12, 17, 20, 21, and 30. Many in the top 30 ranks took oral surgery. I'm sure they are going to make a beautiful career out of it. So, this has been the trend of 2023. Open category ranks went up to 188. Okay. OBC, the first ranker was from OBC category, but he had to take seat from open because that is the norms. But up to 262, the seats had gone. EWS till 330, SC till 1373, and Open PWD till 4928. This was the trend in last year. Now we come to a very important quota seat which is given through all India counseling. Okay, there are three universities which give preference to their own student based on their all India ranking. Okay, so this is the all India quota only, but they are given preference to any other outside student because their BDS is from this institute. Now, oral surgery seats are there in IMSBHU. Last year, there were two seats, as you can see here in IMSBHU. One was in open category and one was in OBC. So, two seats were taken. Rank 68 and rank 113 OBC had taken it. Aligarh Muslim University, again, there were two seats. Both were there in open. So, the students who have done BDS from AMU and their All India rank was 536 and 783, they were eligible and they got the seat through the All India quota. And DU, there are two colleges, Lady Harding Medical College and Maulana Azad Medical College. UCMS has only a pediatric seat, it does not have an oral surgery seat. These two colleges have oral surgery seat. So इनमें कुल मिला के दो seats थी, एक EWS General और एक, okay, sorry, one ही seat थी. So that had gone to SC and EWS, that had gone according to this rank. So this was the matrix of last year. So if you belong to BHU, AMU or any of these colleges, LHMC में तो BDS है ही नहीं, but if you belong to these colleges, please look out. This can be the quota seat that you can get. So अब इस साल आपको क्या मिल सकता है? वैसे तो tomorrow the matrix is going to be released and you will know what you get. Okay, just give me 1 second so that I can connect my laptop to the charger. Give me 1 second. Okay. All right. So, through All India quota, broadly speaking, if you are, there are 30 to 35 government colleges. Last year, seats were opened in 32 colleges. There are around 51 seats in oral surgery. All right, I am only talking about OMFS here. I'm not talking about other branches. There were around 51 seats last year in all the categories together in government colleges. So this year we expect around 50 plus minus 5 seats. Private colleges, there are around 26 private colleges, deemed universities that participate in all India quota. There are many more private colleges in the state quota. But in the all India quota, in the deemed category list, there are around 26 private colleges and they have 141 seats. Till last year, there were 141 seats in various quotas: management quota, payment quota, NRI quota, Jain quota, and Muslim quota. All right. So these are the seats in private colleges. Many more private colleges are available in the state quota. This is the matrix which you all have in your website. And talking about the top colleges in oral surgery, it's very difficult to choose the first best. So I have put 4 colleges in the top colleges list. Okay. 2 colleges, MAMC and KGMC, Maulana Azad Institute of Dental Sciences and King George Medical College, top 2 colleges through NEET. And AIMS Delhi and PGI Chandigarh are the top 2 colleges that you can get into through INI-CET. All right. So these 4, in my opinion, are the best colleges for oral surgery post graduation. If you are okay with the 2-year work bond, please choose KGMC. Okay, if you're not okay with the work bond, please choose MAMC. All right, that's the only difference. These are oral surgery in maids has started in 2012, whereas oral surgery in KGMC is very, very old. It's a much more older institute, much more established institute, but there is a very long work bond of 2 years or a penalty of 40 lakh rupees. So that's a very big deciding factor based on which you can choose. All right. So through NEET, you can choose MAMC or KGMC if you're in the top ranks. The next in the line are equally good colleges, but because of differences in stipend, because of differences in the available procedures, they slightly come down of the first few colleges. They are the Institute of Medical Sciences, IMS Banaras Hindu University, Varanasi, PGI Rohtak, GDC Chennai, and Nair Mumbai. Now, please forgive me. Again, I'm saying if you feel that, GDC Kozhikode is better or any other college is better, this is purely based on stipend, purely based on the students' feedback that we have, that how much satisfied they are in the particular colleges. All right. This is not a personal only view. This is based on the review that we have from many students across the country who have done their preparations with us, and whether they are happy in their college or whether what all they are learning. All right. So these are the top government colleges in the country for oral surgery. I will also let you know what are top government colleges based on your region. Okay. If you are from North India and you're not in the top government colleges, you should always choose a college in the northern states. Travel becomes easier, expenditure becomes less, and settlement becomes slightly easier. So in North India, we all know AMU, LHMC, GDC, Srinagar, Amritsar. Nagpur is not really North India, it is West India, but Jammu. These are the colleges in North India. South India, Kottayam, Bangalore, Kozhikode, Hyderabad, Trivandrum, Vijayawada, REMS, Andhra Pradesh, and Kudalur in Tamil Nadu. These are some of the best colleges. West India, GDC Mumbai, Ahmedabad, Jaipur, Goa, Aurangabad, Nagpur, and Jamnagar. These are some of the great colleges. These are all very, very old. GDC Mumbai is a very old college. GDC Ahmedabad is a very, very old college. Jaipur is a very, very old college. So all these are excellent colleges. It is very difficult to really rank them on priority. You have to choose them based on stipend, your city, and all of that. East India, R. Ahmed, obviously the oldest college in the country. SCB Cuttack, MGPGI Pondicherry, Vijayawada, GDC Vijayawada, RDC Guwahati, and RIMS Kadapa in Andhra Pradesh. These are the good colleges, GDCs in East India. And in Central India, there are Indore and Raipur. All right. So these are the government colleges list in oral surgery. Coming to the private colleges, now I have made this list based on two things. कौन से रैंक पे कौन सा कॉलेज पिकअप हुआ है, that is the way in which I have. So the after the government colleges stopped, after the government colleges seats got over, which college did the student prefer, that college is on the topmost list. Okay, so based on that I have made a priority list. Also, the highlighted colleges are the one which are established with a lot of seats and a slightly better reputation. All right. So BVP Pune, Sharad Pawar Wardha, Savitha Dental College Chennai, again a very old institute, KLE Belgaum, AP Shetty Mangalore, and Amrita. These are the institutes जो उठते भी जल्दी हैं, कम rank पे उठते हैं, and they are sort of renowned also with good patient footfall. So these are the first 10 colleges. In the next 10, we have DY Patil Navi Mumbai, Manipal, Manipal, and DY Patil Pune. Okay. And in the last list, we have Meenakshi Ammal, Chennai. All right. It's very difficult to prioritize these colleges into priority lists. The fees for these colleges is very, very variable. You'll have to check their individual websites. It's very clearly mentioned, and it keeps changing. So you have to check their websites for the fee. It usually ranges from 10 to 15 lakh per annum. All right. So you go to their websites and you can check. All right. This is a kind of proper a matrix for the deemed universities for oral surgery seats, and whoever wants it, I will be very happy to share it with all of you. So this is about the counseling process in oral surgery. All right. I hope I have been able to tell you all about the colleges. If you have any questions, we are ready for it. So Kabir is asking me, isn't dual qualification required for fellowships and premier institutes? Not at all. Dual degree is not required in India. You can get into fellowships in oral surgery, in cleft, onco, even with an MDS degree in oral surgery. You do not need an MBBS degree for that in India. In some countries abroad, you need a dual degree, not in India. Okay, Pavneet, I've already answered your question. What all states are open and closed? Is there a list? I didn't get your question of open and closed. States will release their list from now on. Okay, now that NEET has given its matrix, now slowly, every state will start giving its seat matrix, and you will have to keep an eye based on which state you are from. आपको अपने state की website पे जाना है, and if you want help with the website, you come to the DBMCI MDS group. We will help you with the website of individual state, and you can go and check the website of individual state. Zubi, I have already answered your question. Good private and government colleges. Private college, what are the procedures taught in oral surgery? Anvesha. I've already told you the best private colleges. Beyond this, you will have to find out go and ask the PGs who are performing the procedures in that college, and they will be able to guide you. I've already given you a list of the top colleges based on their feedback from the students and based on their, their name in the oral surgery world. All right. So Himani Sharma, I will have to restrict myself from answering about individual college. This is a little dicey, so I will not talk about individual private college here. Ritvi is asking me third rank. Is taking state quota private college in Ahmedabad, which teaches 3000 rank. Okay, 3K rank. I've already answered this question in the basics discussion, Ritvi, and you can go to the basics discussion and listen to it. Always choose a branch over a college or a city. All right, this is my recommendation to you, Ritvi. So you can choose Ahmedabad if you are ultimately going to settle in Ahmedabad or Gujarat. It makes a lot of difference to be in the same city. And like I said, 80% of your earning will be bread and butter. Only 20% will be those extra big things. So focus on bread and butter now. Be smart. You are anyways a Gujarati. You have to be really smart. And remember, you have to come to the market, come to your clinic, come to your consultations as early as possible. All right. Okay, Vishal, this is not a platform to discuss career options abroad. I'm not going to discuss about the career options abroad. We are only talking about the counseling procedure in India. All right. So, with that, I think I have taken up all your doubts. Uh, and Shreya Bandari is asking me the last doubt that we'll take here. After that, we have Dr. Aishwarya here. And I visited a lot of clinics from my place, and everybody is just giving me negative reviews about OMFS and just discouraging me. So you didn't talk to me. You've never talked to me. See, there are two kinds of people you can look up to, right? There are two kinds of things you can look up to. For every branch, for every career, engineering, अरे engineering में तो बहुत पैसा है. A group of people will say that. Other group of people will say, अरे अब engineering में jobs ही नहीं बची. अब आप BAMS कर लो. So every career, every thing in life has two ways of seeing it. ब्रांच आपका करियर नहीं बनाएगी. ब्रांच या कॉलेज आपकी सक्सेस डिसाइड नहीं करेगा. आपकी हार्डवर्क, आपका डिटर्मिनेशन, आपका फोकस आपका करियर और आपकी सक्सेस डिसाइड करता है, ना कि ब्रांच. ओके. As much as I am passionate about oral surgery, I will again reinforce this fact that every branch has potential. Every branch can take you to the peaks of career. The best example that I can give you here is Dr. Sanjay Maikar. Dr. Sanjay Maikar is an oral pathologist by a postgraduate degree. But there is no celebrity in Mumbai who he has not touched or whose life or whose dental checkup is not done. Okay, so one of the most celebrated dental surgeons in India is Dr. Sanjay Maikar. That's the simplest example I can give you. There are many others. All right. So it is on you who you listen to, and the best thing is you listen to yourself. What you want to do. All right. So I hope that answers your question, Shreya. And all the other questions, Mumbai, South, North, everything I have answered in this session. For further questions, please put your doubts on the DBMCI MDS group. It's a free group. You can all join that group and put in your queries there. Now, I take the opportunity to invite Dr. Aishwarya here. Sir has already joined the session. Good afternoon, sir. Aishwarya, sir, if you can listen to me.
Hi guys. Hello everyone. Am I audible? Rishabh, am I audible? Fine.
Sir will take
Am
on
I live?
from
I'm not able to see myself on the screen. I'm live? Acha, okay, fine. Great. Hi friends. So this is Dr. Aishwarya Kaushik, and I'm an endodontist. So I've come for to add value to your counseling sessions, which you will be attending officially. That DBMCI MDS, we are giving you a sneak peek into what kind of and exposure you will have during your counseling sessions. So I'm going to give you an idea for, as far as my subject is concerned, your career options, your life as an endodontist, once you, if at all, you choose to take up conservative dentistry and endodontics as your MDS specialty subject. That's one. The second, and more important actually at this point of time, is that what kind of ranks you have and what kind of colleges you should kind of put them on your priority list while you are um, filling up your form, online form, right? So I'm going to give you some good perspective on the choice of colleges based on your rank, a basic idea. So let me start with a basic idea of my subject, guys. Conservative dentistry and endodontics, we are dealing with, as far as clinical practice is concerned, restorative dentistry, right? So we talk about cons and endo, we're basically talking of restorative dentistry, guys. Yeah. So we're doing all kinds of complex as well as simple fillings. And please realize that what is good about restorative dentistry is that full coverage crowns, crown and bridge work, which actually overlaps with that of prosthodontics, also comes under our specialty. So we're not just doing simple restoration or fillings, but it's actually the crown and bridge work that we are doing as part of our routine as well as specialized clinical practice. Then, of course, as far as endodontics is concerned, guys, we're dealing with root canal treatments. You've all done your BDS, so you all have basic idea of what the life as an endodontist is going to be like. Guys, as far as career options are concerned, see, the best part is you end up spending a lot of time in your clinic. So all of you who are oriented towards hardcore clinical practice, forget about the money part, that will come. But all those who are interested in hardcore clinical skills, fine motor skills, endodontics is a wonderful subject. I passed out of my MDS back in 2014 from Maulana Azad Medical College, which now we are very commonly referring to as Maulana Azad Institute of Dental Sciences. If you see the data as far as the top ranked colleges are concerned, the toppers take that college. That used to happen in our time as well. Another important thing that I want to tell you is that as far as the financially viable career option is concerned, apart from starting your own practice, which all of us are not able to do, as was the case with me also initially, because you need to build up some kind of capital, you need to generate some kind of money to start up your practice. You have got good career prospect as a consultant, as a visiting consultant. So you can spend a few years visiting clinics, earning pretty decent, earning your skills, fine-tuning your skills, working on your skills, doing some good work. Of course, that consultation practice would be restricted to only doing root canal treatments. You won't be able to get your hands on crown and bridge work, because obviously that is something that the owner of the private practice would want to do himself or herself, or at the max would call a prosthodontist, right? But once you do that and you start simultaneously, start your own practice, 7 or 8 out of 10 patients in clinical practice, 7 to 8 patients out of an average of 10 patients, guys, are going to be pertaining to some kind of restorative work or root canal treatment work, and obviously subsequently crown and bridge work, right? So I'm including, obviously, if you end up extracting a tooth, that tooth has to be replaced. So you're going to replace it with bridge work, right? Implants are there. Of course, implants don't come under our specialty as such. But yes, many of us, after doing cons and endo, we do end up continuing our education, take up CDE courses, CME courses, and gain some good level of proficiency and expertise in implant work. And we start doing implants as well. So that's another very important aspect of clinical practice. So guys, this is something that basically all of us are well aware of. You've all done your BDS, right? I'm not talking to a crowd which is right out of school, right? So you've done your 5 years of BDS. Apart from this general knowledge, there's just one thing before I start the real thing about the counseling session and what kind of seats you should fill up, what kind of ranks you have, and what kind of seats you should fill up, guys. Let me just tell you one thing. Guys, there are many of us who are very intelligent, get good ranks, somehow are not just oriented clinically because of some kind of peer pressure, because of some kind of pressure from our parents or from our relatives or from our neighbors or from our friends or from our seniors. We end up taking a clinical branch, right? Don't do that. I was very clear. If I get a good rank, I will take up endodontics. It is a subject that I love. I love performing root canal treatments. I have a dental operating microscope in my practice. I love doing my work there. But many of us are oriented towards research. Many of us are oriented towards academic work, towards complete academia. And we end up finding ourselves misfit in a clinical branch. So even if you are a great ranker, top 100, top 50, top 10 ranker, and common sense and logic says that you should take up a clinical branch, but if you feel and you're confident that you're not cut out for this, please do take a branch of your choice. Take oral path, take oral medicine, take something that'll give you happiness, because ultimately we end up doing work. I'll tell you, this is a fact. Ultimately, you end up doing work which you are good at, number one, and which gives you happiness, right? You understand, you will not be able to sustain yourself in a subject by only thinking that this is money minting. So please, before I start with the ranks, with the choice of colleges, please realize, guys, that ultimately you have to ask yourself, introspect, ask yourself, what subject intrigues me? What is that one subject that I like to read? And some of us are actually so clinically oriented that we just we study hard for the competitive exam just to crack it. And then we are like, just forget about studies now. I'll just do some basic amount of study to keep me upgraded in my subject. But I am like complete hands-on. I just want to do patients from morning till evening. Take up endo, take up a branch like prostho, right? Take up a branch like oral surgery, where just giving injections, local anesthesia, and just working on patients. So please ask yourself, before you ask us, before you ask your friends, before you ask your seniors, ask yourself, what is that one thing which you really want to do for the rest 30 to 40 years of your life, right? Most of you are in the age bracket of 25 to 35, right? So please, that is the most important thing, right? Now, coming back to the most important thing, that's our choice of subjects and the ranks. Now, guys, if you see last year's counseling, guys, very commonsensical. If you see the top rankers, because of one, patient exposure, right? Because of patient exposure, number of patients, that's one thing. And because of the stipend or the salary, right? We all choose, the toppers choose government colleges, right? Isn't it? Now, amongst the government colleges, what are the various colleges which are right at the top? So first is obviously New Delhi MAMC, which is also known as MAIDS or Maulana Azad Institute of Dental Sciences. So I've prepared a list here. So you can see here, guys, we have right at the top, we have my college, that's MAMC. Then usually previously, till 10 years back, we used to have bang on KGMC or GDC Mumbai. But, the kind of exposure that you're getting at PGI Rohtak is wonderful. So the toppers usually prefer after MAMC, PGI Rohtak. And in fact, some of us actually end up, in my time, there was a rank one who actually preferred PGI Rohtak over MAMC, right? So that's right there at the top. Then, of course, we have the oldest dental college of our country. That's Calcutta, R. Ahmed, Kolkata. That's again one of the topmost, KGMC Lucknow. Then down south, we have GDCs in Kerala, which are very famous. So we have one Trivandrum, then we have Kottayam, and then we have Kozhikode. Right, guys? So I'm just going to categorize them, based on area specific. If you are in that area and you don't want to go far from your house, then GDC Trivandrum, Kottayam, Kozhikode, wonderful colleges, great infrastructure, great academic environment, great patient exposure. You'll get to do, periapical surgeries, root canal treatments, freehand, inlays, onlays, post and core, crown work. And that is the case with my college as well, Maids or MAMC. We used to have a freehand, we used to do complex cases, periapical surgeries, inlays, onlays, a full mouth, even up to the extent of full mouth rehabilitation, right? Which was not very palatable to the prostho people, but yes, that was one thing which was. I'm simultaneously looking at the messages as well, right, guys? Then what else do we have? Then we have somewhere in the middle, we have, the colleges of Gujarat. And GDC Ahmedabad is very, very famous. Then we have in Rajasthan, Jaipur. Before going further, then we have GDC Jamnagar as well, right? So we have GDC Jamnagar as well, right? In the north, apart from Delhi and surrounding areas, we have AMU, Aligarh Muslim University, which is again a very old university, right? Top 200 students usually take this college. In Rajasthan, you have GDC Jaipur, which is again giving you a lot of exposure to patient work. In Tamil Nadu, amongst the government colleges, you basically have GDC Chennai. All right. Otherwise, when I talk about the list of private colleges, we'll realize that there are a lot of uh, private colleges which are pretty popular, right? So I'm going to tell you the ranks as well as the relevant or the important or the top-notch private colleges there, in case you don't have a top 500 rank. Then in Uttar Pradesh, I talked about, so in UP, I talked about KGMC, and then we have BHU, which is also amongst the most sought after colleges. So Institute of Medical Sciences, IMS, BHU again, very famous. Then in Maharashtra, amongst the government colleges, we have Aurangabad. Then we have obviously Mumbai, GDC Mumbai. Then we have Nair, right? And we have Aurangabad, right? Then we have Nagpur as well. In fact, one of the toppers took Nagpur last year, GDC Nagpur, right, guys? GDC Jaipur, we have talked about. Then somewhere in the middle in Chhattisgarh, we have GDC Raipur. In Andhra Pradesh, that's a wonderful. Andhra Pradesh and Jammu and Kashmir are good additions now. Previously, we did not have these colleges open to us through the All India quota. Now, of course, you can, go to either GDC Jammu, GDC Srinagar, and then in Andhra Pradesh, we have GDC Hyderabad, we have GDC Vijayawada, and we have GDC Kadapa. So when I talk of Andhra Pradesh, guys, I have got, of course, Hyderabad is now a part of Telangana, but yeah. So if you talk of Andhra Pradesh and Telangana, guys, so we have GDC Hyderabad, right? Then we have GDC Vijayawada, and we have GDC Kadapa. All right. This is in the campus of Regional Institute of Medical Sciences, RIMS, right? So we have Government Dental College, Kadapa, in the campus of RIMS, right, guys? So these are basically the GDCs. Then obviously down south, Pondicherry in Tamil Nadu and related areas, you have GDC Chennai, one of the oldest dental colleges, and you have Mahatma Gandhi Dental College in Pondicherry. Now, please realize Mahatma Gandhi Dental College in Pondicherry is a government dental college. Indira Gandhi Dental College in Pondicherry is a private dental college, right? So please, when you're filling up your form, please understand this difference between the two colleges in Pondicherry, guys. So in talk of Puducherry, so there is a government college, guys, in Puducherry, which is Mahatma Gandhi, right? And then there is a private college in Pondicherry, which is Indira Gandhi Dental College. So please realize the difference. Don't mix up these two, right? Otherwise, you would end up getting a college which you did not want. Then in Karnataka, we have GDC Bangalore, right? Apart from n number of private colleges, the government college, the go-to government college in Karnataka is GDC Bangalore. So this was about the common or the sought after dental colleges. These are all government. And Guwahati, when we talk of Northeast, we have RDC, Regional Dental College Guwahati. It is a government college, right? So we've talked about the government colleges. Now the important thing is, guys, as I told you, the top notch, MAMC, PGI Rohtak, KGMC, BHU, GDC Mumbai, GDC Nagpur, Nayar. These are top 7 to 8. All right. GDC Amritsar, one of the oldest dental colleges, good college, good patient load, right? So you have GDC Punjab as well, GDC Amritsar or simply GDC Punjab, right? Which you have as a government college, right, guys? So that's the order which you follow. Let me talk about till what rank were people able to get government colleges, right? Normally, it's still 200, 250. I'm talking of cons and endo only, right? But somehow, last year in first counseling, you had a lucky person who in the general category got AMU, that is Aligarh Muslim University, at the rank of 394. Now, this guy is lucky, guys. At 394 in general category or in open category, you usually don't get cons and endo in a government college. This is not the norm. This is not necessary because, if you see the difference, if you see the previous seat that was allotted in the open category was 318 again, AMU. And before that, in the open category, you have 161. So immediately after 161 to 300 rank, you had people who did not want cons and endo, who wanted to become oral surgeons or prosthodontists. So that is not going to be the case. That is not going to be the case every year, guys. So please make in mind that, cons and endo, safe bet would be 200 in general category. Right, guys? When I talk of OBC, in OBC, we have a seat which was, all India rank 449, all right? So a 449 ranked person in OBC category got BHU, right? So again, you have to be a top 500 if you want to be sure of getting cons endo in a government college in India, in the OBC category. If I talk of SC, guys, then let me tell you, there is the standard data would be 761 till around 750, 800. You can expect to get a government seat in cons and endo in a government college. This was SCB Cuttack, right? The only government dental college in Odisha is SCB Cuttack, right? And fortunately for one person in BHU, for one SC category student, 2,734. That was the seat that someone got. So again, this is just extremely lucky because after 761, it was 2,734 guys. So, I mean, that is just pure luck because all the SC category people in between did not opt for this seat. They were opting for other seats, right? So that was sheer luck. So don't go by that. Don't make your expectations too high in SC category. Be optimistic for cons and endo up to 750 rank or up to 800 rank, right? Beyond that, it's going to be tough, right, guys? Then, if I talk about ST category, then there is a person in a range of, the rank was around 1700 or so, if I'm not mistaken, in ST category, who got a government seat in cons and endo, right, friends? So in ST category, we have up to 700, 1700, 1700 who got a government seat in cons and endo. All right. So if I talk about people with open category seat and people with disability, right? People with disability, then we have up to around data that we have is up to around 2000, 2500 or something like that, right? But again, that is totally luck. There are very few seats, and you don't know what is the rank of that candidate. If that candidate is all India top 50, 2 or 3 people in general category PWD, all the seats are going to be exhausted within the top 100 or 150. That is sheer luck, right? That is sheer luck. Rather, I would say, if not luck, then it basically depends on how many students who've appeared in that particular category have managed to get a good rank, right? So that is as far as this is concerned. Guys, then we talk about the private dental colleges. I've got a very interesting and kind of surprising, notable data in private dental colleges. Usually, when you talk of private dental colleges in our country, Manipal comes to mind, isn't it? Right in the top, right in the top. Well, that is not the case, guys. When people are selecting cons and endo, the first private dental college that was selected was at a rank as high as 756. All right. So we have a person who picked up the first seat in private dental colleges at a rank of 756, guys. This person, this is where the management seat started. This person took Sri Ramachandra Medical College, right? The dental department of Sri Ramachandra Medical College in Porur, Chennai. Now, please realize that these are 2 different colleges. One is, again, there is another Sri Ramachandra SRM college, but that is Ramapuram. That goes pretty low, till 3000. Sri Ramachandra Porur, Chennai, which is associated with a big medical college, is considered relatively better. You understand? Manipal is nowhere in the top 3000. Nobody picked up Manipal in the top 3000. Great infrastructure, but extremely high fees. 20 lakhs, up to 20 lakhs per year. Right? So you end up paying tuition fees of 30 lakhs for 3-year MDS, as compared to other private dental college, like in North, you have Manav Rachna Dental College, which is 10 lakhs per year. So many students, because of affordability issues, because of financial viability issues, despite their good rank, are not opting for Manipal. You understand? Second, there is a saying that is going around that there are less number of patients, especially in Manipal, Mangalore campus. That's a city, right? In Manipal, proper Manipal, again, less number of patients. And Manipal, Mangalore, which used to have more number of patients, now because of AB Shetty, Yene Poya, the number of patients are less, guys. So again, Manipal is going down in terms of seat allotment. I'm not talking of infrastructure. I'm no one to comment on the quality of education. It must be great. But I'm talking of the choice of seats. Right, guys? So you see here, again, the next private college seat that was picked up was again Porur, Chennai, 864 rank person. So, the top amongst the private colleges is Sri Ramachandra. Then you have in Odisha, there are a couple of colleges, Kalinga and IDS Bhubaneswar, Institute of Dental Studies Bhubaneswar, which are amongst the top private colleges now, right? Then you have Bharati Vidyapeeth, Pune. You have DY Patil, Pune. All right. Then you have Savita. Again, Savita, great college in terms of infrastructure, but again, the fees is pretty high. 16, 17, 18 lakhs per year, right? So people are taking up Savita at 2,000, 3,000, 3,500. So if you have a rank in the range of 3,000, 3,500, you will get Savita Chennai, right? Which is considered one of the top dental colleges of our country. So in a talk of private colleges, guys, I have Sri Ramachandra right at the top because of the choice of the student. Then you have AB Shetty again. You would get these colleges if you have a rank right in the top 2,500. right? You have Savita. Savita goes up to, because of its high fees, Savita goes up to, you will be, surprised and pleasantly surprised that if you have a rank of up to 4,000, you can get Savita, or 3,500, you can be optimistic of getting Savita. Um, um, Consendo. Then you have BVP Bharati Vidyapeeth Pune, right? DY Patil Pune, right? Then you have KLE Belgaum or Belagavi in Karnataka. That's also amongst the top. You would get this also up to 4,000. Then you have Rural Dental College Loni. That's right at the, I think, border of Maharashtra and Karnataka. That again, you can get till a rank of up to 5,000, right? Then amongst private colleges in down south, you have Yenepoya, which is again pretty popular. Then in Chennai, we have Sri Balaji and we have Meenakshi. Meenakshi Anmal Dental College in Chennai, right? So the top-notch private college in Chennai would be Sri Ramachandra according to the ranks that people have picked up. We have Sri Balaji, we have Meenakshi, we have Savita, of course. We have SRM Ramapuram. So don't confuse SRM Ramapuram with SRM Porur, right? SRM Porur is right at the top. SRM Ramapuram, again, people in the range of 3,500 to 5,000 are taking up. Now, as I told you, Kalinga and IDS. So in Odisha, the two private dental colleges which are very famous are Kalinga and IDS Bhubaneswar. You know why? Their stipend goes up to 50,000 per month. So the fees is also pretty okay, not up to 20 lakhs per year. So the fees is affordable. Stipend goes up to 50,000 per month, right? So very sought after colleges, both these two, right? But they're again exhausted because they're so popular, they're exhausted within 3,000, 3,500. Now I'll tell you very interesting data. You had, till a few years back, we had SDM Dharwad, which was considered a very important and very popular and very sought after private dental college. Nobody's taking this up. People are not taking up because of probably high fees and less number of patients. It is no longer as popular as it used to be. That's one. Second, Manipal, no longer as popular as it used to be. You know what? The first student who took up Manipal last year, what was his rank? 4,000, somewhere in the range of 4,700. And you would get Manipal up to 6,000, 7,000. You understand, guys? Right? So Manipal, again, as I said, great infrastructure, everything, but because of very high fees, those of you who cannot afford, if you have 20 lakhs per year, you end up paying what, 60 lakhs in 3 years versus 30 lakhs in a college, in a North India college like Manav Rachna. So you realize that a person who was ranked almost between 1,500 to 2,000 took up Manav Rachna Dental College. You know why? Low fees, 10 lakhs per year, obviously low as compared to other private colleges. And patients are pretty good. High number of patients, right? But then in between, nobody took up Manav Rachna, so you can expect to get Manav Rachna up to 5,000. Up to 5,000 rank. Right? And expect to get like Manipal starting at 4,700, expected to, you can get up to 6,000, 7,000 rank. Manipal, right? AB Shetty is amongst the popular ones. People prefer AB Shetty over Manipal. Right, guys? Someone asked me about Ranju Malika, Dr. Cutoff rank for each GDC. So this is going to vary every year. Just make up your list based on your preference. As I said, If you're from down south and you want to stay close to your house, GDC Chennai, GDC Kozhikode, GDC Trivandrum, GDC Kottayam, GDC Bangalore. This is the order that you usually follow, right? Or again, as I said, if you're from Kerala, you want to stay in Kerala, you can go for GDC Trivandrum first, then Kozhikode, Kottayam. If you're from Tamil Nadu, right? If you're from Andhra Pradesh, then GDC Hyderabad, Vijayawada, and Kadapa. You understand? As such, the cutoff rank or seat is obviously going to depend on which student is from which area, right? I mean, I was from Delhi, so my first preference was my own college, right? There might be certain issues with my college, and some other college like a GDC Trivandrum would be, say, much better in certain areas probably than my college, but I would never go there because I would like to stick around in Delhi only because that is where I would want to have my own clinic, right? I want to make my own contacts here. I want to get warmed up to the atmosphere here because ultimately my aim was to start my private practice, right? So just have a basic idea that what your priority is, right? You want to stay close to the place. Obviously, a great idea is if you want to start, if you're oriented towards private practice, guys, obviously you would want to, if you're getting a college in that particular city or near about, you would want to stay in that area, right? If you are hardcore academic oriented, then forget about everything else. Just go to a college where more number of research papers are being published, right? And you get to have a good atmosphere of library and studies, etc., and less number of patients. So all of that is going to depend on that, all right? Beta GDC Amritsar, GDC Shimla, both are pretty good. Both are equally good in terms of number of patients. In terms of infrastructure, both are kind of lacking. All right, Danish. So I would say again, in terms of which one is better, I would say both are more or less the same. So choose whichever is logistically convenient to you in terms of where you want to start your practice. If you're from Himachal Pradesh, you want to start your practice in Shimla, no point in going to Amritsar. If you're from Punjab area, stick around in Amritsar, right? All right. Okay. A couple of important points. Yeah, so I was talking about very important notable points. Dharwad, nobody's picking up. Manipal, no top 5,000 per person is picking this up. Okay, North India, yeah, private colleges. In North India for Cons Endo, guys. So you have Manav Rachna Dental College, right? Then you have Santosh. You will get Santosh Ghaziabad up to a rank of 8,500 to 9,000. That's what happened last time, right? Then you have Ambala, Mulana Ambala, right? Mulana Ambala is there again. You will get this up to 8,000 rank, all India rank. I'm talking of all India open category rank, whatever this thing falls in this, right? So guys, if I'm to summarize, one more important, very important question that sometimes students ask us is, sir, subject versus college. That totally depends on you. If you're passionate about the subject, go for the subject. Again, what if you're getting the subject of your choice in a private college versus you're getting a government college but not the subject of your choice? Then again, it basically depends on your relationship with your subject. If you are absolutely passionate about your subject, you see a great future, you imagine yourself working in your practice, just doing root canal treatments every day, I mean, go for endo. Money is not a constraint. You can, go for a good private college like a Savita, A.B. Shetty, Sri Ramachandra, and but before entering, there's also one thing off the record that I should tell you guys. This is a very general aspect that we are telling you, right? Every college, just like all of us, change, isn't it? All of us, I'm not the same person as I was 5 years back, right? Or 7 years back, more or less. I mean, in terms of moral values and scruples, in terms of, basic character remains the same, but still we do change. Similarly, the college's character changes, especially departments. Guys, you can have a great college in terms of brand value, but you might not be, but the local dynamics of that department might be changing in the sense that you have to see whether the faculty is student friendly or not. If you are a clinically oriented person and you end up in a college which is right at, I'm not naming any college, which is right there at the top, right there at the top, right? But presently, say for example, since the past 1 or 2 or 3 years, the college management or the department administration, the faculty is such that not student friendly, not helping you out in your clinical practice. If you don't have a good atmosphere around, then guys, you would end up having a hard time there. And you might end up having a very good time in a college. Very good time, I don't mean by having fun, but basically learning in a college which is not there right at the top. But you realize that at the present moment, when you are entering that college and looking at the 3 years timeline, you realize that you've got a great coterie, great group of seniors, great group of senior residents who are there to help you. Faculty, regular faculty, which is very helpful, which is very understanding, which is there not to ridicule you or insult you or just um, irritate you or take you for a ride, not adding value to your time, but actually there to help you out, right? So you're better off in that relatively inferior college in terms of brand value than that top-notch college. Now that is something which you have to ask your seniors, guys, right? Finally, when you're taking that decision, sometimes it happens, right? Because a college, a department, particular department which you are entering might have been great 5 years back, not good today. You understand? So, your immediate seniors, we're there to guide you all the way, right? All this information that I'm giving you is very, I've done a very, you can say, detailed understanding of the list of the previous year's counseling, right? And then I'm going to give you a summary and I'm giving you the filtrate of what I understand. But you also have to, at a local level, whatever your rank is, when you're expecting a given seat, when you're filling out that form, please, if you are aware that I'll get a seat in these 2 or 3 colleges, please, those shortlisted 2 or 3 colleges, please ask your seniors about the local environment in that department. How good is that environment for learning? Is it a happy department? Right? Because these are the 3 years that you're going to learn and you're going to apply that knowledge to earn your bread and butter for the rest of your life. Right? And right, guys? Noida is okay. Sharda Noida is okay. Right? What should be preference after Maharashtra for government? Beta, I understand that you're from Pratiksha Wadikar. I understand that you're from Maharashtra, right? So you can go for GDC Bangalore. You can go for Gujarat, GDC Ahmedabad, Jamnagar. In private, you can go for Shah Dental College in Vadodara, right? It, you can go in Andhra Pradesh. You can go for GDC Raipur. You can go in Andhra Pradesh, GDC Vijayawada, right? So you can look at beyond Maharashtra. You can look there. These days, we have got great connectivity with flights. So if you have a high rank, go for MAMC, go for PGI Rohtak, go for KGMC, go for BHU. They definitely carry some brand value, and that adds to your and that adds value to you as a professional when you start up your private practice, right, guys? And JSS Mangalore amongst, yes, Dinesh, Dr. Dinesh, JSS Mangalore, yes, amongst the good private colleges. People have taken it in the top 4,000, 3,000 rank. JSS Mangalore, yes. You have Sharad Pawar Dental College in Wardha. Conservative dentistry and endodontics is considered pretty okay there as well. So I'll add that. You have GSS Mangalore. Then we have Sharad Pawar Dental College in Wardha. right? The pretty good colleges, right, guys? So we wish you all the very best. Okay, and one more thing, you guys will have some nitty-gritty doubts which will be coming, back and forth in your head, isn't it? So for that, what we can do, guys, is that we have a free this thing Telegram group on the Telegram app, DBMCI MDS Premier Group. You feel free to post your doubts here. You can tag the faculty. I'm Dr. Aishwarya Kaushik in Endo and Cons. So you can tag me there, and um, um, clinic a beta in oral surgery. See, this is a very Rahul. When you talk of oral surgery, when you talk of this is a very personal question in this sense. I'll tell you what. Many of us immediately after BDS have the confidence, have the optimism that, okay, we've learned how to make dentures, we've learned how to extract our teeth during our internship. For instance, I have done my BDS also from Delhi, Maulana Azad Medical College. I did almost what? During my 2 months internship of oral surgery, we used to extract almost 8 to 10 teeth every day, right? So I almost ended up doing extractions for what? About if you see 25, 50, 10, around 400 to 500 extractions um, after during my internship only. You understand? I did about 10 to 12 IMFs, intermaxillary maxillomandibular fixations in trauma cases. So there were many students in our college who would have the confidence. We felt that we can start up our practice, we can do general dentistry at least. And then many students, so it all depends, if you've done your oral surgery, 3 years of oral surgery, and many of us feel that, oh, I'm fine, I can do my root canals, I can do my crown preps myself, I'll start my own practice. So it's a very personal thing. Many of us feel that I need to gain more competence, more fineness, more development of my fine motor skills before I actually start my clinic, right? So we end up taking up different kinds of appointments like senior residency and et cetera, take up consultations, visit other clinics, and keep on working on our skills. So that's a very personal kind of a thing. Of course, you can open your clinic, isn't it? As far as endo is concerned, many of us, I'll tell you, there was a junior, Dr. Malvika. She was a wonderful, she was All India rank 1 from Chennai. She went to our college. She was my junior in MAMC, and you won't believe she was so confident and so optimistic. She was like, when I used to ask, I was doing senior residency. I used to ask Malvika, would you appear for your senior residency exams? She used to say, why, sir? I'll start my own clinic. Why should I waste my time in senior residency? So of course, if you're doing MDS from a good college, if you're doing endo from a good college, you end up doing what, thousands of root canal in those 3 years, and you're a hardcore clinically oriented person, start your own practice. And the future of dentistry, I mean, yes, implants is the up and coming thing, but in private practice, believe me, if a tooth can be saved, even if it's grade 2 mobile, grossly carious, patient will always say, doctor, if you think it can be saved, please save it, right? So endo is there to stay. Endodontics is there to stay. You have your, and there's so much more coming in endodontics. I think 5 to 10 years down the line, doing root canal treatments under magnification, preferably under the operating microscope and not just loops, is going to become the norm. It is going to become the norm. 10 years down the line, people will say that, getting root canal treatment done without magnification is below the standard of care. Right, guys? So there's a lot of it's a very interesting branch. It's a whole entire world which is there to be explored. Good, more than decent paying specialty, good volume of patients, good job satisfaction that you have. You get to do your work independently, give your own local anesthesia, manage the patient, make your own treatment plan. Wonderful. As far as government jobs are concerned, yes, if you are interested in a faculty job, you can go for a faculty job, right? You can apply for a faculty post. You get the advantage of being in a teaching environment as well as working. Nobody stops you, right? Even when you're in a faculty position, nobody stops you from doing patients. So you can keep working, fine-tuning your skills, keep working on your skills, right, on your knowledge simultaneously. So if you don't have the money to start up your own practice, no money for real estate, no money for equipment, you can work as a consultant, right? Yes, it's slightly more tiring. It's not that paying, but you will ultimately end up earning pretty okay, right? Right, guys? So for further doubts, you can always post them in our Telegram group. And I'm happy to invite Dr. Divya for your continuation of this mega counseling session. I wish you all the very best for your future, guys. Of course, being an endodontist, I would love maximum students out of you, out of this pool of students who's listening to us to take up endo, right? It's a wonderful branch, and wish you all the very best, guys. Right? Thank you.
Second. Second. Hello, everyone. I'm Dr. Divya Gupta, the Periodontics faculty at DBMCI. A very good afternoon to all of you and welcome to the mega counseling session. So basically today what I'm going to discuss is to orient you to the subject. The periodontics means what all things you can do when you enter the periodontics department. What is the scope of periodontics in India? After you have completed your MDS, what all things you can do? I will be sharing my experience in short, and then in short, we will be discussing few good colleges, both the government dental colleges and the private dental colleges in this session. Okay. So basically, most of us, our dream branch is either endo, oral surgery, prostho, right? So similar was with me. I had a passion for endo. But when I got All India rank 222 and my state rank was 11th. And I was through state rank, I was getting GDCH oral surgery as well as periodontology. Okay. So at that time, I was confused whether I should go for oral surgery because in our college, there were some issues in oral surgery department. So I was a little bit confused. Kya lu? Oral surgery lu, periodontics lu. And during our undergraduation in perio, we have seen just scaling and we think if perio PGs to sirf scaling karte and they do nothing else apart from that. So that's why I was a little bit confused, but still there was a voice inside me that said ki nahi yaar, perio le lete and let us see, dekha jayega jo hoga. At that time, we did not have the guidance which you all have nowadays. Means we were just talking to a few of our seniors who used to guide us, okay, and the common trends that were going. I never had means this type of guidance which you all are getting nowadays, right? So I went to the counseling, I took perio, and when I entered the department, On day one, I was a little bit nervous कि पता नहीं क्या सीखेंगे, what I'll do and everything. But my seniors were super supportive. And I will tell you that throughout those 3 years, I learned that perio is a hidden gem. I don't know, because of lack of awareness amongst the general practitioners, periodontics as a subject is not given that much importance. I felt that, and I thought, okay, whenever I'll get I'll complete my MDS, I'll make my friends in other departments aware कि what all things I can do. Even during MDS, what all things I can do, I made them aware. All my friends were from Endo, my good friends were from Prostho, Endo, and Ortho. All three departments I had many friends in those departments. So we used to practice a lot of interdepartmental, dentistry. We will be talking about that. So basically what happened is, I started practicing, and my colleagues, and I had 4 other colleagues. So we were total 5 students in first year, and we were very enthusiastic about everything. So what I used to do is, we used to see our seniors doing all the flap surgeries, mucogingival surgeries, and we decided कि यार चलो करते हैं. It is very interesting. Something, I always wanted to be a surgeon, but I didn't take oral surgery. And my mind was also like, okay, other than oral surgery, there is no other department where I can do a surgery. But after coming to perio, I realized कि यार periodontics में इतनी सारी surgeries है. There are so many surgeries in periodontics. And yes, I felt कि yes, I'm also a good surgeon. And in the first year, I decided that I'll be a very good surgeon. And whenever I'm getting out of here, I'll be one of the best periodontists in my state or wherever I'm practicing. So what happened is, just after seeing things and after doing things, you learn okay, what all things are there in periodontics, right? So with that, I would like to say, what does a periodontal surgeon do? Okay. All those of you who are going to take perio, by seeing this slide, you will have an idea that what all things you can do, with what mindset you have to enter the department on day one, how you have to choose your research topic. Okay, in PG, you have to look for your dissertation, you have to do your library thesis, LTs, you have to publish papers, all those things. So after this slide, I hope you will have a brief, some idea about what you want to do as a periodontist during those 3 years and after those 3 years. Okay. So just remember that perio is not only about scaling. All those who have attended my live lectures, I make it a point to show all my cases to all my students. Okay. So in periodontics, the first and the most budding thing, the most recent thing in periodontics is the laser. So before 15 to 20 years, very few clinics were practicing implants, right? Not a large number of clinics were practicing implants. So, but now, after 15 to 20 years, nowadays, we see that every clinic in India ranks dental clinic and implant center. All of us are implantologists, right? Similarly, the future of India is about lasers. After 10 to 15 years, dental clinics will start writing dental clinics, implant and laser center. Okay, keep that in mind. So whenever you are entering any department, whether you are getting a government college, if you are selecting a private college, select a private college and find out where you can get a laser in your department. Okay, soft tissue lasers also, if you have, you can do wonders with them. Okay. So not necessarily hard tissue lasers should be there, but soft tissue lasers, you will always have an upper hand in, in dentistry, because we as a periodontist can work very finely. We are very good in handling soft tissues. Okay. So try to, whenever you are entering the department, keep that in mind that you have to learn lasers. You have, because those 3 years are very crucial. You can, if there is no laser in your department, you can talk to your staff, you can talk amongst your colleagues, and you can rent it out. Lasers are available on rent. In our college, at that time, there was not that much awareness about lasers, right? So we one of my junior did a dissertation on lasers. So what we used to do is, whenever she got that laser in the department for a day, we used to get it, and we used to keep at least 1 or 2 patients, so that half of quadrants we used to practice. This is how we started with lasers. But to be frank, I was not that much familiar to lasers during my post-graduation. But I want all of my students, that when you enter the periodontics department, you have a benefit. If you are having laser in your department, it is very good. If you don't have lasers, just rent it out. I think maximum they'll take 1 to 2,000, 3,000 rupees, and they will rent it for a day. And you can practice lasers on them, on your patients. Okay. So keep this in mind, that the future of India will be lasers in 10 to 15 years. Okay. So with that orientation, enter the department. You have to practice laser. I practiced it after my post-graduation. I have my own laser in my clinic since last 1 year. And soft tissue lasers are not that costly, guys. It will come between 3 to 4 lakhs. So start practicing, build up your laser dentistry as a periodontist. It is very important and has a very, very good scope. Patients really like it because you don't need any surgeries or very complicated surgeries. It is bloodless, painless, and you don't need sutures, and the healing is very, very, very good. Okay. Next comes the periodontal surgeries. In periodontal surgeries, you have flap surgeries. Okay, in periodontal surgeries, you have flap surgeries. Different type of flap surgeries you will start doing in your end of the first year or your second year, from second year. So flap surgery is basically what you will learn to handle the delicate tissues with scalpel and blade. You will be more precise by doing as many flap surgeries as possible. You will have a good control over your blade. You will be very good in raising flap. Bloodless fields you will have, because since last means you will be practicing flap surgeries day in, day out, right? And flap surgeries are very, very important, because whenever you are going out and practicing your implants, your flap, if it is least traumatic, the chances of infection, the chances of failure of implant decreases. Okay. So that is why you have to be a very good very good surgeon to elevate a flap. That you will be doing very nicely as a periodontist. You will learn recession coverage. Okay. You will learn different techniques of recession coverage. There are so many different techniques with the use of different materials. You will be learning about bone grafts, the GTR membrane, and the PRFs, how to deal with the PRF, a very good innovative material to use nowadays. And people are using it day in, day out in their clinics also, because PRF can be made very easily with a centrifuge machine. The centrifuge machine costs about 8,000 to 10,000, and all the colleges, all the patho departments and all the colleges will be having this centrifuge machine. Okay, so you can practice with PRF, you can practice with bone grafts, you will learn many things about GTR. Then implants, so many people are doing many specialities, and not even I'll tell you the specialities. There are many good implantologists out there practicing who are not even specialized. But as a periodontist, what speciality you will have apart from other implantologists? So not all the cases that will come to your clinics or your department will be simply you have to put up an implant and close it off, right? No, there will be cases where you will not have sufficient bone, there will be cases of thin ridge, there will be cases where maxillary sinus needs to be lifted. So you can, means I'm listing out the points which you can learn when you are going to your departments in those 3 years, guys. Okay, so keep these points in your mind, and whenever you are talking to anyone, any of your seniors about a college, ask whether the faculty is that much supportive that they will allow you to do all these things. Lasers nahi hai department mein, don't worry, you will get it on rent. Find out a place and you will get it on rent. Okay, so in implants, the specialities, means the special things which we can do is, so here you can do mucogingival surgeries also. Okay, and smile designing. Smile designing is a very good forte for us as a periodontist, because we will be dealing with soft tissues. All the smile designing procedures will be nicely done by us. Now, the third point is what special we can do in implants. Okay, so basically for implants, in implants, what you can do is ridge augmentation. Ridge augmentation you will learn, right? Horizontal as well as vertical ridge augmentation can be learned very nicely in periodontics. Maxillary sinus lift, direct and indirect, you can learn nicely. Okay, all these augmentation, grafting, wherever grafting is required, people most of the times call a periodontist for graft procedures, right? Graft and membranes. We can deal with these materials very nicely, guys. So these are few important things which are a must for you all to learn in periodontics. Now, the fourth and the most important point is interdepartmental relationship. You are, whether you are an endodontist, prosthodontist, oral surgeon, anything, interdepartmental relationship is very, you must have friends in other departments, because when you have friends in other departments, you can tell them, whenever you will read, you can tell them that in perio, we can do this procedure. So if you are having any case pertaining to this, means any special case, we can collaborate and we can do it. We used to do, I am from GDCH Ahmedabad, and we used to practice in this way. I used to tell my friends कि यार ऐसा कोई case आए तो just let me know and हम मिलके करेंगे. Okay, this way you can learn things from other department. You have to have a healthy relationship with your friends of other departments, and you should be open to the ideas. So there is endoperio. Endoperio is like a very, very common thing in clinical. Whenever you are going out of your MDS and you are starting you are starting your clinical practice, you will find many cases of endoperio, in which you will treat only the endo part and the perio part will be left if you are not a periodontist. Okay, I'll just show you a case. Most of the people will just leave the will try to extract this tooth, right? They'll think yaar isko extract kar dete, iska pura yahan pe to there is just bone loss and there is nothing, so we have to extract it. But if you are a periodontist, think in the direction ke extraction is the last resort. Your aim should be, as a periodontist, your main aim should be save the tooth. And I'm telling you, there are cases which we have done that by doing a good periodontal treatment, you can save even a grade 2 or more than grade 2 mobile teeth, even grade 3, by splinting and doing root canals and a good curettage of the tooth. You can save the tooth. Okay, so you have to think what I can contribute to saving a natural tooth. Saving the natural tooth is our duty. Replacement is always an option. Just remember, replacement is always an option. There is nothing as good as what God has given us. Okay, so you have to think in that direction, that what I can contribute to learn and save this tooth. So endoperio mein there are different things such as bicuspidization, a fractured root, a vertical fracture root. If it is coming to you, you can save the tooth. Vertical fracture, most of the dentists will extract and place an implant, but you can save a vertical root fracture. So there are many things which you can do in endoperio. In orthoperio, you can learn lip repositioning. There is lip repositioning surgeries you can done. We used to do it in our time, college times. Corticostomy is a rapid accelerated phenomena where you can put cuts on the cortex of the bone, put holes and grafting, and then you can increase the tooth movement. So this is how we practice interdepartmental in our college. Okay. Prostoperio. Patients with dentinogenesis imperfecta, amylogenesis imperfecta, they need full mouth crown lengthening. So crown lengthening just by gingivectomy will not help. You need to do, flap, apically repositioned flap. You need to do ostectomy. For that, we need periodontists. So this much awareness you should have about the subject before you are entering the department, guys. Okay, so try to be friends, try to make friends with other department people and good friends. Only good friends will help you. Okay. So this is how you can practice your perio, keeping these things in mind. Read, learn, and practice. Okay. Now, next are the career options after MDS. Career options. So I'll just look at the questions. Danish Kapoor, ma'am, which colleges in India, government colleges, have laser in the department? So basically, in government colleges, I think Ahmedabad GDCH Ahmedabad is having, and KGMU, King George Medical College, Lucknow will be having. These two colleges I know, Danish, but other colleges for lasers, I'm not sure. In private colleges, Savita Dental College is having. In our Vadodara, we have Manubhai Patel Dental College, which is having this laser. But government colleges, if the department is not having the laser, I would suggest you can rent it out. Always there is an option to rent and learn. Because if you are a government student, government college student, you will get a stipend and a good stipend. And with that stipend, if you are giving at least 1,000 or 2,000 per month for the lasers, it is very, you can, what you can do is, if you are 5 students in a department, divide the amount, call all your laser patients on one day. One patient, each student can call one patient and you can learn from each other. This is how we used to practice. You can also do the same. Okay. Now the career options after MDS in periodontics. The first thing which you can do is you can open your own private practice. Right? Private practice, it's not like as a periodontist, you cannot earn. In government colleges, guys, you will get n amount of patients. And when you are working on a patient, try to do whatever is there. Even if you want to do root canals, you can learn root canals from your colleagues and do in endoperio cases. You can tell him, कि यार मुझे इसमें root canal करने दे, and I'll learn and I'll teach you this. This is how in colleges you have to work. You have to take help of each other and work. So in private practice, you can, endoperio case is coming, root canal you will do, and you have the added advantage of doing a periodontal surgery. This, now many patients, many of my colleagues who are not aware about the importance of periodontics, I tell them, yaar, agar hum आधा अधूरा treatment करके छोड़ देंगे, if we'll only treat the endo part and if we'll not treat the perio part, what will happen? There will be relapse. The periapical abscess it will develop, and we have to do re-RCT. That is not the options always, right? That is not the option. Always think in the direction of long-term benefits for the patient and give that much treatment, that much importance to your subject. When I came out and I started practicing in my clinics, genuinely speaking, I did all my root canals. I knew how to do root canals. We practiced in our colleges. So when a patient came to me, and whenever I see कि हाँ इसमें periodontal treatment is also required, I tell them, okay, this will be your failure in future if we are not treating the perio part. And guys, out of 10 patients, 8 patients agree for the periodontal treatment if they are explained nicely the future consequences if the periodontium, if the base that is supporting the tooth is not strong. 8 out of 10 patients will agree for the treatment. Cost is not a factor for the patient. And how much you can charge. if you are raising a localized flap, add extra 2,000, 3,000. If you're doing it with laser, add 3,000, 4,000 rupees to the laser for a localized flap, right? You will not charge that more than that. So this is how you can practice in your private practices. Next, you always have in private practices, there is option of empanelment. You can, wherever you are practicing, you can, if there are big companies, big corporates are there, you can go there and give an application for empanelment. Most of the corporates nowadays look for empaneled hospitals or empaneled clinics. So that is a good way to practice, where you can attach yourselves with different companies and corporates, and you can give them some, you have to just give them few benefits. Okay, just to take, I'll give 10% discount to all the patients who are coming from your company, and they will send you the patients. Okay. Next is the academics, that how you can practice the academics. Academic, both private and government colleges are there, where you can go and, you can practice, you can teach the students. Teaching was, I told you that I always liked spreading awareness about perio, because I know that in India, there is, means much lack of knowledge about the subject, particularly periodontics. And as I'm learning and, I'm practicing daily, I tell you that I get 80% of my patients in my clinic who have periodontal problems, and 50% of them have severe periodontitis. In future, I tell them that if you're not going to save this tooth now, you need to get extracted it later in 4 to 5 years and get it replaced by an implant or FPD. And most of the patients agree, they want to save their natural tooth. The trend of India is shifting towards saving the tooth. All of us want to save a tooth, right? Tooth is also part of a body. It is like a hand. It is like an eye. If there is one problem, some problem in one eye, you just remove it and give it away? No, na. Similarly, teeth is there. Don't think about extracting the tooth. Extraction is the last option. Don't think. Think about, shift your mentality towards how you can save that particular tooth. Okay. Next is in government sector. Definitely, you have a lot of opportunities in government sector. I have worked in UP government in CHC for 3 years. I was there, and it depends. I left my job because I found it difficult to stay there, and I was thinking, okay, I'm not using my skills to the benefit of the society, so I left my government job. But yes, definitely, government jobs give you a fixed income every month. There is, you will get patients, and you can work for the community, oral hygiene of the community if you want. So if you are at a CHC, means community health centers, there are PSC seats, state PSC and UPSC, central PSC seats are there. So accordingly, every year, I think right now Rajasthan PSC is there. So accordingly, you can check the paper, keep checking the mails and papers. PSC seats come every year or 2 years. You can give them, you can get yourself attached to a government hospital. They are a permanent position, and they give you a fixed salary every month. So basically, you don't have to, take tension of, yeah, mujhe iska bill pay karna hai, I have to run my practice, I have to earn this much. There is no such thing. And plus, if you are interested, you can educate the people, the local people there. You can run certain oral health campaigns in your sector. This is how you can, work in a government sector. Both PSC's exams are coming. Means there are exams every year of certain states, and they have certain criteria. Fourth is the corporate sector. So basically, corporate sector is the big corporate dental chains are there nowadays, specifically in metro cities and tier 2 cities. I'm not talking about tier 3 cities, but in metro cities, there are a lot of corporate chains. And in the initial few years, after you are coming out of your MDS, you can go there in a corporate dental chain and you can work there. Okay, you can go and work in a corporate chain, and you can learn many things. Basically, these corporate chains develop your personality, your soft skills, your communication skills with the patients. So they give you a lot. So you can, in the initial few years, before you want to open your own clinic, you can go and join a corporate chain. And to MDS people, they are giving good salary also. Means their starting salary is 50 to 60,000 per month. Okay, so you will get good salary also when you are going out there. Starting salary means when you are joining as an MDS, this is the salary they are giving. Most of the corporate dental chains I'm talking about. Okay, now also you can do a PhD after your MDS in your subject. You can go for clinical research. Scientists are there in periodontics. A lot of research is going on right now on nanotechnology, biotechnology. A lot of research is developing. In nanotechnology, they are trying to develop LDD, local drug delivery molecules are developing. The various drugs for host modulation they are developing. So this is the research. And specifically for research, I'll not say there is that much scope in India, but abroad there is a lot of scope, a lot of scope. So for abroad, if you are thinking for research, you can definitely plan to go to out of India and give exams specifically for those regions, those countries, and practice accordingly. After MDS, I'm talking about. Okay, so these are the career options which you have after MDS. Next is advantages of being a periodontal surgeon. What are the advantages? So basically, in periodontics, you will get all kind of patients. Okay, the major drawback, I think, is the awareness amongst the patient. But whenever you are getting, if you are practicing in a government college, guys, and if a patient is coming to you, okay, try to see apart from perio what you can do for this patient. Okay, and then how you can link a perio and a other departmental things you can link. And this is how you can interact with diverse patients and do diverse things in the same patient. Learn doing new things, new concepts in your practice. Okay. Second thing is your contribution towards the society. I feel that the thing which is lacking amongst the dentists, not I'm talking about the periodontists, but the dentists as a whole, is the knowledge of how they can maintain the oral hygiene, right? Most of the periodontal treatments fail if the patient is not adequately motivated. Okay, so your main goal should be to motivate a patient, to motivate the patient about the oral hygiene, to motivate how you can, means if a patient is coming to you and you are talking with the patient, you know what are the disadvantages of not having, getting a clean teeth, not getting scaling done every year after surgery. You know the disadvantages. Explain that to the patient. You know it in detail. Explain each and everything to the patient and tell them if you're not coming regularly for follow-ups. That is what is important in perio. Follow-ups is very important. And on follow-up, you can check that what is the disadvantages. Means on follow-up, you can check this patient is not maintaining the hygiene and you have to motivate the patient. Okay. So this extra knowledge of motivating the patient, you can gain from the department, periodontics department. Next is, this is what I told you, that you can practice your general dentistry along with your specialty. Periodontics is a thing that no other general dentist can practice. So you can practice your specialty along with the general dentistry when you're coming out of your MDS, right? And this is what I told you, that 90% patients have periodontal problems, but they go unnoticed because of lack of awareness. And this awareness, I feel that as periodontists, you have to create amongst your peers, okay? And 50% will have severe periodontal issues. Tell them that we are the doctors who can save the tooth, right? This extra treatment, this extra periodontal treatment will generate extra revenue, and you will have a great work satisfaction after treating the patient, that yes, I have treated my patient nicely and the teeth can survive for longer periods. The patient does not require any replacement with implants or anything. Okay, this is the contribution towards our society. The cons of a periodontal surgeon is, the major con is lack of knowledge amongst the general dentists. So because of that lack of knowledge, there is less consultations outside. In tier 1 cities, you will get good consultations, but in tier 2, tier 3 cities, there are very less consultations because people don't know that they can treat periodontics. But any periodontal treatment needs a good follow-up, good patient motivation, and good oral hygiene. That is what any periodontal treatment will fail if the patient is not maintaining a good oral hygiene. That is the reason where we as a periodontist, where we as a general dentist fail to make our patients aware, fail to motivate our patients. Okay. Now, at what rank, finally, at what rank will you get MDS periodontics? So, I did a research of the last year's rank list, and according to that, in unreserved categories, means in open category, you will up to the 300, you will get, I am talking about the government colleges right now and not the private dental colleges. Up to the rank of 300, you will get a seat of a government college in periodontics. Okay. Next, in OBC category, up to the rank of 500, you will get a government seat in perio. Last year, rank number 93, rank 93 was the first student to opt for perio in KGMU. Okay. After that, till 300 students took perio in government colleges. Next, in SC and ST category, up till the rank of 2000, you will get a perio seat in a government college. Okay, guys. Now, here is the list of top government colleges for periodontics. The first and the most means KGMU Lucknow is a very good college to do your MDS in periodontics. Then R. Ahmed Dental College, Kolkata. This is the second best college for perio. After that, you have PGI Rohtak, Nair Dental College, Maids is there. In Maids, only 2 seats are there, and last year both the seats were in category and no open seats were there. AMU is there, BHU is there, SCB Cuttack, and many other GDCs. All the GDCs are good and nearly equal to each other. GDC Jaipur and Vijayawada are better than other GDCs in terms of faculty and the practice. Perio rank for, okay, I'll just take a question. Ma'am, which colleges in India have lasers in the department? That I have answered, Danish. Are there any options in abroad? Yes, I told you. Vishal, I told you what are the options for periodontists in, abroad. Research is a very good field where you can go and practice, and even definitely periodontists, they earn good in abroad. Nowadays, most of the implants, means I have friends in abroad and they say nowadays most of the implants are done by periodontists in Canada and USA. Okay, so that is a very good thing. And can anyone tell in which state registration? Ma'am, registration. Can anyone tell what is the state registration fee? Okay, this question we'll answer in the group. Now, next is research after MDS or even after BDS is good. Yes, research after BDS is good, Amish. But in perio, if you want to specifically do any research in perio, specifically in lasers, nanotechnology, then definitely you have to do MDS. There are some extra points pertaining to the MDS if you are planning to go abroad. Okay. Perio rank for deemed colleges. Perio rank last year they started after means DY Patil was the first college which was taken, and it started, I think 800 something. People took the starting, I'm telling you, and it can go up till 14,000-15,000 for deemed universities. Okay. So these are the top government colleges, guys. Next is the top private colleges. In top private colleges, last year, the first college that was taken was DY Patil, Mumbai. Okay. And DY Patil, Pune is also a good college. Then the other colleges, private colleges are AB Shetty Dental College, Savita Dental College, SDM Dharwad is there, Manipal College is there, KLE, and Bapuji, Yenipoya, KIMS. All these are good private colleges. Okay. So before you just, I'll just suggest, this is the list which we saw last year's list and made the list of the top private colleges. But before you are entering any college, planning to enter any private college, just check the list. Most of the colleges have their fees between 8 to 10 lakhs per year. Okay, there are semi-government colleges like in Gujarat, we have AMC, Ahmedabad Municipal Corporation. Their fees is comparatively less. In our times, it was 3 to 4 lakhs, but I think now it has increased to 6 lakhs per year. So that you have to check, but they get stipend equal to ours. So if the stipend of GDCH Ahmedabad right now is 50 to 60,000, then person doing their post-graduation from a semi-government college will have that much stipend. Okay, so you have to see whether you want to go for a private university, private college, or a semi-government college. If you are getting, it is better than the private college always. Now, so with this, I'll just take the questions. Till what rank for general category government college for perio is possible? I told you till 300. Up till 300, last year, I think last rank was 293, which went. So accordingly, you can see, Ritika, where you will get perio. Up till 300 rank, there is a possibility that you can get a perio seat. HOD, okay, Dr. R, HOD of other departments will allow to do work. Yes, I see. You don't have to, talk to the HOD. You have to make friends in that department, and then ultimately HOD will not keep an eye on each and every student. You have to be friends with that person, and you don't have to go and work in that department. You have to get patience. You have to tell your friends that we will, collaborate and do these patients, endoperio, orthoperio, prostoperio. So you have to collaborate and do. And you can tell your friends, if you are planning for doing an RCT, you can, and if your friend is very good, and you have N number of, means in our colleges, in the college from where I did my post-graduation GDCH Ahmedabad, there were many patients. There was a waiting list of 6 to 7 months for RCT. So for that, if you have that much patient load, definitely the people will, your friends will help you out and give it to you. They'll tell you, yeah, to perio be treat kar le, endo be treat kar le, no issues. So if you have that passion, you can learn definitely. For learning anything in dentistry, you need passion for dentistry. Till what rank? Okay. This I have answered, Ritika. Mrunal, which are semi-government colleges in MP? Beta, that Mrunal in MP, I don't know, but definitely I can find out, and you all can connect with us on our, I'll just tell you where you can connect, and I'll find it out. Till what rank for OBC private colleges for perio is possible in Kerala? In Kerala, you will get up till private colleges, beta, you will get 10,000. If your rank is between 8 to 10,000, you will get private colleges. So basically, you have to do your, what all rank means. If you got supposedly 1,000 or 1,100 rank, and if you're planning to take a private college, you have to try to take a college where you can learn things, colleges which have a good patient load, and the colleges where the faculty is student friendly. You have to choose such colleges because faculty's role is very important. If there are internal politics in the faculties, amongst the faculties, and if they are, they don't allow you to work on students, and till 1 year, first year, you are just doing scaling, then it is very difficult to learn. So choose a faculty. If you are paying them, then learn from the best. I'm telling you that. Okay. So to end this session with a note to all the budding dentists out there, remember to first change your mindset. So all of you who are going inside the Department of Periodontics and entering, the department on the first day, change your mindset that perio is nothing. No, guys, perio is very important, and you have to it is the base of everything. Whole of your tooth structure is supported by the periodontium. So it is important. Just, you have to see that aspect of perio. Read Karanza, read books, read as many articles as possible, and try to change your mindset. Basically, then change your colleagues' mindset. Make friends in other departments. Make the general dentists aware, general practitioners aware of what all things you do. make a full documentation of all the cases you are doing while you are practicing in your department. Those 3 years are very crucial, very important. So try documenting each and everything that you are doing. And that documentation will help you grow as a periodontist, okay? That documentation will help you motivate the patient. That documentation will help your colleagues, your, other general dentists to, they'll learn that, okay, this can be done. And this will also have, means the general dentist will learn and they will also know, okay, this will help me generate extra revenue for my clinic. So they will also be interested. And then together, we as dentists can change the mindset of a society. So just with this message, I will tell go with a positive mindset to the Department of Periodontics and learn new things. Okay. Thank you and all the best to all of you guys. Be ready to be proud, passionate periodontists. So thank you so much. And guys, if you have any query pertaining to the colleges or anything, you can post your queries on, you can post your queries here. You can join our DBMCI MDS Premier group on Telegram, and you can tag me, tag any faculty there pertaining to the, means whichever doubt you have pertaining to that particular subject, and we'll help you out. So thank you so much and all the best. Now, okay, just one doubt I'll take, which till what rank for OBC category private is, okay, this I have answered. So guys, now I'll hand over the session to Dr. Ruchi, who is our Prosthodontics faculty, and she'll be joining you all soon. Anil bhai.
स्क्रीन शेयर नहीं नॉर्मल Am I audible now to all of you? Okay, I think there was some glitch. I was not audible. So sorry for that. Technical glitches do happen here and there. But I hope I'm audible to all of you right now. Can you all give me a thumbs up? I'm waiting for all of you students to join. And yes, Pooja, Sammy, Biswadeep, I'm extremely sorry that I was not audible to all of you. And I'll repeat what I just said. But if I'm audible right now, just give me a thumbs up, say yes, hello, good afternoon for all of our students. I see about 55. How many students have joined in? 55 students have joined in. Good afternoon, all of you. So firstly, congratulations to all of you. I know for sure you are good, excellent rankers. You have ranked something you have in your hand, and that is why you're watching this NEET counseling session. So first and foremost, a big congratulations to all of you. Some of you may be extremely happy with your ranks. Some of you may not be. Some of you may be confused what to do. We are here to solve all of those doubts. And like I was just saying before I was muted, that I'll be actually looking at your queries also simultaneously. So just like how I was saying before, that I was actually listening to all of these sessions by different mentors, Dr. Himani, Dr. Aishwarya, Dr. Divya. And the bottom line of all of that, which I could figure out, was that a student is trying to understand, I am a BDS student, and tell me something which would work out for me. If I tell you in simpler terms, एक बच्चा ये जानने की कोशिश कर रहा है कि मुझे कोई श्योर शॉर्ट सोल्यूशन दे दो और a sure short branch, or give me a sure short college which would not fail. Do you think that is actually possible, that someone can give you that guarantee? No. Dr. Aishwarya said a very good thing, that after all, do your research, but go with your gut. I'll 100% agree to that. Do your research, listen to everything, but at the end of the day, you have to go with your gut feeling. Things can change over the course of your post-graduation in the same institute also, and that is how your career can go different, right? So for all of you who are seeing me for the first time on this platform, hi, I'm Dr. Ruchi Raj. I'm MDS in Prosthodontics from AIMS New Delhi, and I'm your original guru for Prosthodontics. My role here is to orient you towards the subject of prostho. I have been exclusively doing prostho since almost a decade now, and I'm here today not as a mentor or as a teacher, but as a friendly senior to you, to tell you what lies in the future of prostho after learning it And after practicing for nearly almost 8-9 years, considering my post-graduation also, I joined my PG in the year 2015. And since then, mostly, I think 90% of my practice has been prostho only. So as a friendly senior, I'm sitting here for you for those questions pertaining to my branch. I see a lot of your questions that are directed to say, if I'm this particular rank, what is the best option for a college, private college, or what is the best option? Like, for example, a student had asked, what is the rank at which in Kerala, say, a private college would be available for this branch or not? It is as good as asking that if I want this item, what could be the cost of it? If you buy it from a very high-end shop, it could be different. If you buy it from an ordinary shop, it could be different. Likewise, if you go through it, trends do change, especially in private colleges. So let us try and understand all of them. The basis of this presentation, or the agenda of this presentation in front of you, primarily is to orient you to my subject, prostho. If you are sitting on the bench thinking whether I should take prostho or not and what lies in future for you, listen to these 15, 20, 30 minutes and probably it will give you a clearer idea whether this subject is made for you or not. I'm a very firm believer that a lot of different parameters come into play when you're selecting a branch. Of course, you should be passionate about that particular subject. Reason being, when I introduced myself, my first name, after that, the next line that is I'm a prosthodontist. So that becomes your identity for your entire life. It is not a small thing to carry on. So especially if you're not passionate with something, or that is something that is not your true nature, you would not be able to live on with it for a very long period of time happily. Secondly, there are, like how Dr. Himani discussed, a lot of different parameters that can help you decide what you want to go ahead with or not. I can for sure discuss that again with you, but let us first begin what prostho is and what a prosthodontist would do. Now, generally, a lot of people have this misconception that a prosthodontist is mainly for dentures and for crown and bridge. To be very honest, when I was an intern more than 10 years back, even that was my idea. My idea was that prostho is for dentures and crown and bridge only until I joined AIMS, and it opened my eyes to a plethora of opportunities. So that is how I would want to orient you today, that a prosthodontist, apart from crown and bridge, will do a lot of these procedures and much more than these. I have not even mentioned, I can think of one more thing right now, which is not on this particular slide here. First and foremost, you have to consider prostho as a very wholesome branch, treating you, or a wholesome branch treating generally the entire stomatognathic system and bringing balance to it. It is restoring the entire stomatognathic system. And basically, while doing prostho or while learning prostho, you will understand the foundation of how the entire stomatognathic system functions. And with one single word, if I tell you, it helps you understand balance. If it is off balance, even by millimeter here and there, it will start a plethora of problems in your entire occlusion. So the best knowledge of occlusion is, I think, which is necessary to practice dentistry, is learned by a prosthodontist. You are taught that extensively. That helps you with other aspects of dentistry also. Even if you're doing a composite filling, you should know what an occlusion is, because even a high point on an occlusion can lead to a cascade of high point in an occlusion on a restoration, can lead to a cascade of events, eventually can lead to TMDs also. So that is something which I consider the foundation of prostho, that occlusion is taught very extensively. Now, coming to the procedures, apart from crown and bridge, you are taught dental implants, which is a booming business these days. Everyone is an implantologist. Everyone tries to be an implantologist. My logic is very simple. Patient comes to our clinic with the complaint of missing tooth. It is, after all, at the end of the day, dentist or a clinician's responsibility to find support for that tooth. You could gain it from a denture and tissue supported. You could gain it from a tooth. You could gain it from an implant. And I feel a prosthodontist is able to better decide what is the nature of support for that missing tooth or dentition. However, there are other specialities which also practice dental implants, such as periodontics, oral surgery, but a prosthetically driven implant dentistry or a wholesome implant dentistry is learned, I think, best via prosthodontics. You can even add up on your skills that are related to periodontics or oral surgery after you have learned the foundation of implant. Apart from that, a completely broken down mutilated dentition, pathological attrition is present in patient, or any developmental defects such as amelogenesis imperfecta. You need full mouth rehabilitations. And what better than a prosthodontist to actually explain the process of it? Any step that reorganizes occlusion, a prosthodontist would be able to do it nicely. The main thing which I was very surprised to know when I joined my institute was that there is something that you can go beyond the oral cavity, which is maxillofacial prosthesis. And I think maxillofacial prosthesis, constructing ocular, orbital, nasal, auricular, I myself have also done all of these prostheses, obturators, mandibulectomy defects, all of these defects that you treat as a part of maxillofacial prosthesis is a very rewarding part of the field. Then you have cosmetic dentistry. Say, for example, your mind is driven towards the commercial aspect of dentistry. And for example, you're very much into aesthetics. You can learn smile designing, veneers, and various other options where you can improve smile of a patient. Also, one thing which is not mentioned here is sleep medicine. Obstructive sleep apnea is increasing day by day, and a lot of patients actually are first diagnosed by even a dentist also. Because of the increasing obesity that we see these days, sleep apnea is something that is, as a team effort, even treated by a prosthodontist also. Why I'm telling you this over here? I'm not here to tell you, okay, a prosthodontist is a magician trying to do everything at once. No, I'm trying to show you the different subspecialties that a prosthodontist can master and do. Now, there are two reasons over here why I'm telling you this. Firstly, if you feel that you're not good at one part, say, for example, how much ever you try, you think that, no, I think dental implants would work for me. Then you have another subspecialty such as cosmetic dentistry, veneers, or anything which you can exclusively practice and go ahead into. For example, you like the surgical aspect, but you could not, say, get into surgery, which was your dream branch, or anything for any reason. You can at least practice this through implants, learn advanced implantology, even go for zygomatic or pterygoid implants and other things. Okay. It gives you a range of subspecialty. And if you're someone who just wants to do simple general dentistry, this will teach you the basics of dentistry, rather help you master them. We all learn prostho at the BDS level, but we all know how good dentures we were able to make at BDS level also. Or were we able to actually understand the concepts behind, say, very simple things such as jaw relation at that point. So you would be able to refine those concepts over a period of time. So my idea here is to tell you that a prosthodontist has various subspecialties that you could, even if you want to pick a niche area, you could do that. If you want to practice it wholesomely also, you have plenty of options where you could work in, right? Now, what are career options after doing MDS in prostho? So in between, I can see a lot of students. Yes, good afternoon. All of the students that have joined, very good afternoon to all of you. And what are career options after MDS in prostho? I think the general basic career options remain the same. You could join a college as an assistant professor. You could work as a consultant in a private practice. You could do something which is called as medical writing, that is into research. You could run a private practice. Additionally, prostho has an advantage that if your laboratory skills are good, you could run actually a business out of it, which is dental lab. So very practically speaking, I have seen a lot of students being frustrated after actually completing internship, thinking that this branch has late settlement, or dentistry in general has late settlement, and I'm not willing for that. I want to earn money fast and better. If you probably are a prosthodontist and you have the capital income to open a dental laboratory with good lab work and trained technicians, you can actually make a good successful business out of it. There are plenty of labs all over Gujarat and India which are actually run by prosthodontists. Here, the difference is that if you have done your prostho from a good institute where you have actually done your entire lab work yourself, for example, at AIMS, we used to do casting of our crown and bridge, we used to make implant crowns, we have done all lab work of our complete dentures, made maxillofacial prosthesis by ourselves. If you have done ceramic clearing by yourselves or Emax pressing by yourself, you basically know that this is how the process is done. Now, when you have a technician, you know how to navigate through it. You know what instruments to buy or invest into. and probably won't be fooled by a technician, where a technician usually says us, "Ye to aise hi hota hai." That is not how it works when you know it. So the knowledge helps you when you're going in a private clinic, when you're working, when you have problems with ceramic layering, you can actually convey to your technician that this is how it is done, because you would have also done it in your PG. So these are the different ways where you can practice as a prosthodontist. Now, are these applicable to all of you who are doing prosto? Practically no. I'm not here sitting to fool you up. If you have joined a college that has an excellent research background and offers you opportunity for research, makes you learn research, then you would be able to practice as a medical writer. So I think the first thing that you need to do when you're sitting here watching this session is to identify, why do you want to do a particular branch, what is your end goal out of it, and what skills you want to master. Because at the end of the day, dentistry is not saturated, or dentistry is not going downhill. It is that people lack skills generally when they're sitting in practice. So assess your situation, see what you want out of it, and then select a particular branch. So if you're selecting prosto and your end goal out of it is to join further in research, your target should be institutes that have excellent research backgrounds. You might even look at publications of the guide and the professors over there and see what are the areas of interest. I'm sure all of this is available on ResearchGate and Google Scholar. If your aim after doing PG is supposedly having a good clinical practice, find a college that has an excellent OPD and variety of cases in OPD. If your aim is supposedly to run a dental laboratory, you will rather should not join a college which offers you very less resources in lab work, and where the general trend is that all work is outsourced outside to a dental lab. So think what your end goal is after doing NDS in this branch or in any branch. See what city you want to practice it. See what is your future goal. See your environment. Do a run through of the kind of patients where you are going to practice, and then likewise select. I think this is the general aspect of selecting any particular branch, which I'm sure would have been discussed earlier. Now, what are the advantages for being a prosthodontist? First and foremost, I think everyone is going to lose teeth sooner or later. Everyone is going to become edentulous sooner or later, so never out of demand. It has wide options for subspecialty, something that I discussed before only. Excellent options for subspecialty for both reasons. If you're not good at something, you have still something else you can practice. Or if you're not interested in something, there is still something for you to practice. It is not just limited to oral cavity. So someone trying to get good satisfaction out of what you're doing, do an obturator patient, you will actually be very satisfied after that. So not limited to oral cavity, you can make ocular, orbital, auricular, nasal, obturators, mandibulectomy, finger prosthesis, variety of things. And probably you would be one of the few people doing that in your city. Mark my words for it, there are very few people practicing it. So if you learn it from an excellent institute who practices good maxillofacial work, you are placed in a city that has a good cancer center, and you're finding the lacunae in your city where you feel that there is no good maxillofacial prosthodontist, this is a lacunae that you could fulfill by learning this skill. So not limited to oral cavity, it is an excellent option for pursuing something which is not saturated and something that gives you good satisfaction. Again, it is, for example, a lot of students actually in dentistry feel that after all, this is not something that a patient needs. It is something like an elective or a cosmetic treatment only. Prosto, oral surgery, all of these branches are not actually that. There is an actual need over there. You will feel like, okay, I'm doing something over here. Visible results now. You give patient an edentulous and you give a denture, or you give a good smile with veneers, or an obturator patient, for example, or an orbital patient, for example, visible results upfront, you can see that is something very rewarding. Good income source, definitely. When you have a wide range of options, you have wide range where you can earn also through a laboratory, through a clinic. So excellent income source. And I think overall, by understanding occlusion better, you have a very good understanding of dentistry in general, which you learn. Now, students, do we have any questions for the session? I'll just take a pause here. About 72 students have joined in. So I'll take some questions if there are there. Right now, I cannot see any questions. Now, Just a second. Right. So what are the cons or limitations of being a prosthodontist? It is not, everything is not as starry as I was saying in the initial few minutes. First and foremost, what I feel as a prosthodontist is there is a long and a tough learning curve. Long also because to understand how this stomatognathic system functions, you have to visualize a lot of things, and maybe after reading, rereading and practicing, you will be actually able to understand that. A very quick or a simple example, if I tell you, is try and increase your vertical dimension of occlusion by 1 or 2 millimeters only and see what havoc it causes in your prosthesis. So any newbie or any beginner can make that 1 to 2 millimeter mistake. It is far very common. Even I have done it, but see the havoc it causes. So it will take time to actually learn that. So it is a long learning curve that becomes frustrating, highly competitive also, a very competitive branch and a very tough learning curve. Now, why do I say tough learning curve? Considering that you are going to a college where you are going to do your entire lab work by yourself, which means you are processing dentures, you're doing tooth arrangements, you are making crowns, you're layering crowns, you're pressing Emax crowns, you're making silicone prosthesis, everything by yourself. Even if you're appointing 6 patients in a day, 3 for say morning session and 3 for afternoon, just see the amount of lab work that you're going to do after your OPD gets over. At AIMS, our OPD hours used to get over at 5 o'clock. So from 5 till probably, I think in the first year, we used to go until 2 o'clock or sometimes even more than that in the night, finishing that lab work. Over a period of time till your final year PG, you will gain practice and you will learn how to manage all of this. And do not consider that your weekends may go free. Your weekends are going to go in that lab only. Your entire PG might get over, but lab work will never get over. That is the golden statement that I can say as a prosthodontist. PG khatam ho jayega, lab work kabhi khatam nahi hone wala hai. So that is a tough learning curve. When you see your endodontist friends probably having lesser work after the initial first year, where you see that if you have transitioned to more clinical work and there is less amount of after work after finishing OPD, or in other branches also, I won't want to name it, I think Prostho and OS will be buddies in the initial years because they are the only people probably staying very late in departments at night. So if you're willing for that, if you're willing to invest those hours, then I think Prostho is for you. There are long working hours in PG also. You're doing a full quadrant preparation. It will take you 1.5, 2 hours, maybe even to do that initially. You're doing a full mouth rehab. You're making longer procedures are there. These are not procedures that will be done in 15, 20 minutes. You're doing as simple as border molding. Initially, I remember as students, you all would also agree to me that you all would have taken from 9 a.m. in the morning till 1 o'clock to finish maybe one border molding, or even the entire day to finish one arches border molding. How many of you agree with me? Just tell in the comment section. So that is the number of working hours that is going to be there. Again, very saturated because it is in an in-demand branch, so very saturated. Then I think challenging in terms of patient satisfaction. If you see that a particular patient and if there is a mistake here and there, then your patient won't be satisfied. Again, it will be visible to you. So challenging in those aspects. Now, coming to limitations in all clinical practice, there is a statement that runs around that root canal is the bread and butter of dentistry. So if you do not know that, or if you do not know other aspects of dentistry, you may find it difficult to initially set up your own practice. However, with the availability of fellowships and courses, it is learnable. It is not something that you would be able to do as a prosthodontist, but that is a limitation that happens. And armamentarium in PG and otherwise is generally costlier in prostho. Now, coming to the golden question that I think everyone wants to listen to. At what rank will you get prostho? Seeing the seat matrix and rank allotment from last year, rank number 8 till rank number 14,323, if I remember. So from 8 till 14K is the range of prostho. Now, very briefly, I'll just tell you how to look at that seat matrix and what I feel. From top 10, the big shot colleges will be picked up for prostho. However, it depends upon what is the interest of the student. So if you are someone who are in 11 to 20, and just pray to God that the top 10 are interested in other departments, so you get the better colleges that are there for Prostho. But speaking about Prostho, I feel from rank 1 to rank 250 or 300 is where I've seen the range of government colleges, obviously in the range of the better ones or the top ones picked first and then gradually going down. With private colleges, what I feel, and as a tip I would want to tell you, it shuffles. I'll tell you why. It shuffles not only just on the basis of the college and how good or bad it is, it shuffles on the fees. That changes quite a lot year on year. It shuffles on even on the professors. Now, if you are interested in a private college, or if you are in the rank where you might get a private college, I'll give you a few tips of how to go about selecting it. With private colleges, even the faculty keep on changing. So look at the current year, see that who is there heading the department, talk to the first and the final year resident who is there in the department, and see what are the opportunities currently. Because a lot of big shot colleges have now reduced OPDs. So see and assess the current situation, but it can go in any range. And I think why private colleges, the variation is seen is on the paying capacity of the students also, because these colleges have high range of fees in lakhs and lakhs. So you are not sure whether someone would be able, who is ahead of you, would be able to pay that or not. And secondly, what is their rank in the state quota? So with private college, very difficult to actually predict. So fill up your all of the options and search about what college you want to go in, and then I think do your own research and you'd be able to go. Now, this is something I think all of you would want to hear, but as a prosthodontist, I would still not want to rank any college. I am not a person who would want to rank it. These are institutions that have been there for decades and decades. I'm nobody to rank them, but I can suggest you something. In my humble opinion, I prefer, or I would say, AIIMS Delhi is probably the best department that you can learn prostho in, second to none. As a student, I was passionate to learn prostho, always had a backup option of another branch. This is also something that I would tell you, keep a backup option of one branch in your mind. But I was passionate to do prostho, and that is why AIIMS Delhi was a target for me in mind while appearing for the entrance. If not, I would prefer KGMC and MAMC, whatever I get. Definitely MAMC because it is in Delhi. So people prefer that, considering that Delhi would be better for them to get accustomed to than I think Lucknow. But it depends on person to person. If you are from UP closer to Lucknow, you may prefer KGMU also. All three departments are excellent in terms of infrastructure, patient opportunities, learning, and research opportunities. Obviously, AIIMS has an advantage of being a central government institute, autonomous body, excellent amount in terms of stipend, recent every knowledge on resource, on research opportunities also. We are trained specifically in research and biostatistics and biomedical waste management separately from what DCI colleges would be taught about. But that is there. But KGMC, MAMC, and the general school of learning, you will find it similar in all of these three institutions. Reason being that the profs that you will see in all of them are either trained from KGMC, MAMC, or AIIMS only. So it's a mixture. If you are from KGMC, your learning will match with what is there with someone in AIIMS or MAMC. So if you are able to get into either of this, you are going to come out as an excellent prosthodontist. Apart from that, IMS BHU, Nair Mumbai, GDC Mumbai, Goa. I feel GDC Goa is a very good option for learning prostho. I myself had done that research at my time. GDC Jaipur also, AMU, and all of these government colleges. Even if I want to take other names, GDC Patna is considered, Puducherry is considered good for prostho. So these are good institutions where you can go for prostho. Now, what are top private colleges? Sorry, not for OMFS, it is for prostho. So top private colleges for prostho. Here, I would want to tell you, take a word of caution. Check the fees, and one more thing, check the current situation when you're selecting. In my opinion, if I have to tell you one standalone different point, if you're interested in maxillofacial, go for Amrita School of Dentistry. Excellent opportunities in maxillofacial. In general, if fees and everything, if you want to strike a balance in everything, go for AB Shetty Mangalore. That is also an excellent organization. But since the dynamics of private colleges keep on changing year and year, you want to have a look at the professors that are there, ask the residents, see the number of patients that are there presently, and have a look around in the department and then join. But these are the list of good private dental colleges. Now, if you're someone who are interested in the current aspect of how dentistry is practiced, where excellent camera skills and documentation you would have been seen on Instagram and otherwise, or generally learning cosmetic dentistry better, I would even suggest Savita Dental College for you. So see what your end goal is and then pick a college out of it. You might want to learn cosmetic dentistry, but the college might not be supporting that alone. So do your own research over it. Now, this is just something that I want to share with all of you. Here is, I think these are the 5 factors that you can keep in mind while selecting any branch, even if you are someone who is not interested in prostho, but you are generally listening to this class. I would want to tell you, have a look at the department first and what is its attitude towards learning. Is the department open to multidisciplinary cases and opportunities? So when interacting with first and final year students, you are not just asking about, okay, what is the bond or how is the hostel, mess में खाना कैसा मिलता है, senior toxic तो नहीं है, अच्छा यहाँ पे cultural activities कैसी होती है. Okay, all of that is important, but do ask your senior when you're doing your own research, how are the different opportunities for multidisciplinary case? Would I be able to interact with endo department or perio department or ortho or oral surgery and practice these cases? Because it helps. It helps doing all of these cases. But when you ask such a question, you might encounter, no, I think that environment is not very preferable over here. So that is something that is okay, fine. You can keep in mind that, okay, this environment is not supported here, a multidisciplinary approach. So ask your seniors, have you done such cases? Is the department open to such things? Secondly, don't ask for the total number of cases when you go. Okay, रोज का कितना OPD होता है? 80 OPD होता है, 100 होता है, कितना है? Ask for the variety of cases. If those entire 80 cases are of complete dentures only, you are going to become a denturist after your PG. Ask for variety of cases. Do you get maxillofacial cases? If there is a cancer institute attached, are there amicable terms in between them where they get those cases? I don't want to name a good government college, but despite having a cancer institute, they were actually not treating the cases for prostho because of whatever conflict was going on. So ask them that if there is a cancer institute attached, do you actually get to do all of those patients, or do you have postings over there just for a very short period of time? Okay, how many implants do you get to do? Or who bears the cost of these treatment? Do we have to bear, or will the student or will the patient bear? What are the variety of cases, right? Then free hand to explore. Now everybody would be like, सब कुछ करने मिलेगा, मैं जो करना चाहूँ मिलेगा. Free hand to explore means taking your guide into confidence that, look, this is the kind of theoretical treatment plan that I want to execute. But if I fail at it, I'll do and finish up the conventional treatment that can be executed here. So that free hand to explore, is it there or not? Or are you just allowed or asked to follow that same routine or pattern of treatment? Then what is the academics to clinical ratio? Now, if you are in a department where your academics is very poor and clinical ratio is too much, I think you are also going to come out as someone who will be just purely doing clinical work without any foundation of it. So keep that in mind. And lastly, language barriers, that there should not be language barriers. You are not going to spend your 2 to 3, you're not going to spend your 2 years or even more than that just actually learning that subject, learning that language. So for example, if as a Gujarati, I decide to go on to any southern state, it is going to be very difficult for me to even tell my patient muh kholo. I'm not putting a blanket statement here, but I'm just trying to tell you that, are you willing to take that up? GDC Kottayam, again, excellent institute for prostho, but are you willing to take that up onto you as an additional task when you will be burdened with patients, research, making a thesis protocol, burden and toxicity of department lab work? Are you willing to take that extra thing on yourself of trying to learn a new language? So you should be aware of that. At the end of the day, all of this session should help you introspect that what am I built of? what am I actually passionate about, and how much can I actually do, and will what I am selecting help me get better at it, right? There may be people who would not want to put in those long laboratory hours. So try and select a department which is comfortable with you outsourcing the work to a private lab. Nothing is good and bad. It is about upscaling yourself in skills that you want to be better at. So that is the general idea that I'm trying to tell you with any postgraduate branch that you select. These are the questions that you want to ask when you go to a college while trying to figure out whether that college is for you or not. Of course, the top government institutes that are there, they are something that are documented. Say KGMC, AIMS, MAMC, all of that are documented without a doubt. Even if you are in top 10, fill that up and you can select those colleges. Now I'll have actually a look at your questions in the comment section. We have 77 students watching right now. So presently, okay, Yastika at 11th rank, which clinical branches can I get in deemed colleges? At 11th rank in NEET overall? Or 11th state rank? Okay, Yastika, till the time I think you reply back, you can take up other questions. Any other question, please, students? Okay, Yastika is saying that she has 11,000 rank. Now at 11,000 rank, Yastika, the situation is going to primarily depend on what people select in front of you. Like I said, at 14,000 rank also, a seat for Prostho has gone. So you are eligible to get different colleges, but it will primarily depend on what people have selected in front of you. My advice would be to actually fill up all options of your choice and then see how it works out for you. Yes, Shruti. Shruti is asking at rank 190, All India rank, General EWS category. Can I get a government college Prostho seat in Maharashtra? Within Maharashtra, not too sure, Shruti, considering Nair and GDC Bombay get filled up too soon, but you can definitely get a Prostho seat all over India. Now, that is also something that I was thinking on talking with you. I had actually, or rather, I know quite a few of people who have a preference for staying in their own state only because of varied reasons. So, would you? So, again, it's a question that you are supposed to ask to yourself only. Is the proximity to the house more important to you, or selecting a branch that you're going to be with for your life? So on the basis of that, I think if the proximity is more important, you might have to actually compromise on Prostho in Maharashtra. Reason being that it gets picked up at earlier ranks. But if you can actually adjust with that, you definitely will get Prostho at a GDC at 190 rank. Now, Fatima is asking at rank 5600, can I get a clinical branch in GDC? Difficult, Fatima. At 5600, it is difficult. In general category, I think it is difficult. Pooja Chamdar is asking, how about the instrument cost in PG for Prostho? Is it too much or surveyor? I think the maximum cost in Prostho in terms of instruments comes in your articulator, which comes close to 1 lakh. You can get second-hand articulators, but rather than considering it as a cost, consider it as an investment that is going to stay with you. Whether these are not perishable items, your surveyor, good articulators, hand instruments, anything that you purchase, that is going to stay with you. Plus, if you are in a GDC, you will have good stipend to support it also. Mohini, can you please tell me what region you belong to? I can help you with your college choices then. Mohini is asking, please suggest government college for Prostho after Central and Maharashtra. You can go to GDC Jaipur, you can go to GDC Kottayam, you can go to GDC Indore. Indore comes in Central, but you can go to that. Goa is an excellent option actually for Prostho. Then apart from that, if you tell me what state you belong to, I can help you with it. Fatima, still I think in OBC till 5600 it won't go. Difficult still. I'll get back to you. I'll have a look at the final what was last year's counseling PDF, and then I can get back to you. Just tag us in the that. Okay, so there's one more thing. We have a Telegram group, right? And you all can go to that Telegram group, like how the previous mentors were saying, tag us. My name is Dr. Ruchi in there, and we can surely help you with that. Now, Deka, which college will be best for oral surgery? Oral surgery, Dr. Himani is your best mentor to guide you for that. Shobita, best GDC college in South India for Prostho. Shobita, what language are you comfortable with? First, tell me, what is your native language? If you understand Malayalam or you are comfortable with it, I'll suggest you take up any GDC in Kerala. Excellent. Kottayam and all of that are excellent for Prostho. If, however, that is difficult for you, I'll suggest you as a next option, go for GDC Goa. Goa is also an excellent institute to learn Prostho. So keeping that in mind, you can pick up your college. Okay, students asking for recommendations for oral surgery. Dr. Imani would be able to answer that better for you. You can direct all your Prostho questions to me. Okay, Dr. R has a good question. If I go to other state for PG, how will I build up my connections and patient base? Because ultimately I will open a clinic in my state only. Okay, very good actually discussion question that I am talking about over here is that when you open up, okay, when you travel to a different state, even I went through that, you're saying that you will lose your connections and patient base. I'll put a question to you over here. Is learning a skill and mastering a skill better, much more important for you? Or developing a patient base right from the year in which you are in PG more important for you? As a clinician, both are important. But if you are an excellent clinician, it will take hardly less than 6 months to spread your name and develop a practice. But if you are someone who has stayed into your own state or into your own city with an average choice, considering the proximity to be more important, and you have learned a very average skill over there, then that will not take you for a longer duration and will not sustain you in your practice very long. At the end of the day, for me, or generally for a person to person, it varies. But for me personally, upgrading my skills was the prime goal, and that is why I went ahead with that. But it can vary from person to person. I think that what you're worrying about is something that is buildable after PG also. When you come back, it is buildable, especially with the advent of social media. Now it is within 6 months to 1 year, your name can get better and you will be able to communicate and make connections with people if you have excellent skills. So don't worry about that, I feel. At 9169, I think it is difficult. You have chances of getting prostho, but probably not in a very sought after institution. Dr. Rami Reddy Himani, you have ranked 9169. You have chances of getting prostho because it has gone till rank 14,000 last year. It depends actually on how the private colleges work out in the ranks before yours. Shubhangi Mishra, GDC Mumbai and Nair equivalently. I'll prefer GDC Mumbai more than Nair, but it is a personal choice. So Shubhangi Mishra asking that in Maharashtra GDC, which is better for prostho, Mumbai, Nair or Nagpur? I'll prefer Mumbai, but Nair and Mumbai both will go equivalently only. So choice is yours. How much marks required for prostho? So Mahi and Swati are asking how many marks are required for prostho. Difficult to answer actually. It's not a mark-based exam, it's a rank-based exam. At rank 175, what is a good choice for prostho with Punjab domicile? So Danish, I am assuming you want to take up in Punjab only at rank 175, and that is your state rank. Or is Danish 175 your general category rank for all India? Again, Alpha Gamer, he's asking how is Kemsha Dental College for surgery? I won't be able to comment on that. Have no experience on surgery, so please actually communicate with Dr. Imani for it. Okay, Deka again is asking me, can you tell me about oral surgery, ma'am, in the state of UP? Guys, students, please direct your questions pertaining to oral surgery to Dr. Himani. That would be better. Okay, Danish, till the time you come back with the relevant information that I've asked, are there any students who would be able to, who have any best college for prosthodontics in Chennai? GDC Chennai and Savita would go equivalently. If you are at a rank where you are getting into a GDC, take up GDC Chennai. You can upgrade your knowledge about the latest skills later on also. But if you are someone who wants to already begin with that and wants to go probably more into cosmetic and digital dentistry, I have seen some excellent work going around in Savita Chennai. So choice is yours. If you are able to spend that amount of money, again, do your research. But if it were me, I would prefer GDC Chennai because it will save me a lot of money. So that is my personal opinion though. So Vipul Sharma asking what is the best college for prostho in Chennai? I hope that solves your question. Okay, Dr. D has come with an excellent question. Out of the two, what should be priority, ma'am? A good number of OPD in a college or a college with good lab setup, necessary instruments, but less OPD comparatively for prostho? So I would want to tell you, don't just look at the number of OPD. Try and find out what is the variety of case here. If the variety of cases are better in the college with good instruments, but the different kinds of cases are there, prefer that. If, however, the previous college where there is good number of OPD is offering you a different variety of cases and the other factors that we were talking about, say these other factors, if they are better, then you can go for that. So Dr. D asking this question about patient OPD. Have a look at the other four factors and then probably you'll be able to decide better. Now Mehul Gondalia is asking college list with fees and stipend. Mehul, I think that would be available per se on the government websites and that will better be able to tell you. Kanchan Satpute is asking, if someone's hand skills aren't good, can they go for prostho? Definitely you can go for prostho. Skill can be acquired. It is not something you're born with. It is an acquired. The more practice you do, the more you'll be able to do it. So don't be restricted that I won't be able to do prostho because my hand skills were poor in my undergraduation. You will be able to master it over a period of time. And your second question, how is Savita Dental College's prostho? I think it is a good department for learning prostho. Again, Alpha Gamer is saying how many FMR cases are considered ideal in 3 years of MDS. There has been no published research that states that these many number of cases are ideal for 3 years of MDS. But if it depends on what you are as a person, a student who understands the why behind everything can learn that in one case also. A student who does everything mechanically will not be able to learn that even after doing 10 cases. So firstly, it depends upon what you are made up of and how you perceive doing a patient and what you take out of doing a patient. But even if you are able to do 2 to 3 full mouth rehabilitation cases in your PG, that is a big number I'm saying. Some are only able to do 1. That is still good to begin you with the learning journey of FMR. For a government job, I think department won't be that important, DECA, unless and until if you're saying that you want to take a government job in an institute where trauma will be involved, then oral surgery will offer you better chances than prostho. Other than that, I feel government jobs generally do not have that specification nowadays where MO, medical officer or dental officers posts are out. They are not branch specific. Apsara Sadanand is asking, in rank 250, can I get a good government college in North India? I think you can get a good government college. Depends upon the branch you're going for. Kanchan Satpute is asking, would you suggest someone to pursue PG in South? Yes, I would. Like I discussed before, it is upon to the person. When you're doing PG, you have a lot of things already going on for it. You have your new department that you have to get accustomed to. You might be out of your home, the comfort of your home. You might be managing your personal life and other things by yourself. That is your food, clothes, laundry, money matters, accommodation, whether you have a hostel or you have to rent out a house, managing that house, all of that. That is the back end of it. On the front end, you have a research protocol in your first year to prepare for. You have a thesis to work with, you have cases to go on with, you have to learn the working dynamics of that environment, get friendly and familiar with your professors and your seniors. Now, as a person, if you're willing to take up the challenge of learning a new knowledge, a new language, beyond all of this, I will suggest you taking up a college in South India. It depends on you, how much you're able to accomplish. There are people who accomplish much more work in 24 hours. There are people who may lie around only for 24 hours and still feel that they've done a lot. It's actually on to the person how they would be, but I'll never stop you from doing something. It's on your comfort, whether you'll be able to put in that effort. The reverse of it is that I have had juniors from South India. Rather, after my years, a lot of my juniors were from South India only who had difficulty learning Hindi and talking to a denture patient in Hindi, where even I had difficulty learning different phrases of Hindi. Being a Gujarati, it was very difficult for me to learn certain specific phrases of Hindi when communicating with a patient. So that barrier is always going to be there. But how much of weightage or how much big or small you make that barrier for you is on to you. If as a North Indian, you go to a state that exclusively speaks Malayalam or Tamil or Bengali, it is going to be difficult, but not something that you cannot do. People are doing PG, people have done PG, and you would be able to do it. In fact, my own co-guidance sir had done it from GDC in Kerala. And so I think it is doable. It is not something that is not doable. Now, Danish All India rank 175, which is a good government college at this rank. What are your choices in terms of branch? If you're talking about Prostho, I'll suggest you start filling from the top only. That means fill MAMC, fill KGMC. Then I think it depends upon your choice. If you want to be close by to your house, then you could fill up actually IMS BHU, Jaipur, or rather than Jaipur, you could go for Nair and Mumbai. Then after all of that, everything else comes at the same level, Goa or other colleges. But that would be the sequence in which I would tell you to fill it up for Prostho. Other branches, I think you can consult the respected mentors. Now, how many implant cases should see? I have one particular student asking how many FMR cases are ideal, how many implant cases are ideal. I would want to tell you one thing which I firmly believe in. No department, no branch, and no institute can make you an excellent clinician. It should be within you. You should be able to learn what has been given to you from a case. If I execute that case completely mechanically without drawing anything out of it, I am not going to be an excellent clinician even after passing from a very good institute. So at the end of the day, it is upon that person what they're doing. You can be doing only 5 cases in PG in implants and still learn a very good knowledge about implants. You may have done 50 and you may still not learn the basics of it. So it is completely a personal thing. Kanchan AB Shetty versus Savita Dental College, both are equivalent, I would say. If finances are an issue, you can compare the fee for it, but according to me, both are equivalent. Then you take other factors into mind. What is your proximity to both of these colleges and other things as well? But in my honest opinion, both are equivalent. Best colleges for Prostho in Gujarat. First would be obviously GDC Ahmedabad. After that, all of the different private colleges would come. You can go for then, like how Dr. Divya was said, you can go in a semi-government or a government-aided college like AMC, Ahmedabad Municipal Corporations College. So you can go for that. Then I think different private colleges would come and you could select any of them depending upon what is the fee structure. I think all of them fall equivalently. If you're talking about Vadodara, there are 2 colleges over here. One is in Nadia, then rest of all are in Ahmedabad. All of them fall equivalently in terms of work and everything. If you're someone from outside, you can select something in Ahmedabad, considering connectivity of flights and everything would be better. But generally, GDC Ahmedabad would be the first choice. Now, we have a question by Brainy Tricks. If I get a seat through NEET and still want to appear for INI-CET in November 2024, shall I go for the same? And if by God's grace I get a seat in AIMS, then leaving the NEET provided college, then is leaving the NEET provided college seat possible or not? Every college, I guess, has a bond structure. If you're willing to pay for it, you can leave a seat at any point of time, regardless of whether you have a rank or not. If you're someone who is passionate about learning from the best of the best, you can appear for INI-CET. Being an AIMSonian, I can give you plenty of examples. We had an example of someone who was, I think, pursuing MDS in Prostho and was in final year of it at a government dental college. And I think he appeared for AIMS exam and got into oral surgery. As far as I know, I don't know the entire story personally. I had a junior who is also from Gujarat only. And I think in the first round, she had AIMS pedo. In the next INI exam, she had AIMS oral surgery because OS was her choice. Again, not taking any names over here. My own colleague in Endo department had a government seat in PGI Rohtak, GDC Rohtak, and he had kept that seat in hand and simultaneously had a rank in AIMS, took up Endo at AIMS and resigned the seat at Endo, or I think, I don't exactly remember what department he got into. Endo or pedo is something that he had gotten up at through NEET. So plenty of options. These people had paid up their amounts, whether it was 5 lakhs, 10 lakhs or whatever. I think if you, yes, you do pay penalty for it. Most colleges have a penalty of it. So within the 6 months frame. So if you're wanting to go for something like this, then be just cautious about that penalty amount. Don't go to a state or a region there where the penalty amount is 50 lakhs. You won't be able to fill that much up. So if you want to keep that leeway for yourself, then check the bond amount of any colleges. How are clinical jobs after MDS Prostho? Kritika, can you define what do actually clinical jobs mean according to you? Okay, Kanchan is asking, as crown cutting is done by endodontist also, is there a drawback for prostho? RCT is done by prosthodontist also. Is that a drawback for endodontists? You tell me. Any specialist would do any treatment far better than the other person, or after all, it depends on the skill of the person. So nothing is a drawback. how well you are able to execute that. That is the question over here. Inakshi Banerjee is asking, I have got 1400 All India rank in NEET. I don't think I can get any government seat in general category with this rank. I am thinking not to register now and wait for state counseling. I hope I'm doing right. Yes, at 1400, difficult to get a general category clinical seat. I think what you're doing is a fair choice, unless and until you're very sure that you want a government seat only. If exploring private options is a choice for you, then you can go for All India counseling. Shruti, the specific question that you're asking about between All India and state counseling totally depends on your options where you're getting on both sides. See what is the best option for you and accordingly select it. Mehul, yes, I think DCI registration number is needed in counseling. Okay, Harita Shri is asking GDC Chennai, how is it for Prostho? My own very good friend actually pursued Prostho from GDC Chennai. So it's a good institute to pursue Chennai, but this is something that was 10 years back. Present situation, I can actually ask her to find out and probably get back to you. So tag us in the Telegram group, we can do that for you. Okay, so what Kritika is asking is what is the demand of Prostho in consultations? To be very honest, Prostho is very botched up by people outside. Everyone feels that I know how to make dentures, I know how to put implants, I know how to do RPDs and everything. So you may not be the primary source of your earning, may not be primarily from consultations, because everybody would try to botch it up first and then call you that, okay, you try and fix what I've botched up. It will take slightly some amount of time for you to develop that repute where people won't botch it up and directly call you for work. So it's a difficult curve in consultation. I would agree with that, because it's not like ortho, which people don't know at BDS level and this. Everybody would try their hand at prostho work. It's only, I think, pedo and ortho where people straight up called up a consultation for any branch. Otherwise, generally for other branches, people will try to do something by themselves. And then if they don't succeed at it, they try and call a consultant. So in prostho, it's difficult consultation, but not something that is not doable. If I've established your name, you will get excellent earning from consultations. Okay, I think that completes our discussion session on the subject of Prostho in general. I hope I have solved all of your queries and doubts. It was excellent interacting with all of you. If there is any further query, do put up a question for us in the Telegram group and I'll be happy to solve for you all. Now with this, I'll wrap up the session. I wish you all the best that you get the seat of your choice, institute of your choice, branch of your choice that you want to pursue in life. And our best wishes are with you. Do join the Telegram channel so that you will be in link with all of the different mentors for any further queries that you have. that you will be in link with all of the different mentors for any further queries that you have.
That was quite an insightful session, Dr. Ruchi. I've been listening to your viewpoints about how to pick up a how to select a seat for the upcoming Dream branch. But I'm really, really happy that you could put such insightful topics to the students so that they will be able to select a good branch from themselves. So, good evening, everyone. This is Dr. Kunal Agrawal, original guru of DBMCI Orthodontics in for the upcoming sessions. So, I am here today. Basically, we are talking about a counseling session, a pre-counseling workout, how to go about the counseling, which is just about to be coming up in a few days from now. And I, as a clinical practice owner, I as a consultant orthodontist, and I was an orthodontic student as well. I was an orthodontic student myself from GDC Bangalore. I had completed my Orthodontics MDS in 2016. I was student in 2013 to 16 batch. And I did my BDS from Maulana Azad Institute of Dental Sciences, New Delhi. Right? So in this session, I would be talking about my own personal experiences also. Like I was All India 46th rank in open general category in 2013 NEET exam. So what were the challenges which I faced while selecting a proper seat for myself? What are hurdles came into my way? Who were my supporters? Who were my criticizers? And everything. So we'll be just having a live, we'll be just having a discussion kind of a thing. I'm not going to impose anything on you. I'm just discussing what I went through, what all I have learned, what all I have experienced. I would like to share those experiences with you in the upcoming half an hour session from now. Right? So just to begin with, to talk about a few mantras before selecting a seat. And these are the 7-8 points which I personally believed in myself during my time in 2013 when I was at the same pedestal at what you are right now. So first and the foremost is always and always follow your dream branch. It's the dream branch which should be the guiding factor, which should be the motivating factor for you to study for the upcoming NEET exam, even for the aspirants and even for those who have successfully completed, who have successfully secured a rank right now in this exam, in this very particular exam. And I wish you many congratulations on securing such a good rank for you. So always you have to follow your dream branch. One thing, and I consider it one of the most important things, which I myself followed despite getting criticisms from my peer group, my seniors, my juniors, even my mentors, my teachers also, that don't run after stipend. Please mark my words, don't ever run after stipend. You will be attracted. It's very natural for people to get attracted that how much stipend a particular GDC is offering. But mind you, stipend remains only for 3 years of your life, but your specialty remains for the lifetime. I'm repeating myself, stipend remains only for 3 odd years of your life compared to the rest of the 40 years in which you will be practicing your specialty branch. So please mark my words, stipend should not be a determining factor. It should not be a choosing factor for you to choose the college, right? If you really want to grow, you need to get out of your comfort zone. That's an age-old fundamental principle that you cannot get everything sitting at your own place. If you want to get it, get up, and then run for it, and then go for it, right? Then base seat selection criteria on the college's reputation, not to the proximity of your hometown. So this is the point which Dr. Ruchi also mentioned a little while ago. And I am a firm believer that if you want to go for a branch which you are aspiring to be since a very long time, since the formative years of in your BDS, the proximity of the college to your hometown should not be a deciding factor. However, there are certain instances in which where you have certain family problems or you're responsible for the well-being of your family. that's a different situation altogether, that you need to move from the college to your hometown on a very frequent basis. Then that's a different thing. But I leave this to be decided by you, by yourself only, that if you are up and ready to go for it, I think you should go out of the state based on the selection criteria and based on what research you have done, and you have shortlisted which college for your dream branch, right? Then think of tuition and logistic fees as an investment which will reap returns later on. Again, one more important point, that you might think that certain colleges are taking admissions at a very large fees, or that certain branch, suppose orthodontics, I'm talking about orthodontics, is a costly branch. It requires certain investments, the instruments, the armamentarium, the consumables, the non-consumables. All of those instruments are quite costly. If you are investing in them, then you should really invest in good quality materials, good quality instruments, right? You should not compromise on the investment. You should not compromise on the quality of the instruments. You should not compromise on the quality of the textbooks, what you're going to read. Think of it as an investment. You're investing some amount of money for your well-being. You are going to learn something for the rest of your life. And then sky is the limit. When you have learned the clinical skills, when you have gained mastery over your clinical skills, then sky is the limit. Everything, whatever you have invested, that is going to come back to you. Maybe after 3 years, maybe after 5 years, maybe after 10 years. But you have to be patient enough and think of it as an investment, not as an expense, right? And of course, students, we all are fortunate enough to have parents who always save for us, who always save for our higher education. But in some cases, when the savings are not enough, student loans can come to your rescue. And if I'm not wrong, I'm not very sure whether they're interest free or not. You might have to find out that yourself on your personal level. But as much as I know, student loans, even if they are not interest free, they charge very less interest. Okay. And investment in skills, knowledge, and books is the best investment possible. One more thing I would like to agree with Dr. Ruchi is that she said that, and that this principle I also followed myself personally, that while selecting a branch, while selecting a particular college, you should be in touch with the current PG students of that college. That is very important. Talk to the PG students. Just get their phone numbers, get their contact address, email ID, whatever. Even you can send a request to them on Instagram, Facebook. Just make the contact with the existing PG student of your dream college. Talk to them about the number of OPD per day. Talk to them about the variety of cases what the students are going to treat. Then talk to them about the frequency of seminars, discussions, journal clubs, whatever they are taking. What is the frequency with which the particular department is undertaking those discussions with the students? Then you have to talk to them about the about the variety of cases I said, then discussions, seminars, and all. How much importance they are giving to the free hand, whether the teachers there are giving you free hand to practice or not, or they are always on your head and they're always standing behind you and they're always ridiculing you, humiliating you in front of others. So all those things you have to take care of. So the bottom line is that you have to establish a proper contact with the current PG students. It could be first year, second year, third year. Third year is the best because they have been in the college for 2.5 years. And first year also you can make good contact with, because they are in the honeymoon phase right now. They are exploring the college. So they will be exploring much beyond the curriculum. They'll be talking about the cultural activities what the college is offering. They'll be talking about all politics. It happens everywhere. Or all the politics, whatever conflicts, politics, whatever is going on in the college, and in any way, if any, that is impacting the growth and development of the particular department of orthodontics department of that particular college, right? So these were the certain mantras which I followed on a personal level before selecting a seat for myself. I was All India 46th rank in general category in 2013 NEET exam, based on which I got PG seat in orthodontics in GDC Bangalore. So I did the same thing before selecting GDC Bangalore. Now, to put things into perspective, there could be many people who might be, although all of you have read BDS, all of you have studied different subjects in BDS, but orthodontics, especially orthodontics, you must have read whatever you have read in theory, in books. I'm sure none of you must have got a good, proper clinical exposure in the Department of Orthodontics in your internship. So as they say, orthodontics is a postgraduate branch. It's a clinical postgraduate branch. I very much agree with them, whosoever says that. So an orthodontist is a comprehensive stomatologist. Now, what is a stomatologist? It's a person, it's a scientist, or it's a doctor who is studying the entire stomatologic system of the person. So stomatologic system includes what all? It includes the temporomandibular joint, the occlusion, both dynamic and static. It includes the teeth, the periodontium, paradental tissues, the soft tissues of the mouth, the tongue, the musculature, the mandible, maxilla, jaw bones, the hyoid bone, the suprahyoid group of muscles, the infrahyoid group of muscles, the trapezius muscle, the sternocleidomastoid muscles, and temporalis, muscles of mastication. And also it, basically we are talking about the entire head and neck region. So that's what an orthodontist is. So if you think that orthodontist just limits himself or herself to just straightening the teeth, to just alignment of the teeth, I'm afraid you are very wrong. That comes as an additional bonus. We are for sure, we are straightening the teeth, we are aligning the teeth by different means. We can do the same thing using metallic braces, we can do the same thing using ceramic braces, self-lighting braces, lingual braces. Nowadays, aligners have also come into existence since last 10 years, 10 odd years or so. So there are different modes of correcting the teeth, different modes of aligning the teeth. But what many orthodontists fail to understand is that they are doing a comprehensive treatment of the entire stomatognatic system. So just on the basis of, just for the cosmetic purpose, you should not limit your outlook, you should not limit your horizon to treating patients just on the cosmetic level. Because patients have a chief complaint that patients come to you with a chief complaint that, sir, I have forwardly placed upper teeth, or I have gaps between my teeth, I have got crooked teeth, I have got misaligned teeth. That is the chief complaint what the patients are facing. But that's true. That's true that you have to address the chief complaint of the patient on a priority basis. That is absolutely true. But you should look beyond the chief complaint of the patient. You should try to gather that data. You should rather ask leading questions or indirect question to the patient that because of the malocclusion, what is it that you are facing? Are you facing any gingival recession issues? Are you facing any bad breath? Then are you facing any issues related to cavities or tartar deposition, calculus deposition? Because I'm sure in most of the cases, these are the very common conditions, very common problems which the patients might feel that they are facing because of crooked teeth. But since they are so much obsessed with getting their crooked teeth corrected, they are just going to focus on the chief complaint, and the patient just want to emphasize again and again that I have got forwardly placed teeth, I've got crooked teeth. So they just want you as an orthodontist, as a doctor, to just straighten the teeth, and that is the end of the story for them. But as an orthodontist, as I said, you have to think much beyond just straightening the teeth. Okay? So basically, we are doing alignment and smile enhancement of the patient's crooked and underconfident smile. So many times, patients who have proclined teeth, who have got malalignment, misalignment, they are quite underconfident. They are not that confident to be present in the social gatherings. Or even if they smile in a very shy manner, right? So they have got high expectation from an orthodontist. And nowadays, I'll be coming to that also in the disadvantages of being an orthodontist. Let me just give me some time. I'm going to come back to it. So orthodontist is a dental specialist who prevents, diagnoses, and treats facial irregularities as well. Then As I said, we have different options available. Then we have metallic braces, ceramic, self-lighting braces, lingual braces. Aligners have come up. Nowadays, intraoral scanning is the latest fad which has come up in the science of orthodontics and general dentistry. Post-graduation course is the most grueling period in one's career. That is step number one. So I'll again emphasize myself, if you're choosing to be an orthodontist in your postgraduate course, you have to come prepared that it is one of the most grueling period. Those 3 years of your life are going to be most grueling period. If you happen to land up in an institute where there is a good environment, where there is a good positive environment, then you are very lucky. But there are certain institutes, I'm not going to take any name. I had done my research at my time. Based on that only I'm talking about right now. At that time, there were certain institutes which were full of politics, all shitty things, So just surround yourself with good people, surround yourself with positive people, surround yourself in a positive environment, and then you can see yourself blossom. That is the mantra which I would like to impart to you. And again, I would stress myself, for that, you cannot understand, you cannot know the ins and out just by looking at the star rating in Google Maps of that particular college, whichever you are thinking of taking a seat in. You have to talk to the postgraduate students. You have to talk to the junior faculty as well, if that's possible. And learn to handle patients beyond dentistry. So this comes under soft skills, basically. So no college teaches you financial management. No college teaches you how to handle patients on soft skill basis. Now, what are soft skills? So soft skills are how you handle the patient, basically. How much confident you are in your own skills so that you can instill confidence in the patient. All that comes under soft skills. Okay. So being an orthodontist, it's a tough job. You have to be on your toes all the time. And also in the PG time, like the clinical work is different, the lab work is different. I remember my clinic hours were from 9 a.m. to 4 p.m. My clinic hours were from 9 a.m. to 4 p.m. But I used to remain in the college. Just a second, my computer battery is running low. Just give me a second. I'll just be back. नहीं चल रहा, बैटरी नहीं लगी उसमें.
Yes, sir. Yes.
अब ठीक है. हो गया.
नहीं वही बोल रहा था. कैसे बोल गई मैं वो सोच रही.
बैटरी नहीं ना इसमें निकलने गया. Really sorry for the interruption. There was no battery in my laptop, so I had to get the charger and put it. So that's why the delay. So what I was saying, so you have to learn to handle the patient beyond dentistry. That includes the soft skills. Yeah, I was talking about my own experiences. My college hours were from 9 a.m. to 9 a.m. to 4 p.m. They were the official college hours, but I used to be like, along with me, there were so many other co-PGs, my seniors, my juniors as well. We used to be in the college till maybe 7 o'clock, 8 o'clock, sometimes 9 o'clock in the night. And all of us used to do the lab work. We had to do the basing. We had to prepare the retainers of the patients. We had to do the lab work, basically. For that purpose, we had to stay back. And beyond this, beyond just the alignment of the teeth, we can go for interceptive orthodontics in different manners, in different ways as well. We can go for orthopedics. We can go for dentofacial orthopedics. So orthodontists are equipped with certain knowledge, skills to modify the entire craniofacial structures of the mouth. So if you encounter a patient who has a small mandible, or if you encounter a patient who has a very large maxilla as compared to the other jaw, so you have to ascertain what is the age of the patient, whether the patient is in circumpubertal growth period or whether the growth has been completed. So based on that, you can base your treatment planning differently. If the patient is in circumpubital growth period, you are very lucky. You can go for a myofunctional appliance, or you can go for an orthopedic appliance to rather modify the entire craniofacial structures, right? But if the patient has surpassed that growth period, you can go for surgical correction, surgical orthodontic correction. So this is again a multidisciplinary thing. You have to take help from the oral surgeon, oral maxillofacial surgeon. Sometimes you have to take help from prosthodontist as well for kinematic jaw relation transfers to the articulator, to the semi-adjustable and fully adjustable articulators. So orthodontics is not just straightening the teeth. It goes much, much beyond that. It's a comprehensive specialty taking care of the entire stomatognatic system, as I said earlier. And also many times we have to go about interdisciplinary treatment as well of the patient. Nowadays, with the advent of adult orthodontics treatments, with the advent of lingual braces, with the advent of aligners, nowadays many adult patients are seeking orthodontic treatment. So we have to take care of their sensitivities also, that they don't want to display that they're undergoing treatment to the people with whom they are dealing on a day-to-day basis, right? So if we are treating an adult patient, so adult patient come with their own sets of dental treatment which has already been done, right? You might encounter patients having less teeth or more number of teeth, or teeth having prosthetic crown over them, teeth having good extensive restorations over them. So sometimes you will observe that the edentulous span has been there for a very long time due to previous extraction, and because of anterior component of the force, the posterior teeth have tilted anteriorly, right? So in that case, you cannot go for a comprehensive orthodontic treatment. You have to go for adjunctive orthodontic treatment or limited objective orthodontic treatment. So that's where the role of orthodontist comes into existence, that he or she, the orthodontist, has to decide upon the exact treatment plan, what is going to be given to the patient. You have to sit with the orthodont with the you have to sit together with the oral maxillofacial surgeon, periodontist, and most importantly the prosthodontist. So you have to have an interdisciplinary meeting. So what exact treatment you are going to impart to the patient, based on that objectives, you can go about the delivery of orthodontic treatment to the patient. So this is what stomatognatic system looks like in a schematic diagram, as I was saying. So we are basically concerned about this area, the teeth involving the maxilla and the mandible. But as I said, everything is interconnected. We have suprahyoid group of muscles. We have infrahyoid group of muscles. We have got trapezius. We have got sternocleidomastoid muscles. We have got the vertebral column, and each and every structure is being shouldered by the shoulder girdle, right? So if anything goes wrong in the mouth, in the teeth, and in the muscle surrounding the craniofacial region, so that cascades into a bigger problem. So you as an orthodontist, you as a prosthodontist for that matter, so it's your moral responsibility to have all the structures in balance, in proper occlusion, muscular balance, so that these problems do not arise in the future. Now, this is the slide which many people would be waiting for, I hope. So what are the career options after MDS? You are at cloud 9 that you have entered into your dream branch, into your dream college. But you have to have a reality check, first of all, and you have to understand what are the different career options available after pursuing MDS in orthodontics. So as everybody must be aware, there are not enough government job prospects in India for dentists. So we have to look beyond that. We cannot just depend on when the government is going to increase the number of dental officers in their primary health centers. You don't know exactly when that will happen, but you have to have a living for yourself. So you have to look into other prospects. So you can work as a visiting orthodontist. as a consulting orthodontist in different city, different clinics of the same city. Even you can go for outstation consultations also, as I've been also doing. Then there's an option of working as a full-time practitioner in any dental chain. That means there are different dental chains available in North India, South India. So in North India, we have got Clove Dental in Delhi and NCR region. That is quite popular. I think even in Jaipur, Lucknow also they are there. They're quite popular. And in Bangalore, we have Partha Dental, Hyderabad, and other southern Indian states. They might be having different chains of dental clinics with which you can get affiliated to. Then you can get affiliated in a teaching institute as a senior lecturer or an assistant professor if you are academically inclined. If you want to upskill your academic skills, then no other place other than working as a senior lecturer in a dental college. And one thing I would like to tell you here, that nowadays senior lecturers do not get enough salary. That thing you have to take care of. So it is your choice whether you want to be a full-time senior lecturer in that particular department, or you can be on papers as well. What worked for me, I've joined as a senior lecturer in one of the colleges in my city in 2016, right after completing my BDS. Sorry, right after completing my MDS. Right? So that has helped me in building my network, in building certain contacts, because I was a fresher. I was a newbie in my city. I did my BDS from a different city. I did my MDS from a different city. So when I came back to my hometown is Bhopal, Madhya Pradesh. So when I came back to Bhopal, nobody knew me and I didn't know anyone. So it was a virgin field for me, actually, to put it that way. So I had to work little harder, building up contacts with different dentists, with different people, so that they get to know me. And those people who already are running their own private practice, they get to know me that I'm available as a consulting orthodontist, and I can be available to you. I can be available to you later on, as soon as any patient requires the treatment to be done. Right? So that helped me in building up my network, in building up my contacts. So that also you can consider if you want to be associated with any college on a full-time basis. You can also get attached with a non-academic institute like AIMS or any other institute as a senior resident, but you have to take care of whether whether there is bond in that or not. And yeah, one more thing about bond, one more thing you have to take care of while selecting a seat for MDS, you have to look for certain bonds, because different state governments have got different bonds which may be applicable to people who have taken selection in that particular college in that particular state through a state quota seat. It might not be applicable through an all India quota seat, but you have to know for sure. You have to visit the website of that college before choice filling, and you have to be aware of what is the bond that you're going to pay in case you want to leave immediately after 3 years after completing your post-graduation course. Then other option is you can be self-employed in your own practice, which of course, if you are owning your own practice, it again comes with its own set of challenges. So not everyone, let's be real here, not everyone is lucky enough to be owning their own practice. So that's a question to be discussed later on, that what are the challenges which one has before setting up own practice. So that's a thing to be discussed at some other time. Then you can have certain fellowships and memberships. Most common membership which many people are doing these days is membership in Orthodontics, Royal College of Surgeons, Edinburgh, right? So that also you can have. Then you can get certain certificates, like if you want to practice aligners, like I am an Invisalign certified aligner provider. So I have done that certification course in Mumbai in 2017, just an year following when I came back from after passing my MDS. So the training faculty had come all the way from Australia to Mumbai, and I have done that certificate course, based on which right now in 2024, I can proudly say that I'm a certified Invisalign provider, based on which I can provide aligners to the patient. Then we have certain certification course in lingual orthodontics also. Dr. Sanjay Lab in Ghaziabad, near Indraprasth Dental College in Ghaziabad. He conducts his own certification course on lingual orthodontics. So you can go for that also even. Then other career option is that you can get associated with aligner companies on contractual basis to help orthodontists plan treatment and deliver aligners to their patients. Now, this has been in trend of late, that right after completing your MDS, those who cannot open up their own practice, or who don't have other things to do, who don't want to who want a sedentary job, who don't want to run around as a consultant, taking a bag in your hand, running from one clinic to another clinic. So if you don't want that, this option could be another option for you, right? Then yeah, there are certain talks in the middle regarding introduction of a course called MDCH. I don't know when this will be introduced in the field of dentistry. It is very similar to MCH, right? After MS. So MCH is Master of Chirology. Similarly, MDCH is Master of Dental Chirology, right? So I don't know whether this will be even given a green signal to be introduced in the course in India or not. I don't know about that. So, and of course, there is no limit. One can explore beyond orthodontics itself, and one can even relocate to other countries as well right after completion of MDS. Like if you want to relocate to maybe Canada or USA, but you have to fight, you have to clear an exam, you have to clear NBD exam or NDB exam, National Dental Board examinations. And if you want to go to Middle East countries, Saudi Arabia, United Arab Emirates, Kuwait. So for that, you have to clear that equivalency exam, which is specifically pertaining to getting license of practicing orthodontics in that particular Gulf countries, right? You can even go to Australia, you can even go to New Zealand, even some people go to African countries also, Libya, Egypt, I've seen, even South America also for that matter. So that's entirely up to you. If you have got resources, if you want to go beyond our own country, and if you want to explore the world, Hong Kong, China, Shanghai, Beijing, so many different places to go and settle down. So I'll just take a pause here. I'll just see whether I have any questions or not. One second. So, so I think there are 54 people watching, and I don't think I have got any questions so far. No, I don't think I have got any questions so far. So let's talk about advantages of being an orthodontist now. So orthodontics is one of the most sought after clinical branches in dentistry. If you're aware of that, stomatopathologist. As I said earlier, we are responsible for overall well-being of the patient's stomatopathic system. That is again an advantage. Then it is one of the highest paid branches in dentistry. You are an artist, dentist, you are a doctor, you are an engineer, plus you are an artist as well. So you are an artist where the dimensions of the teeth run in the order of 0.5 to 1 millimeters. 0.5 millimeter difference, upper lower difference, vertical difference of 0.5 millimeter space, if it remains in the mouth, that could be a cause of concern to the patient, right? So you are an artist. Then you're responsible for emancipation of patient's psychological makeup and self-esteem. If you're able to deliver a beautiful smile to the patient, hands down, that patient is going to be a fan for your lifetime. It has happened with me. I get certain compliments. I have my own clinic, and similarly, consequently, I have my own page on Google. So every now and then, if I visit, I find few more comments, few more Google reviews appreciating my skills and appreciating how I made my patients feel about the treatment. So everything comes down to the patient management skills, the soft skills what I was talking about earlier, right? So you get already motivated patients, boys and girls alike. So this is one of the important things. In orthodontics, you don't need to motivate the patient so much so that many a times it happens that patients, both teenage boys, teenage girls, young adults, old adults, middle-aged patients, everybody nowadays, they are so much well informed in previously because of the advent of social media, because of electronic media rather, Google search engines, uh, YouTube videos, and so many other electronic media uh, uh, resources which are available to them freely. So many times patients come to my practice who are already well informed. So it is your responsibility as an orthodontist, as a dentist, to be even better informed than them. That patients have their own sets of doubts. Everybody has. So you should be able to answer those doubts what the patient has. So many times you get already motivated patients. You don't need to convince them so much so that you need this, for this purpose, for that purpose. They have done their own research. They have just come to you. They will be visiting other clinics as well, other orthodontists as well. So it is the soft skills. Again, I'm emphasizing on the point. It is the soft skills that matters, how you are going to attract the patient. So that's what makes you different from others. Then we have high job satisfaction. There is no retirement age per se. It is said no, जब तक हाथ चल रहे हैं काम करते रहो. There is no retirement age as such. In engineering or any other non-medical field, the retirement age is around 60 to 65 years. But in the field of medicine, even dentistry, there is no retirement age. You can work as much as you like, till as much age as possible. Okay, so that there's no retirement age per se. Then there's professional autonomy and there's continuous learning. Now, as I said, we have to be ahead of the patients during the consultation time. Patients are well informed these days, so you have to learn. You have to keep updating the skills. You have to be aware of the different developments, different uh, developments or different advancement which is happening in other parts of the world, and how are they going to be available to you at your own practice in your own country. So you have to be continuously learning. You have to be continuously aware of that so that you have an edge above other people. Now, everything comes with a downside as well. What are the limitations of being an orthodontist? Although this branch is one of the highest paid clinical branches, payments are received in installments, which can span over the entire duration of patient's treatment. So this is the thing which might concern certain aspiring orthodontists. So the payments which are received from the patients, they are received in the form of installments. So what I follow in my practice, and everybody else also, if I am not wrong, so we take 1/3 of the payment upfront when I start with the patient in the first visit, right? Rest of the 2/3 payment is equally divided month-wise for the rest of the remainder of the patient's treatment duration. So it doesn't create a hole in the patient's pocket because everybody is in the working condition. Everybody is earning money. Everybody is getting their own salary or business income on a monthly basis. So I don't want to impose myself on the patients, telling them that I want all payment upfront right now, today. If somebody tells me that I have to shell out maybe 30,000, 40,000, 50,000 rupees from my pocket today, right now, I'll think 10 times before doing that. So similarly, you have to understand the patient psychology, how they are versed, whether they are motivated or not. And patients are very sensitive when it comes to finances. You have to put your, you have to, you have to, you have to tell them this is the treatment cost, what you're going to charge. You just have to tell them and then shut up. It works actually. Patients have a tendency of bargaining, but I personally don't entertain bargaining in my own practice. And that's what exactly I want for all the dentists to follow. And also, one more thing I would like to tell you, that many times during the BDS course, you must have heard people talking about among themselves and dentistry mein kuch rakha nahi hai. Everything is like it's a gloomy future for dentistry. Well, it's not so. I don't think so. It might be there. I'm not saying it might be there. Every profession goes during their up and down phase. Maybe we are at the downfall. We are at the plateau phase of dentistry. But if anything goes down, it comes up. So you have to be the right person at the right time. You have to you have to upgrade yourself. You have to learn the skills. You have to be so theoretically sound in your knowledge that you should be the right person who will be able to uplift the level of dentistry in the current scenario. That's what I think, and that's what I think everybody should follow. So what are different limitations? Many times patients come with their broken brackets, which could be irritating at times. And this is especially true for me. I'm telling you on my personal experiences. You know, as long as patients come with broken brackets in your own practice, in your own clinic, that's fine. But if you are working as a consulting orthodontist at someone else's clinic and you have got 5, 6 patients waiting in line, then it becomes irritating at times. Because repair of broken brackets take time. You have to go about cleaning the tooth, cleaning the adhesive which is remaining on surface of the teeth, and then you have to go for the entire procedure right from the beginning. So that could be little irritating and time consuming at times. In GDCs, you don't get assistance in PG course. This line I put along with a smiley. I'm putting one more smiley here. I'm emphasizing this point because many of you must have done your BDS from private colleges. And if you are aware, people, postgraduate students in orthodontics, even in other department also, they must be fortunate enough to have attenders roaming around them. It happens in my department also, since I am working as an associate professor right now in one of the colleges in the city. So I see this every day. The PG students are asking for this, they're asking for that, and the attenders are always roaming around them. They're always on their toes. So that liberty you don't get in GDCs. You have to do everything by yourself. You have to do everything by yourself, right from instrument sterilization to bringing the instruments from the autoclave and setting them properly on the instrument tray, wiping up the instruments, cleaning up your dental cubicle or dental chair. Everything has to be done by yourself. Of course, clinical work will be done by you also. You won't get any assistance while clicking photographs of the patients. You won't get any assistance while fabricating the retainers of the patients, and so on. Right? So everything you have to do by yourself. So as I said, PG time in orthodontics is one of the most grueling times in one's formation of one's career. Over time, we become white tissue centric. We tend to ignore the pink tissues. So we are so much obsessed with the white tissue present in the mouth that we tend to often ignore the pink tissue associated with it. Pink tissues include the gingiva, the oral mucosa, the tongue, the buccal musculature, buccal mucosa, and everything. So you have to comprehensively look at the patient's mouth while doing any treatment. So Hippocratic Oath says what? Everybody must have taken Hippocratic Oath at the time of their graduation of BDS, that whatever we do, we don't do anything to harm the patient. So orthodontics or any other dentistry or any other field of dentistry, it might happen that there are certain untoward situations, unavoidable situations which might happen, which can injure the patient, or they could be certain like gingival recession due to plaque accumulation due to brackets. So you have to address that also while doing the treatment, right? So you don't have to be blind. You have to be comprehensively, you have to keep your eyes open all the time. You have to have a comprehensive look of the entire tissues present in the mouth. Then orthodontics, being an orthodontist comes with high stress levels, that is for sure. We have long hours and irregular schedules. We have to go about from one clinic to another clinic. So you have to manage your time, your resources, petrol, your vehicle, your public transportation, whatever, accordingly. That if you have 2, 3 clinics in a single area of the city, you can just cover those 2, 3 clinics in a single time. Means if I'm working today is Friday. If I have certain appointments today at one place in the city, so I try to complete those 3 clinics in a single trip. I don't have to go separately. So that will save on your time, your energy, petrol, your money, and your resources also. Okay. Then high financial investments in setting up a practice and instruments. As I said earlier, investing in instrumentation, investing in upgrading one skill should not be considered an expense. It is an investment which is going to reap, which is going to, excuse me, which is going to reap benefits in the long term. Maybe not now, maybe not after 2 years. You will definitely get results after 3 years, 4 years, 5 years from now, till the time you get established as a practicing orthodontist in your city. Okay. Yeah, one more thing, bending over patient's mouth could be taxing on your lower back muscles. So ergonomics is a must. So I've seen my own PG students in my college who are completely bending on the patient's mouth. I often tell them, I often point it out to them that you need to maintain a proper erect posture. Otherwise, you are going to develop occupational problems, occupational health hazards pertaining to muscle problems in the lower back. So ergonomics is a must. Okay. And of course, sometimes we come across unrealistic demands and expectations from the patients, especially in the era of artificial intelligence, right? Many people have softwares in their own clinic that they can just click the pictures of the patient's teeth, or they can do intraoral scanning of the patient's teeth, display it in the computer monitor, and then you will have artificial intelligence integrated enhanced smile, which will look good on your photo on your computer screen. So patients usually develop that kind of expectation. So you have to make the patient understand the limitation of the treatment. You have to make them understand the limitation, the financial limitations as well sometimes, and what all treatment plan would be better for the overall development, overall health of the patient. Okay, so for everything, you have to, artificial intelligence has its own pros and cons. This is one of the cons which has its grassroots in the field of orthodontics. I'll just take a break. Let me see if I have any questions or not. I'm not getting any questions. Why so? I'm not getting any questions. Can anyone please look into it from the management team? I'm not getting any questions. All right, so what rank will get you an orthodontic seat? So hands down, top 60 to 80 all India rankers will get top GDCs in open category. That is for sure. According to last year counseling and seat allotment data, so this 60 to 80 AIR rankers I have compiled based on last year counseling and seat allotment data. SC, ST, and EWS candidates might get allotment up to rank 300 or 800 if they are lucky. So this is the rank. This table shows the college and the rank and the category in which the orthodontic seat was allotted to them. So for VHU Varanasi, the first seat which was allotted was AIR 5 and 14 in the open general category. Then comes GDC Chennai, PGI Rohtak, AMU Aligarh, GDC Kottayam, GDC Ahmedabad, Nagpur, Bangalore, R. Ahmed Dental College, Kolkata. So you can see in the initial 1 to 50 ranks, all of these colleges have been picked up by the top rank holders in the open category. Then we have GDC Indore, GDC Jaipur, KGMC Lucknow. KGMC Lucknow did not have an open category seat last year. Otherwise, it would have been picked up in initial 20 seats. I'm pretty sure about that. Then again, we didn't have any open category seats for orthodontics in Maids, New Delhi. So otherwise, that would have been picked in initial 5 ranks, 5 or at the max 10 ranks. We had DU quota, that is Delhi University quota, and SC quota. Then we have GDC Cuttack, GDC Mumbai, GDC Goa, then GDC Guwahati, Hyderabad, Aurangabad. These were the GDCs, but now we have certain reputed private colleges which have come up recently. In that, we have Sabita Dental College, which was picked up at AIR 462, 1069, and 2377 through the management quota. Then we have Kaling Dental College in Bhubaneswar, Odisha, which was picked up at 679 and 797, both in management quota. Then we have A.B. Shetty Memorial Dental College in Mangalore, Sri Ramchandra, Chennai, KLE Belgavi, Bharati Vidyapeeth Pune, and JSS in Mysore. So you can see as the rank goes in a downward spiral among GDCs. I'm saying the top tier colleges. You can name it Maulana Azhar Medical College. AIMS itself has a different college, different examination altogether. So I'm not talking about that. I'm talking about the colleges which are filled up with NEET MDS counseling, right? So we have BHU Varanasi, GDC Chennai, PGI Rohtak, Aligarh, Kottayam, Ahmedabad, Nagpur, Bangalore. This was my alma mater. Then Kolkata, Jaipur, Indore, Lucknow. So all these colleges are good colleges, but you have to, as I said in the beginning of the session, that before choosing a college, you have to have a word with the existing PGs in that particular department. Whatever field you choose, whatever field you look at, you aspire to be, you have to have a heart-to-heart conversation with the existing postgraduate students of that particular department, of that particular college, to have a comprehensive overall view of that, of the functioning of the college, basically how the environment is, whether that's toxic, whether the environment is conducive to your overall development or not, right? So all those things you have to take care of. So top government colleges for orthodontics, as I said earlier, we have MAIDS and AIMS, New Delhi, PGI Rohtak and Chandigarh, Institute of Medical Sciences, BHU Varanasi. Then we have GDC Bangalore, Naya Dental College in Mumbai, GDC Indore, Hyderabad, Ahmedabad, Jaipur, Kottayam, Mumbai, Raipur, KGMC Lucknow. Then we have GDC Cuttack, GDC Nagpur, Chennai, Srinagar, Pondicherry, Aligarh Muslim University. But these dynamics of government as well as the private colleges keep on changing with every year. Especially the top tier private colleges. Dr. Ruchi had also mentioned this point, and I agree with her. I'm also going to put the same point to you. So, especially if you're talking about choosing a good private college, so the private college which has been picked up earlier, today, I mean, into last year, 2023, it is not necessary that it will be picked up at the same rank in the counseling session of 2024 exams, 24 results. So you have to take care of the different dynamics which go along with it. You have to look at the tuition fee. You have to look at the proximity to your hometown. You have to look at the infrastructure, how the professors, how the teaching faculty of that college is, how open they are to giving you a free hand, how much that college, that particular department is into research, publications, and all. So that's how you choose a private college, especially. So just to name a few, based on the ranks at which they were picked up last year counseling. So we have Savita Dental College in Chennai. We have Sri Ramchandra Dental College and Hospital, again in Chennai. A.B. Shetty Memorial Institute of Dental Sciences in Mangalore. Manipal College of Dental Sciences. SRM Dental College in Chennai again. Then Kalinga Institute of Dental Sciences in Bhubaneswar. SDM Dharwad, Cords Davangiri, D.Y. Patil College of Dental Sciences, Mumbai and Pune campuses. Sharad Pawar, also known by the name of Datta Meghi Institute of Dental Sciences, Wardha. And finally, last but not the least, ITS Dental College in Greater Noida or Ghaziabad. So with that, I would just like to conclude the session that if you want to know more, you just have to join DBMCI MDS Premier Group on Telegram. Since it is not always possible, although I cannot see any questions, I don't know whether the problem lies in my YouTube, in my phone, or I actually do not have any questions, because I can see 50 people are watching the session right now. So anyways, if you have any question regarding you need assistance from the faculty to understand the basics of counseling procedure, which branch to look to choose for. You are very much welcome to join the DBMCI MDS Premier Group on Telegram. Since this is a live session and it is not always possible to answer each and every query posted by the students here on this platform. Right? So with that note, I would like to take a leave, and I would like to introduce the next faculty of Public Health Dentistry, Dr. Garima Pambani, who is just waiting outside this room, and she will continue with the rest of the session. So I hope you enjoyed the session. If you have got any doubts, again, I would say you are very much welcome to ask any of the doubts on the displayed group on Telegram. Till then, good night. Bye-bye.
ये भी टेलीग्राम ग्रुप पे ही है ज्वाइन।
फोन पे कहाँ से आएंगे?
लिंक दूंगा आपको।
हाँ भेज दे एक बार जल्दी से। Good evening, students. So I am your public health dentistry faculty. One second. I'm just opening the links so that we can see your questions simultaneously. YouTube pe, that link is on YouTube, right? Okay. So very good evening, all of you, and so I'm your PhD guru. I am Dr. Garima Bhambani, and I work in the capacity of professor in People's College of Dental Sciences. So basically, let's start, and I hope to um, um, see some enthusiastic participants from amongst you all who are ready for the next step and to take up public health dentistry as their branch. So I'll just open the link wherein I can see your comments meanwhile, like in case you have any queries. So one second here. Yeah, okay. Yeah. So we'll be starting with this. So basically, what does a public health professional do? So obviously, this is a branch which is at the UG level. You have very less exposure as compared to what this branch actually stands for. So basically, this is a discipline. So where a dentist solves various oral health problems in the community. Okay, here the subject of interest is the community at large. Like when in clinical practice, the focus is on one particular patient. Okay, whereas in public health dentistry, here the focus of interest is the community. So it focuses on educating the people, bringing about a permanent change in behavior, promoting health, so that brings about a permanent change. Okay, also, as you know, that whatever programs are being run, that is because when we collect the data by survey, so only when the surveys are done, we collect the data. So those are the functions of the public health dentist. The public health dentist plays a very instrumental role in identifying the problems in the community, in planning, informing the policies so that the oral health problems can be solved. Okay. The role is majorly in the awareness and in providing the comprehensive services. So basically, a patient who comes to the public health dentist or in a satellite center, the comprehensive, that is the complete services are being provided by the dentist, okay, by the public health professional. And many of us think that it's a non-clinical branch, but public health dentistry is not non-clinical. It is basically paraclinical. Okay, so we have in our branches exposure of all the clinical branches. You can basically do all the procedures and especially the preventive procedures. So procedures like pit and fissure sealants, atraumatic restorative treatment, they are specially done in remote settings wherein it is not possible for the drills and those mechanisms. So, if you have the urge to serve the community, and to basically be connected to the masses, and that gives you a good feeling. So it's a very interesting branch in that case. And coming to the next point, basically, what are the career options after MDS? Okay, so the various career options is that in some places, they also, with the help of public health dentist, they also, practice teledentistry. So teledentistry is basically in that case, what they practice is that the center is somewhere else, and the public health, so basically with the help of the PA system or the video system, the dentist monitors and he helps in treating the carious lesions or in solving the dental health concerns. Okay, also a public health professional can be a public health consultant. He can work in the capacity of an epidemiologist, because the public health dentist is trained in epidemiology, in the study of diseases and what are the determining factors. Okay, and since the public health professional is very much into research, so they can later on work as a researcher also, and they can also work in the various research projects, okay, and in the as research professionals in there are various organizations in which the post for the research professionals come up. So even in my institute and in my department, my PGs are PGs. So basically, some of them have got projects and they are working in ICMR projects, and so they are working as research professionals, and that can be an interesting branch. They can also join a corporate hospital. Also, they can practice preventive dentistry. Okay, they can also join preventive services, and they can also apply for jobs in various health organizations such as WHO, UNICEF. Okay, and again, the most comfortable in terms of the other hustle, because other for the other branches one has to really apply and try and take specializations and work into the public sector, get a place for themselves, work as a consultant first. But based on the Dental Council of India and the requirements, the dentist can join as an academician. So once you have completed your masters, you can join in a dental college, and based on whether the dental institute is having a 1 unit or 2 unit, okay, he can basically work as an academician, okay, and he can be a public health educator. And there are people who like statistics a lot, so they also master that art further, and a public health dentist can carry out statistics very well, and they can continue their profession uh, completing the statistics and making research projects, formulating research projects, doing the analysis for people. So that is also an interesting thing. And there are also people like there's someone in Chennai, they have made a mark in terms of psychology, because we also deal with psychology. So that is also an interesting profession. And many public health professionals have also, because now DCI mandates tobacco cessation unit in all the dental colleges. Okay. So basically, within the dental colleges, what you need is we are also trained to be a tobacco cessation specialist, which is indeed a very interesting branch, one of my areas of interest personally. So basically, that is also an interesting, very interesting career option, and it gives a lot of satisfaction to be practicing that. So these are the various career options. One is either you be an academician, or you do the basic procedures and you join a hospital, practice clinical dentistry, or you can pursue all these other options, or you can do all, or you can join a teaching institute like me, and you can also teach. So all of that. And also academics is very interesting, very satisfying to teach students, and it's a very rewarding experience to work in dental colleges. I'm myself a professor in People's College, so that also has a lot of job satisfaction. And it's an interesting thing to do, because you get to do different things in all different areas. Okay, so basically, but as UGs, what you experience is probably depending on the various institutes, you may be going to milk dairy and to incinerators visit, you might be visiting the satellite centers, you might be going to the camps. We personally take our students to all these areas, so it is obviously a good exposure. And you do surveys also. So that is just a glimpse of what public health dentistry is about. It is much more vast, much more interesting. The theory that you learn in your UG is different from the branch that it is. And so again, but one needs to be passionate about it, and one needs to have an interest in what they are doing. That is the prime in pursuing any branch. Okay. So what are the advantages? If you are a public health dentist, what are the advantages that you get? One is that you get to practice, it deals with all the branches, right? So you get to practice all procedures under your roof, because a person who's come to you in a satellite center or in the comprehensive clinic for treatment, so you can basically do all the dental procedures on that patient. Okay. Also this practicing, working for the masses, educating for the masses, non-profit work, it has its own beauty and a lot of satisfaction. Doing selfless service, doing acts of selfless service, preventing a disease. Although, like when I opted for this branch at that time, and even now, it is not very common that a patient will come to you and he will say that I want to go for a Pitt and Fisher sealant. Okay, so it has its own advantages, and there are students who also pursue masters in public health and they go abroad. So people who decide not to stay in India, but that's an altogether different thing. But again, public health as such, apart from the public health dentistry, especially abroad, it has a lot of scope. And I think there are many medical professionals also, before getting into a course, they try to do MPH because it has its own job vacancies and stuff. But again, that is different from your masters in public health dentistry. Those are different things. And you get to serve humanity, you get to go to places, you have outreach, in those places where you normally do not go and you don't have the access to. So that is indeed very rewarding. But again, uh, it totally depends on what you're passionate about. What are the limitations? So, of course, the limitations are that for most of the people, it is a non-clinical branch. The clinical exposure that you get or you don't get, or the limitations that we face for not being completely clinical. So that is definitely one thing. And you're not a specialist of any particular branch, right? You're not an endodontist or like someone who specializes with root canal treatment. So that is the limitation of being a public health dentist, of course, which I feel. And what rank? So, what rank will actually give you public health dentistry? So, if you have up to 400 rank, you might get a government college, okay, for public health dentistry. If a person has a rank up to 2,700, maybe a category student might get a rank, okay, and might get a seat in a government institute. And if someone has up to, like for private colleges, up to 14,000, we might get seats for the non-clinical or paraclinical branches, okay. Now, what are the top government colleges for public health dentistry? So basically, GDC Bangalore was one of the oldest institutes from where we had all the pioneers of our Indian Association of Public Health Dentistry. We have KGMC Lucknow. Okay, we have GDC Chennai, and GDC Kottayam is very good. Okay, AIMS Bhopal is now coming up with public health dentistry. Then Maulana Azad is also running very well, and it also has public health dentistry. Then you have PGI Rohtak. Banaras Hindu University also has public health dentistry. There's GDC Raipur, there's GDC Ahmedabad, and there's GDC Hyderabad. GDC Indore is also having public health dentistry. My own guide is there now, and GDC Shimla is also there. Okay. So coming to top private colleges, again, Savita is a wonderful institute. So Savita Dental College has, PhD. There is KLE Belgaum. Belgaum is also very renowned. Okay, SDM Dharwad is known for its quality. It's amazing. Manipal standards are really good, as we all know. Bapuji Dental College is there. There's JSS Mysore. There's KM Shah Baroda, which is very good. Kalinga Institute is definitely amazing. This is in Bhubaneswar. And the Saraswati Dental College, Lucknow, is also known for very good public health dentistry seats. And Sudha Rastogi Dental College in Delhi is also very good. DY Patil Pune is good. And then my institute is also very good. That is People's College of Dental Sciences, Bhopal. Okay. So, I'll just go and see if I have, any queries. Any queries, any questions here? Yeah, I don't think any questions are there. Okay, Apsara has asked me, ma'am, what does MDS and PhD work in a hospital, like working in a dental hospital. So you're asking about dental college or dental hospital? See, dental college has a mix of duties. There is academics, there is satellite center, there is PG teaching in institutes where there is teaching. There is also UG teaching where you teach the undergrad students. Okay, there are tobacco cessation units in it. There you run the satellite center of the institute. Okay, and also you have. So this is the work, okay? But also as a dentist, and just like because you have a master's degree, you can also work in corporate hospitals. Like there are friends of mine who have also joined who have also joined dental colleges and sorry, hospitals, mohalla clinics in Delhi. So being a dentist and being a master's, you can any which ways apply for the corporate hospitals. Yes, Jaipur Dental College is good. It's quite old. And I think like I visited it long back, 10 years ago. That is when there was PG there. So you need to, maybe visit the place, see for yourself what are your priorities. Is it academic growth that you're seeking, or you're seeking clinical exposure? So, based on what is feasible for you and what are your areas of interest. Okay. And also, apart from the institute, the guide also definitely plays a major role. So, accordingly, you need to take your call that where you need to basically, join and, you know, uh, decide for yourselves. So basically, what else? What other questions do we have? Any other questions in PhD? I'm just looking at the questions. I think only Apsara and Aditi have asked. Okay. So I think if anyone has any other questions, which branch offers more chance of government jobs after MDS? Okay. So see, if you go for, as far as government jobs are concerned, what my observation is that if you go for the, this PSC exams. So in that is the branch doesn't really matter. You have to clear your scores and you have to apply, and based on that you get it in the adjoining hospitals. Okay. Now, what I have observed, that is my personal observation, I might not be right, when a new aims comes up, because now government had come up with a lot of aims, new aims, okay? So maybe they prefer to take an oral surgeon in the beginning. Okay, they might take an oral surgeon to start with, and because they are only having one to start with, and then slowly as they establish, like, once the institute established, then they come up with post graduation, then they come up with all different specialities and all of that. So then initially they want to make it a little clinically functional. So that is where oral surgery might play a role. But then again, if you're applying in academic institutes for government jobs, so in that case, what happens is many times that, there are many criterias, like, your publications. So anyone who has a very good scientific background in that case, or your profile is very good, or a good clinical exposure, or a good academic background. So there are many factors. So basically, if government job is your aim, you can't really, decide from now on, I feel, because that is pure destiny. And, there is no formula for that. It is, nothing is, there is no fixed formula on that road, basically. So it has its own pluses and minuses and known challenges and, of course, perks. So, yeah, any other questions? That was Kanchan's question. Any other question anyone has? So I hope regarding public health dentistry, I solved all your queries. And those of you who are interested, it's good to join, and maybe I generated interest in some of you all. And so, yeah. Okay, so I think, anyone who has any further queries in this regard, I don't see any further questions in this. Okay. So, share your questions related to NEET and INI-CET MDS counseling. Okay, you can do that on DBMCI MDS Premier Group on Telegram. Okay, so just do that over there, and you tag the respective subject faculty. Okay, to resolve your query related to counseling. This is completely free. This group is completely free. So maybe you all might come up with questions later on, or some questions have not been answered now. I think maybe you can't think of any questions as of now. So yeah, so we would love to solve your queries. And if there's anything, let us know. Okay. Yes, Rani, I really liked PhD. I was quite fascinated with the public health service, uh, and now I've completed 10 years. I'm a professor. I will be completing 10 years on the 10th of July. So back then, academically also, it had a lot of scope. And, there were these branches like PhD, oral pathology. They needed faculty like anything. And if you want to venture with your branch, there is always a lot to do. Any branch you do, you can always venture into various areas. And I felt that while opting for it, that there is always a lot of scope. And then one of my faculties also told me that a lot of patients would come, and they would, like, for their children, anyone would spend on their children, and they would get pit and fissure sealants done. So there was always a sense of mystery in that. So I kind of liked it. How to get into government dental college after MDS as a lecturer? Okay, so to get into government dental college, there are many factors. Okay, and no, it is not via PSC. For government colleges, you see, government colleges and all, you should aim when academics is your aim. So first, as Dr. Himani said, that you have to be very clear that whether you want to be a clinician or you want to be an academician, you have to choose for yourself. Okay, because what makes you feel alive and what makes you feel passionate is what matters. Okay, so basically, I opted for PhD where I had the option of other branches. I was basically confused between pedo and PhD. But then I opted for PhD because I thought maybe I can do root canal as a PhD person also. But of course, pedo has its own beauty, and it has so much more. Like there is conscious sedation, and there's of course so much more. But PhD has so much more in its own area. So basically, government dental college, do not keep that as the end goal, because there are the vacancy comes. Sometimes the vacancy can be branch specific. Sometimes the vacancy can be according to the quota. Okay, sometimes it might, the place where the vacancy comes, you might not be ready to relocate to those places. Okay, so PSC is not government dental college. In PSC, you get posted into the related hospitals nearby. And I think in between, the PGs also had some bond. And then, right after, they got jobs, which was a very good opportunity. They all earned pretty well. And one of our students was also doing a ICMR project, and then she was also doing SRship. So it was pretty good for her. And so, of course, it is obviously a lot of luck. But my personal recommendation is that always choose the branch. Don't take decisions based on what will give you a government college, what will give you long-term, gains or anything. I would say just choose the branch which you think you want to live with throughout your life, because that branch is going to stay with you whether you work in a dental college, you don't work in a dental college, whether you have a clinic, you don't have a clinic. And I think if you're going for clinical, then just master skills, master the skill that you are most interested in. If aesthetics makes you feel very passionate, so then maybe, choose accordingly. If so I think probably like I might, if you ask me to go back, I might make a choice between PhD, prosto, pedo, because I might say that, I want to help people who are old aged, and then what better and more rewarding it is to give them good dentures and give them the personal touch. So I think that is, according to me, in my personal experience, that is how you should choose a branch. This is my personal opinion, rather than going into, what will get you a government college and things like that. So I think, do we have any other questions? Okay, so we'll end the session. I think next is Periodontics faculty, Dr. Anaya. So she'll be taking your next session. So you can ask all about Periodontics and continue with it. Thank you. स्टार्ट है, लाइव है।
अभी नहीं है। ये मैं लिंक शेयर कर दूंगा।
ओके,
नहीं खोलना, नहीं यहाँ से पढ़ोगे।
हाँ नहीं, यहाँ कुछ नहीं ओपन करना है, यहाँ से देख लूंगी मैं कुछ।
चलाना तो ये भी कौन है।
ये वाले, ठीक है। इज इट लाइव, कैसे पता चलेगा मुझे?
और ऋषभ सर से कनेक्ट करना व्हाट्सएप पे, तो उनको बोल दो लाइव चल रहा है।
Okay, so hello, good evening, my dear students. A very, very good evening to all of y'all. And we here at DBMCI are here with you to give you a mega counseling session, for the NEET MDS. And I am Dr. Anaya Kulkarni Kale, your original guru for pediatric and preventive dentistry, that is Periodontics. All right. So since morning, you've been attending everybody's counseling sessions from all the original gurus. And up till now, I'm sure you are completely packed up with the knowledge, with all the queries, with all the answers that you required. A lot of things would have been clear, but I'm here to talk about my specialty. I'm here to talk about why and how periodontics is an important part of dentistry, and how beautiful the subject is, and how flourishing the career as a periodontist can be, and what is the scope based on your rank, etc., in the NEET MDS exam. All right. So for the first thing that everybody, all of you all know, what exactly does a pedodontist do? So the first thing that comes to your mind when you see a pedodontist is that the pedodontist treats children. So it's not just treating children. The first, you see a general dentist will do everything, but as soon as a child walks into the clinic, he is going to be scared how much ever well practiced, great handwork a particular dentist has. Because the most challenging part of treating a child is managing the behavior, is making the child come around to actually accept what treatment you want to do. So a periodontist, let's just not, talk about it in a nutshell that a periodontist only treats children. It is actually a multifunctional, a multidisciplinary branch in which you get to almost practice every other branch. Just go through the index of periodontics as a subject, and you will see so many topics that are actually interrelated to the other subjects of dentistry. Like, for example, endodontics. So when you practice pediatric dentistry, when you are practicing pediatric dentistry, then you are treating children up till the age of 14 years. Okay, so you are looking after children up till the age of 14 years. So when we say 14 years, you are in charge of the primary dentition, of the mixed dentition, and also the permanent dentition. So you know what is a root canal, how to do a root canal. You know how to do a crown preparation for a permanent tooth. So not just pulpectomy, pulpotomy, you almost are practicing the entire conservative and endodontics in pedodontics. So in case you are planning to be a general dentist, in case you are planning to have a general practice in your dental clinic, pedodontics is actually a very good branch for you, because you will be able to practice all the all the procedures on the adults, as well as you will not be scared of children, right? So that's endodontics. You are almost dealing with all the procedures in endodontics: post and core, crown preparation, all sorts of fillings, all sorts of restorations, and of course the root canal procedure. Prosthodontics. So there are procedures in periodontics, such as there is something called as nasoalveolar molding. So nasoalveolar molding is basically a prosthodontic appliance that you give to a cleft lip and palate patient. So it is a rehabilitative procedure. Once the surgical treatment for a patient who has had cleft lip or palate has when the patient has undergone that surgery, in the rehabilitative phase, you give a nasoalveolar molding appliance. That is actually a prosthodontic appliance that molds the jaw and the nose, because the jaw and the nose gets disfigured in case of a CLCP patient. So after the surgery, a pediodontist's role comes into existence for the rehabilitative procedures, where you have to construct a nasoalveolar molding appliance, and there you work hand in hand with a prosthodontist, or you have to deal with a lot of theory of prosto also. Again, there are things for when we are talking about the CLCP patients, there is something called as the obturator. So when a child that is very, very young, a child who cannot yet undergo the CLCP surgery and has a good degree of cleft palate, a child who is so young that he has to feed on either the breast milk or the bottled milk, that time you have to give something called as an obturator. Again, that is a prosthodontic appliance that a pedodontist has to make by taking the impression of that young little child, right, in order to obturate, or in order to close that gap that is present in the palate of the CLCP patient, so that the patient can feed well. He can create that suction pressure easily, so that the feeding becomes easier. Okay, so there also you are going to read about or work hand in hand with a prosthodontist. Again, ortho, it is the ortho and pedo go a lot hand in hand. So you have various, removable appliances. So there are various removable appliances that you're supposed to make for children in order to treat the, in order to treat various malocclusions. And apart from removable appliances, such as, habit breaking appliances, there are a lot of habit breaking appliances, such as thumb sucking habit and mouth breathing habit, and a lot of other habits that you need to take care of. So as a pedodontist, you have to deliver such appliances. So that's a lot of ortho work. Again, there are appliances such as the 2x4 appliance, which is a fixed appliance given in children with mixed dentition. So these are appliances that are given to children with mixed dentition, and these are fixed ortho appliances, 2x4 appliances. So you get to practice removable as well as some part of the fixed orthodontics also as a pedodontist. Okay, so until now you've done stuff with endodontics, you've read about prosto, you've read about ortho. Again, perio, so you're doing procedures such as mucocele excision, you're doing procedures such as frenectomy, and then you will deal with juvenile periodontitis and all of these things, drug-induced gingival enlargements. All of these things do occur in children who come in the range of a pedodontist. So you are doing minor oral surgeries in such as frenectomies and mucocele removal, etc., in as a pedodontist also. Okay, so such as, let's say, frenectomy, mucocele removal. And then again, there are scaling, and there are curettage, and you deal with periodontitis that come with teenage. So these things you are dealing as a pedodontist. Then in oral surgery, again, minor oral surgeries, as I told you, these frenectomies and mucocele removals, etc., also come in oral surgeries. Then in case of, if there are cysts that are present in a patient's mouth, like that comes well within the range of a pedodontist. There are cysts associated with a particular decayed tooth. You are supposed to be doing enucleations, and in case of granulomas, abscess, you do things like marsupialization manipulation and complicated extractions, everything, these all cover the oral surgery part. So you have a hand with the oral surgery as well. And then public health dentistry, of course. Again, periodontics and public health dentistry also go hand in hand. So you have to go for a lot of camps. You go to schools with the PhD people, and then there are screening camps, there are treatment camps, and fluoride application camps are there. So with the public health, there is a lot of role of periodontists when you go out for these various, camps, etc. Right? So a periodontics is not a branch where you are getting restricted to one particular thing. When you read the subject periodontics for a good span of 3 years, you cannot say that you will not be able to practice any other procedure. Once you are done with the MDS, you will be able to do almost every single procedure in a clinic as a general dentist also. Plus, you will have the advantage of being confident enough to handle a child. So I think it is an excellent branch in case you are planning to practice general dentistry, or apart from general dentistry, even if you are planning to practice, if you are really passionate about children, about treatment in children, then you can definitely go for an exclusive periodontic clinic or exclusive periodontic practice. All right, so this is what exactly a periodontist does. So there is so much. You are not getting restricted as a periodontist. Now, what are the career options after MDS when you do periodontics? So first thing, academics. Of course, there is a periodontic department in almost every dental college in India. You have great scope in academics. If you are passionate about teaching, if you are passionate about giving lectures and interacting with students, academics is an excellent field. Other than academics, along with the academics, you always have an option of having a clinical practice. So there are periodontists who are doing exclusive pedo practice, and there are periodontists who are doing general dentistry practice, who are practicing general dentistry. So now, to be very specific, people who are settled in, larger scale cities such as Mumbai, Delhi, Bangalore, Pune, etc., these people have great scope in exclusive pedo practice. The paying capacity of people is excellent, and they are exclusively practicing pediatric dentistry under conscious sedation. So they have conscious sedation units in their clinics. There are various, you will get, it's like a branch. You'll get various different countries will offer their clinics. They'll offer you to open branches in your city. So you'll have like a franchisee name of their clinic, and you can even run a clinic like that. And that is an exclusive pedo clinic only for children. You can practice conscious sedation, and there is great awareness about pediatric dentistry in such places. I would say in places that are, that have an average, a little smaller places, smaller towns, you will be better off practicing general dentistry. And the plus point will be you will have the advantage of handling pedo patients. Plus, you will be well versed with every procedure required for a general dentist. So, exclusive pedo practice is also a good option, and general practice is never out of hand for a pediatric dentist. Again, consultation. So consultation is great in pediatric dentistry. People who are very good with their handwork, very good with their clinical work, cannot handle children. A lot of many senior dentists I've visited, they just, it's not the procedure, it's just the behavior management part that hinders them to deliver the correct and quality treatment. So consultation for pediatric dentistry never goes out of fashion. You will always have a great demand, especially in bigger places. So if you want to practice periodontics in bigger places, so it is an excellent option. You will never go out of practice, out of demand for consultation. And again, practicing exclusive pedo gets a great scope for you in such places, right? So I don't want to be very specific though, but females actually have a great scope with periodontics. They are generally thought to have a little better rapport with children, though we have some really great male periodontics in our field, though I'm just telling you a general predilection. Okay. Again, there is a scope of doing PhD and research, entering into taking up a thesis, doing PhD in whatever topic you love, doing PhD and entering into research. But again, when we talk about research, it's exclusively based on your interest. You can enter into research only when you are interested. Okay, just let me go through your queries also. Yeah. Okay. Yes. So that you can enter into research also. Great scope. Again, as I told you, it is a multidisciplinary. It goes hand in hand with a lot of other specialities. You will never run out of a topic when you are searching for research in case of periodontics. Okay. Okay. I think I am not online. Yeah. So you will never go out of practice or out of a research topic when you are searching for periodontics. You can search something that is related to perio, you can search something that's related to endo, ortho, OS, or PhD, anything. You will never run out of a topic for research, and you will get plenty of excellent researches in this case. Again, you can publish books, you can since it is such a multifactorial, it is such a multidisciplinary subject, you can there is a lot of scope in new material discovery, new material introduction, new getting patents, getting copyrights over different materials, various mouthwashes, irrigant solutions, obturating materials, and whatnot. So research is not boring when it comes to periodontics. I have a couple of books published. I have more than a couple of copyrights, a patent. So, I do it along with my academic and clinical practice. So trust me, it's a beautiful branch. There is no emergency. You can have a great, family life and professional life all together. And plus the entire dentistry is like, it's not out of your hand. You are in touch with almost everything. Then there is one more thing, that is additional courses that I want to add on to. So about the additional courses, if you are interested in implants, you can have a course on implants also, even after doing MDS. So you can learn about implants. Rotary you learn during your PG in periodontics only. There are a lot of things you learn, conscious sedation, etc. There is one more new thing that people are really doing nowadays, that is actually taking up a lot of interest in people, and that is a course in child psychology exclusively. So every other institute nowadays has a separate psychology wing. Institute as in, I'm talking about the educational institute. So, the big shot schools, the colleges, the various institute. I'm talking about all the institutes, not just dental institutes. Every institute, most of the places, it is mandatory to have a psychology unit, a psychology therapy, or counseling unit. So there are a lot of periodontists who are doing additional courses on child psychology, degree courses on child psychology, out of interest, of course, if you are interested. And then they are working as child psychologists in various institutes, and they are getting paid really handsome. They are getting paid really, really well. So apart from all the additional courses that are open for you all after MDS Periodontics, you can always go for, courses in things like child psychology, etc. Plus, nowadays, since you all know, there is a lot of flourishing, Ayurveda, and people are a little this thing about allopathy and etc. So there is something called as biodentistry that we are practicing nowadays in case of periodontics, where you give a lot of prophylactic treatment, you reduce as much as medication as you can, and you include Ayurveda in pediatric dental treatment. So that's a separate, that's called as biodentistry, but there are a lot of researches going on amongst us about it. So that's also, if you are interested in it, that's also one of the very interesting and new topic that you will have in hand when you are practicing pedodontics. So are you just noticing how many different things are there to explore? Okay. Now, advantages for being a periodontics, there are so many I already told. I am just going to repeat them. So the advantages are nothing but you will have a hand in almost every specialty. You will not be out of practice for any particular, like for example, 3 years you read about periodontics, you will still know what is how to do a root canal, how to prepare an adult tooth, and how to do various minor oral surgeries and everything. Okay. And plus, if you have a special love for children, this is going to be like excellent for you. Plus, consultation never goes out of fashion in case of periodontics. Even the senior most practicing dentist will require a periodontist to handle children in the clinic. So consultation wise also, periodontics is a great, excellent branch. Is it clear? Then cons or limitations of being a periodontist. So one, if you are very passionate about hardcore surgical cases, or being on the surgical team to do things, you do not get very hardcore surgical cases. The trauma cases goes on to the oral surgery, but there are cases you can do as a periodontist under GA. So we do a plenty of GA cases as a periodontist. So in case there are certain special children, so children with special children with mental or physical disabilities, so the special children who have things like full mouth rehabilitation, there are a lot of pulpectomies, lots of fillings to be done, and it is not possible on the dental chair for the children. So I've personally done a lot of such cases under GA. So the child is posted in the OT, and the anesthesiologist gets the child under, and you can do the entire full mouth rehabilitation of the child in a single go. And that is really rewarding. That is really beautiful to see that child who was not ready to enter into your clinic walk out happily with all the teeth properly done in a single sitting. So you can operate on a child, you can do all the dental rehabilitative treatments under GA, but hardcore surgical cases, they will not be, you will not be on the team on the surgical cases. You will be on the rehabilitative aspect. So that is one limitation if you are really passionate about surgery, right? The next is language. So why did I write language? Because when you are doing MDS periodontist, the key of being a periodontist is communication. That is, the communication is the key of being an excellent periodontist, right? So so if you are doing MDS periodontics from a state that is that has a different regional language, it is going to be difficult for you. Okay, because children generally are comfortable in the regional language. Like for example, I am from Madhya Pradesh. If I decide to do MDS periodontics from a college in Chennai or Karnataka or somewhere in Kerala, the children there will be comfortable with their regional language. They will not be knowing Hindi.
I am comfortable with Hindi and English. So it is going to be very difficult for me, because the key of child psychology, the key of behavior management is exceptional communication. If you cannot communicate well with the child, all your periodontics as a this thing is gone. Okay, that's the key for behavior management. So language is one thing that you should always keep in mind when you are choosing a college for MDS periodontics. Okay, yeah. Right. So that is one thing. Even if you are really passionate about a particular college, but there is language barrier, it's going to be difficult. You will have to be a little, you will have to learn the language in that case, so that you can communicate well with the children. So that's one limitation of being a periodontist. Okay. Now, what rank will you get periodontics? So periodontics, we have studied about the last year metrics. So about 400 plus minus 50 ranks get periodontics as a branch in government colleges. So as much as I remember, the last government seat that was picked last year in the subject of periodontics was around 493 or something. That's where the last government seat for pedo went. Okay, so about that you will get a government seat, and for the private you will get up till the rank of 14,000 plus 500, around 14,500 you will get the this thing, what do you call as the private pedo seats. Okay, so what are the top government colleges for periodontics? So as I told you, you all know what are the top government colleges. There is PGI Rohtak, Chandigarh, then there is BHU, AMU, GDC Nagpur, Chennai, Srinagar, and then Nair Dental College, GDC Kottayam. There are a lot of government colleges. So these are the matrices from last year. This year they are going to open up new matrices, how many seats for which category are available in which college. But again, I would want to stress on the point that if you are going for periodontics, keep it clear in your mind that it is very important. Apart from the facilities that are available in the particular college, you must be sure that you can communicate well in the regional language of that particular area. Okay, again, the top private colleges for periodontics. So we have Savita Dental College, excellent facilities, the interiors are beautiful. It's a beautiful college, okay, with great faculty, everything. That's in Chennai. Then we have AB Shetty Mangalore, then there is SDM Dharwad, and there are a lot of other private dental colleges. So what I want you is to see is to look at the OPD, how old is the college, how is the OPD of the college, the faculty in general. Okay, and plus again and again I'm stressing, if you are going for periodontics, make sure that you are comfortable with the regional language of that particular area, because that matters a lot. The communication part matters a lot in case of pedo as a subject, right? Okay, so as so far, I don't know whether this is not getting refreshed or can I not see any queries. Okay, but if you have any more queries, if you have any queries related to pedo that does not get cleared in the YouTube group, so share your questions related to the NEET and INI-CET MDS counseling and tag the respective subject faculty. Like if you have any doubts related to this thing related to pedo as a subject, then you can tag me in that particular Telegram group. So there is a DBMCI MDS Premier group on Telegram. So you can join that group, and there you can tag the particular subject faculty and ask the query. Okay. Yeah, and ask the query, and there you will get your queries solved. So basically, that was all. And I know the private colleges, they will have their own set of rules. So we've covered a general ranking system, and last year, according to the last year matrix, I've told you a general this thing on what rank you can get what type of a college, and the states will declare their own set of rules. This is for the all India level that I have told in general. And again, in case of any particular query, you can just go to this particular, join this particular Telegram group and tag me if there is any query related to pedodontics in particular, and then I will be there to solve your queries. I hope I was able to generate interest in a subject, in the subject periodontics. I know most of you all are scared of treating children, but believe me, it's a great branch where you are never going to be out of practice. So all the very, very best for your counseling, and bye bye. Good night. So next we're going to have Dr. Shrishti with us, your original guru for oral pathology. And just hang on for Dr. Shrishti Jaiswal after me.
Good evening to all of you to counseling session for the academic year 2024. I hope I am audible. Counseling session for the academic. All right, so this is Dr. Priyanka, your original guru for the subject OMR. And in this particular session, we are going to look at the aspects of OMR, what all you can do in OMR branch. All right, so what do we call this branch as? A non-clinical branch, right? And I would first like to burst a biggest myth that everybody has incorporated in our head as OMR is a non-clinical branch. No, it is not a non-clinical branch. Once you get into this branch, you will get to know what avenues have for this branch, or what are the different avenues are in this branch. All right, so this OMR subject is dynamic and versatile, right? I have put up these pictures on this particular slide to just summarize what all OMR specialist can do, or we are also known as oral physicians. Okay, so first, what does an oral physician do or OMR specialist do? Okay, when you enter the college or else in your private practices also, what you actually do, you take complete history of patient, right? Medical or dental, right? Then you do thorough clinical examination, you advise investigations. If you are in the college, you yourself do investigations, radiographic investigations, right? Or you can also carry out biopsies, right? Yes, you can carry out biopsies. OMR specialist can carry out biopsy, no need to refer it to surgeon, right? Then management, if pharmacological management is there for the condition, you can treat the patient pharmacologically. All right, so all the aspect that we have for a particular patient, right, you can carry out as a OMR specialist. All right, so I have put up these points where these OMR specialists have knowledge about pharmacology, okay, to treat different chronic conditions, right? Like chronic ulcers, or you have TMDs, orofacial pains, right? They have attained expertise in diagnosing the oral mucosal lesions as well, right? Then oral precancerous or oral cancer, okay, screening for precancerous and cancer, oral OMR specialist can do, right? Now the advanced technologies have come where we are using lasers for this treatment of precancerous lesions, okay? It is called as laser ablation. So it is a latest technology, and in future ahead, we are going to use this as our primary management for the precancerous lesion, right? Then we are handling orofacial pains, atypical orofacial pains also, right? The most important aspect is management of medically compromised patients. So a patient having systemic conditions, they all have oral manifestations also, right? So we as OMR specialists have expertise in this, right? To treat those or first to diagnose those conditions and then treat and manage those conditions, right? Next point is for those who are interested in this crime and forensics and everything. So you can do fellowships in forensic odontology, and then you can enter into that field if you are interested, right? So these all are the you can say things that OMR specialist does exclusively apart from general dentistry, right? Next thing, yeah. So everybody tells that OMR में future नहीं है, कुछ भी नहीं है, सिर्फ clinical, सिर्फ पढ़ना. No, this is not the case. There are different career options after MDS in OMR. All right. First of all, the most important, it bridges the, all right, it acts as a bridge between the medicine and the dentistry. So if you are an OMR specialist in colleges in second year or first year, third year, you get to interact with a dermatologist, you get to interact with general medicine specialist, right? And you can discuss the cases, because there are oral manifestations of systemic diseases. There are some dermatological conditions which shows oral manifestations. So in those cases, you need to interact with the specialist, right? Gastroenterologist in such cases, ulcers cases, right? If a patient have recurrent aphthous ulcers, right, and you are not getting the cause of it, you can refer it to gastroenterologist. And if he has some gastric ulcer problem or acidity problem, it may reflect on the onto the oral cavity. In such cases, you can just diagnose the condition by referring it or by discussing it with the specialist, right? Then we have some broad areas where OMR specialists achieve this expertise. First of all, you can just put up or own your diagnostic and imaging center. So I'm here talking about CBCT. Okay, so now in this, you can say, era, the CBCT has become very important diagnostic modality. Okay, without CBCT, you cannot do implant, you cannot do surgical excision of the pathology. You need, you can say, proximity of the vital structure from implant or for impacted tooth, right? CBCT is must. Without CBCT, you cannot go ahead. Okay, so you can act as, or you can become consultant radiologist in the CBCT centers, right? And also you can own your own CBCT centers in that case. All right, next we have orofacial pain clinics. Okay, so very few people know that there are exclusive orofacial pain clinics in India. They are not much. There is no saturation, unlike other branches. Okay, orofacial pain clinics. Then we have this TMD specialty clinics. Okay, exclusively only practicing this orofacial pain and TMDs. They are giving treatment to TMD patients. They are diagnosing the pain cases or TMD cases, right? Then you can collaborate with oral pathologist, oral surgeon, and dermatologist, and you can say build your own private practice, right? And next, oral cancer screening clinics. So, as an OMR specialist, we specializes in diagnosing precancerous and cancer cases, right? So you can put up this oral cancer screening center, all right? Or you can also open your own private practice and accommodate all these things in your private practice. All right, that will become much larger, you can say, aspect, okay, of OMR. Then we have you can get associated with hospitals, okay, where you can manage this medically compromised patients. Also, you can get associated with hospitals, right? You have scope in that also. Then academics, obviously, of course, academics in government colleges or private colleges, you can join academics. Then government jobs are there. After clearing PSC exams, you can become class 1 government officer. Okay, after MDS, you can become class 1 and medical officer. And after BDS, you just have to have experience to become class 1, but after MDS, you can directly become class 1 medical officer, right? Research, you can join research institute. There are vacancies, government vacancies for OMR people, or you can say pathologist or PhD people, right? So you can get into research also. Okay, yeah. Then fellowships, we have fellowships available for TMDs, orofacial pain, and forensic odontology also. You can do fellowship in forensic odontology, and you can get into that field of forensics if you are interested in. Okay, so what we do in forensic odontology, what we are we have as a OMR specialist, that you can we have lip prints, like, okay, lip rings, and you have palatal rugae examination, then identification of teeth, right? Getting the dental history of the suspect and everything. So all these things we can also do, and we can get into this forensic field, right? Then abroad, I am not telling you like painting the rosy picture here. Yeah, for going abroad, you need to plan, like pre-plan, okay, in your BDS UG years only. Okay, after, I would suggest after BDS only, you can go for abroad. Okay, after doing MDS, then you are, if you are planning for abroad, it will take too much time. Okay, because this Indian degree is not directly you can practice over there. Okay, with Indian degree you have to clear the licensing exams after going there. So better to go after BDS, okay, then MDS. Yeah, there are some corporate jobs also, okay, that you can, if you don't like clinical work and everything, you can go into corporate jobs. All right. So these are some career options after MDS, right? Okay. Then I'll tell you what are the limitations in this OMR subject. Limitations. First and most important limitation is lack of awareness. So, lack of awareness among general practitioners, among medical practitioners, all right, among patients. Okay, that this condition can be treated by OMR specialist. Okay, there is lack of awareness. Therefore, this specialty is facing the identity crisis. All right. So I'll give you one example. In my posting times, okay, after MDS, I had 1 year of government posting. In those days, there was one patient who had this condition, okay, lichen planus. So he had oral manifestations as well as systemic manifestations, right? And he, from 2 to 3 years, he went to all the general physicians, all right. They were giving antibiotics, they were giving multivitamins, and he went to some dentist also. He and that dentist prescribed him some mouthwashes and this lignocaine gel and everything for the oral manifestations. Okay, and then he happened to come to our hospital. Okay, I diagnosed the case as lichen planus by looking at the oral manifestations. I started the treatment. All right, he was very like very much depressed, okay, since 2 years, because he was not getting a proper treatment, right? Then he came to me, and then I treated for 1 month, 2 months. I carried out the steroid course, okay, and then he was completely fine. The oral and systemic manifestations also were like treated properly, and he was very happy and satisfied with the treatment. So what is important here is diagnosing the case is very important. Without diagnosis, you cannot manage, you cannot give any treatment to the condition. Yeah, I understand these cases are not so common, but if you treat one case or also, the patient will spread a word and you will get the cases, right? So not just for the counseling purpose, but in general also, I'm telling you that you need to refer the patient to OMR specialist if you feel that this condition can be like treated by the OMR specialist. Okay. Yeah. And next limitation is not including the OMR specialist in oncology team. So we as OMR specialists diagnose the precancerous and cancer cases, right? So including us in the oncology teams will add +1 or will be the advantage only, right? So these are some limitations, yeah, and takes time to establish your practice, your brand, okay? But this applies to every branch, right? You need time to establish your name, right? Next, I have just put up this government colleges which are participating in this counseling 2024. Okay, and I have put up this sorry. I've put up this OMR seats, okay, for this government colleges. We have general OBC, SC, ST category wise seats for OMR in these government colleges. Okay, and what are top government colleges for OMR? MATES, Aligarh Muslim University, BHU, Banaras Hindu University, right? GDC Mumbai, GDC Nagpur, Nair Dental College. All right, I'll tell you cutoff marks, okay, in these government colleges. Okay, so you can just take screenshot of it, or yeah, you can note it down. All right, next we have these are private or deemed universities. Okay, and these are seats for OMR. These are OMR seats in these colleges, right? And top deemed universities that you can get enrolled in are Manipal Dental College, Sabita Dental College, JSS Mysore. All right, these are top deemed colleges where you can get good exposure to patients and everything. All right, just make sure whatever college you are taking, you should learn CBCT within these 3 years. Okay, CBCT is a need of an hour, and if you are getting into OMR branch, you need to learn CBCT on priority. All right, these are some central universities where you have this OMR seats. Okay, for category wise. All right. Next. All right, what rank will you get? Okay, see, this data, what I'm telling you, is based on 2023 allotment list. All right, and we are talking about all India quota. So 50% seats are reserved in government colleges, and then we will talk about central universities. All right, and deemed colleges. Deemed colleges. Right, so I'll start with the general category. All right, category wise I'll talk. General category: to get into government college of OMR seat, you need rank from 1 to 350. All right, you need rank from 1 to 350 to get into good GDC. All right, then for OBC category, okay, you need rank. I'll give the range 350 to 800. All right, you can get GDC if you belong to OBC category, right? Then if you belong to ST category, okay, and your rank is between the say 3000 to 4000. All right, you can get into GDC, Bangalore, Chennai, and Indore. So these colleges reserve seat for ST category. Okay. Next, we have, if you belong to SC category and your rank falls approximately, okay, or around 1300 or something, you can get this postgraduate Institute of Dental Sciences, Rohtak. Rohtak. All right. So these are some ranks for government dental colleges. Then you have central universities. So for central universities, what rank do you need? For central universities, what rank you will need? See, yeah. So first we'll take MATES, Maulana Azad. Last year, for OBC category, they have only one category, one seat for OBC in AIQ, like All India quota. So 242 rank have got this mates. Okay, have got this seat. Then Aligarh Muslim University, you should be around 800 rank. Okay, 800 rank, and this is for general category. All right. Then Banaras Hindu University, you should be around 1600 rank for general category. So you can just note it down if you want to take OMR branch. All right. Then I'm talking about deemed universities. Okay, deemed universities, if you are around 2000 to 3000, then KL University, Belagavi, okay, you can get into this university or college, 2000, around 2000 to 3000 rank, right? If you have rank around 4000 to 5000, then you can get into AB Shetty, uh, Indira Gandhi College, Pondicherry, Pondicherry. All right. Then 6000, these are management or paid quotas, right? So 6000 to 7000 rank, you can get into SRM Chennai, Sharad Pawar Dental College, Wardha, Meenakshi Dental College, Chennai. All right. Meenakshi Dental College, Chennai. All right. Then if you are between the rank 8000 to 9000, okay, you can get into Indira Gandhi, Bhubaneswar. Sorry, not Indira Gandhi, Institute of Dental Science. Institute of Dental Science. Institute of Dental Science, Bhubaneswar. Okay. You can also get Savita Dental College, very good college, Savita Dental College. Okay. And DY Patil. DY Patil. Again, if you fall in between 10,000 to 13,000, okay, 10,000 to 13,000, you can get DY Patil, AB Shetty, Yenopoya, Savita, and Rural Dental College, Loni. Okay. All right. Yeah, I'll take the questions once I finish this. Okay. I think you will get your answers after I finish the next slide. See, so these are the institute in which you can get OMR branch at this ranks. All right. So make a note of it if you want to put OMR in your preference. All right. Yeah. Now I'm talking about stipend and approx fees. Now, when we are talking about government colleges, right? Government colleges, approx fees will be 20 to 30K. Okay, 20 to 30K. If we are talking about government and central universities also, fees falls between 20 to 30K. If we are talking about deemed universities, maximum fees for OMR can go up to 8 lakh to 10 lakh, and minimum fees 3 to 4 lakhs. All right, maximum fees, minimum fees. All right. And stipend, if I talk about in government college, you can get stipend up to 40 to 60K. All right. Central universities gives stipend around 80K to 1 lakh. All right. And deemed universities, I have just I've just got this values from the prospectus, and deemed universities like Manipal, Bharati Vidyapit. All right. Institute of Dental Science. Institute of Dental Science. Right. These universities only offering around 30 to 40K. All the deemed universities are offering around 5 to 10K. All right. Others. Only Manipal, Bharati Vidyapit and Institute of Dental Science, Bhubaneswar is offering a stipend around 30 to 40K, but the fees are 8 to 10 lakhs. So there is no, like, you can say they are returning your fees only, right? So these are some important points. Yeah, now I'll take your questions. 246 air, any chance for OMR in Central University? Yeah, anonymous. See, Central Universities last year, if you belong to any category, okay, if you belong to any category, mates OBC, in OBC category last year 242 rank has got this seat. Okay, so if you belong to category, yes, you can get into Central Universities, right? And yeah, in general category also, Aligarh Muslim and Banaras Hindu, you can get a seat. All right, anonymous. Kalyani Kaushik, what's the fee structure for Belagavi? Okay, so fee structures differs each year, but maximum fees for OMR in deemed university can go up to 8 to 10 lakhs. 8 to 10 lakhs maximum, and minimum is 3 to 4 lakhs. Okay. What rank in state? See, stipend also I told you in say these colleges, deemed universities, Manipal, Bharati Vidyapit and Institute of Dental Sciences, Bhubaneswar. Only these institutes are offering around 30 to 40K. Rest, all the other deemed universities are offering 5 to 10Ks. All right. I hope counseling. State counseling, Hina, in state counseling also, you can get seat up to, again, it differs according to cutoffs of each college. Okay, so 10K, if you fall between 10,000 to 13,000, you can get a seat for OMR. All right. So I hope I've cleared all of your doubts. And just for concluding, okay, for concluding this session, I would just like to tell you that just spot your interest, okay, and pursue that. All right. Don't get overwhelmed by everything, okay. Just know that this, yeah, I want to take this and I want to pursue in this field. You should go for that, and your end goal should be to excel in your field, okay, no matter what branch you take, okay. Your end goal should be to excel in your field, and you just need these four things to be successful. You need willingness to explore, right? You need patience, and you need vision, okay. then you can be successful no matter what branch you will take, right? So all the best to all of you, and I hope you all get your dream branch. Yeah, Rani. Yeah, I see. I'll tell you honest, Rani. Ma'am, did you like OMR? Okay. See, I'll tell you honestly. In final year of UG, I I just hated OMR like anything. Okay. Compared to all the other subject, I hated OMR. Okay. And then I hated PhD the most. And then second last was OMR. Okay. But once I got into the field, okay, I got so interested in this subject because of the medicine, you can say, um, uh, reference or a medicine part. Okay, so I got so much interested in this field. Now I don't regret getting into OMR. Okay, so I'll tell you, if you are dicey, if you are having a dicey mind, okay, you like the subject, also have dicey mind, what future holds, and what can we do in OMR subject. Don't think too much, just grab the seat. I'll just give you that advice. Just grab the seat, you will not regret it. Okay. Ma'am, PCD or OMR, which should I prefer? Okay, I'll not tell you which subject you prefer. That you have to figure it out by yourself. What in what subject you are interested in. Okay, that you should take. Can I get JSS Mysore in 15K? See, JSS Mysore. Mm, yeah, we have 4 seats. Yeah, you can get JSS Mysore. You can get JSS Mysore, but that again depends on the cutoff rank. Okay, cutoff rank. I'm not giving you a surety, but you can try for it. Fellowship. Yeah, you can do fellowship after OMR, after MDS. You can do a fellowship if you want to pursue in particular topic. Say, I have told you, see, orofacial pain, TMD. If you just want to exclusively practice this particular topic, you can get fellowship, get into fellowship, do your fellowship, and practice that exclusively. Yeah, you can. All right. I hope I've cleared all of your doubts. And if you still have any doubts, you can join our DBMCI MDS Premier group on Telegram. You can tag particular faculty if you have doubt in that particular subject, and you can get your doubts cleared. Right? Thank you so much. And next faculty will be Dr. Srishti, and she'll be guiding you about oral pathology. Thank you so much. If you have any doubt, you can post it in the Telegram group. I'll be happy to answer.
A very good evening, everyone. Okay, okay. A very good evening, everyone. So I know you have been doing this session since afternoon. Okay, so I will not talk anything which will confuse you. Okay, I'll not talk anything which will confuse you. So coming directly to the oral pathology from your perspective. Now, when I'm talking about this, so okay, so when I'm talking about oral pathology, so there are three things. Okay, now Dr. Priyanka has she has already spoken about the rank list and at what rank you will be getting what subject. So oral pathology and OMR, they go very hand in hand. Okay, so if you are getting oral pathology in any of your college, like including your deemed college, including your government college, you get easily oral pathology. Now this comes between the rank range of 0 to 350. So in that you will be getting your government colleges, okay, or central deemed universities. Just give me a second. Okay. So now coming to the three important things. When do you have to take oral pathology? So if you are interested in oral pathology, okay, so I think there was a slightly technical issue. Okay, so now coming to the oral pathology. Okay, I'll not talk anything which will confuse you. So let's just exactly talk about the oral pathology. So I know first you should keep in a mind that first you have to do a MDS degree. Okay, so what are the things which will help you in pursuing which branch you have to take? Now, when we talk about oral pathology, okay, now you should take oral pathology if you have something with when you have something in your mind, like if you want to do something in forensic. Okay, so there are different courses for the forensic. So if you are interested in that particular aspect, so you should take oral pathology. Now generally there are very less students who are actually interested in oral pathology, to be very honest. Now coming to the next very important perspective. Okay, when you do not have any desired clinical rank, okay, when you don't have any desired rank to get into clinical seat, but you can get into a government college, like Dr. Priyanka, she had spoken about that if you have a rank till 450, till 450 or 500, you can still get a get a oral pathology seat in a government college. Now I will be talking about what are the advantages of doing oral pathology in a government college. Okay, now the third point is when you just want to get an MDS degree. Now the very important perspective is like different states, they recruit MDS postgraduates. Now in this you will become a medical officer, and the average salary for a medical officer, it is 60,000 to 1 lakh. Okay, so this option also holds good. Okay, now oral pathology, coming to my second point, oral pathology from a government college. Now what are the advantages here, what are the pros here? First of all, you will getting a good stipend. Okay, so if you are from government college, you will be getting a stipend of 40,000 to 60,000. Okay, now if you are in a central university, you will be getting a stipend of till 1 lakh. You will be getting a stipend of 1 lakh plus, now a very important aspect, plus you will have a free evening time. Like when you are in a department like oral surgery or endodontic, you don't get free evening time, but when we talk about non-clinical branch, you have a free evening time. And what you can do this, like if you are clinically oriented, but if you have taken 1 year drop and you don't have any option, but you have to do only from the government college, then what you can do, you can do your clinical practice. If you cannot do your clinical practice, you can join any of the clinic. Okay, you can learn the clinical aspect. Also along with this, you can do many courses like basic courses. You can go for RCT courses, implant courses. Okay, because all the specialists, they cannot do everything. Even an endodontist, if they want to do implant, he or she, they have to go for implant courses. Okay, if a prosthodontist wants to do an RCT, he or she, they have to go for endo or the RCT courses. So there are many available courses, and if you have that passion to do that, so in that you can excel in any of the field. You can excel in RCT, you can excel in the implant, irrespective whether you take OMR, irrespective whether you take oral pathology. Okay, so this includes all your pros and cons of going for oral pathology. And if you have less rank, okay, that you cannot go for a clinical option, but still you are getting a good government college, or the central university in the non-clinical, including your oral path, so this option holds very good for you. Okay, now career options after MDS. Okay, so you have academics with you. Now in academics, if you are very much oriented, there are many forensic odontology courses. Okay, so everybody knows Dr. Ashit Acharya, okay, who helped in finding the finding culprits for the Nirbhaya case. Okay, now forensic holds very good in outside India also, outside India. Okay, so there is no end to it. Now coming to your clinic. Okay, after academic, it is only till 4 or 5. You can, if you have very good clinical skill, you can open your own clinic. And when you open your own clinic, there is no end, to your money. Okay, there is no end. Okay, now research option, again research option holds very good. You can, there are many research courses available. And you get even there are many companies, or their government recruit people who have done research. Okay, so you can train people who wants to do research. Okay, so this also hold goods. Okay, so these are the career options when if you are doing in oral pathology. Okay, but remember, you can, whatever branch you take, you can run your own clinic and you can excel in any of the field. So dentistry is a branch. If you have a MDS degree in any of the field, it does not matter, you can go in any of the field. Okay, now come, these are the top government colleges, okay, like your KGMC, BHU, AIMS Delhi, PGI Rohtak, IMS BHU. So these are the government college. But if you have to just get a MDS degree, okay, if you just have to get a MDS degree, if you have a very high rank, if you have to just get the MDS degree, then there are many deemed colleges also there, okay. Deemed colleges, like I'll tell you the name of the good deemed colleges. Deemed colleges, like you have Savita, Chennai, Savita, AB Shetty, JSS, JSS. There is a college in Karnataka, SDM Dharwad, Bharti Vidyapeeth, and there is IDS Bhubaneswar, Now, and also Manipal. Now the fees range, Manipal, Savita, AB Shetty, the fees range can go from 1 lakh, 2 lakh to 6 lakh, 2 lakh to 6 lakh. And the stipend, only few private colleges, they give you actually stipend, like Manipal, IDS Bhubaneswar, and BVP Pune. They give stipend of 30,000 to 40,000, while rest of the colleges, they range from 6,000 to 8,000. Okay, so this is the stipend for the oral pathology. Okay, so if you have any other doubt, regarding oral pathology, then you can telegram on DBMCI MDS premium group. You can tag any of the faculty, okay, not only the oral pathology, you can tag any of the faculty, and your doubt gets immediately cleared. Now one thing I will tell you about oral pathology, that irrespective, okay, so don't think that if you have taken 1 year drop, I know I can understand your situation. If you have taken 1 year drop and you are not getting a seat in the clinical, I would say take OP as your option. Take OP as your option. There are a lot of I mean, it does not mean that it will shut your door. Dentistry is a field you can excel irrespective of the branch. You can still holds your clinic, you can run your clinic, and you can excel in it, okay. So it's okay. You don't have to feel depressed that I'm going into OP. It is really a very good branch. And also one more thing, you can tie up with the medical medical pathologist and open your own path. Okay, so there is no end. It totally depends upon the person, okay. So it all depends upon the patience and perseverance, and how dedicated you are. So even if you are doing academics, you can still go for a good clinical practice. And once you have started your own clinics, so there is no end to it, okay. You can do RCT, you can do implant, you can do courses in lasers, and you can do anything, okay. Gargi Ghoshkal, ma'am, last year students have got OP till 500 to 600. Exactly, you can get, actually it depends upon the ranking list, okay. It depends upon the cutoff, okay. So even till 700 rank, you can still get OP in good government college, and in a good government, or even in the central university, okay. If you are SC or ST, you can get till 3 to 4,000. You can get till 3 to 4,000. And trust me, I am saying this, I know a student. He had a rank of around 200. And he still opted public health dentistry in Kolkata Ahmed College, okay. And I asked him, why you want this as an option. He told me ki ma'am, if I join PhD, then I get a good leisure time and I can practice how much ever I can. and I will also get a very good stipend in hand. So once you pass out from the PG, you have a good stipend, and the money, it is actually very important if you are thinking about running your own clinic. Okay. So along with that, you can still do your academic. So it opens a wide option. Okay. So I wish you all best of luck. And if you have any doubt, you can directly call me. You can tag me in the Telegram group. Okay. So apart from that, if you pathology in Rajasthan, Punjab, and Himachal, please tell me. Okay, good private college. So there are list of many private college which is there. When you talk about Rajasthan, Punjab, and Himachal, for personal, for personally a college, if you're talking about, then you can just give me a text in the Telegram. I'll tell you in detail. Okay. Yes, NIAD. It actually it depends upon that ranking list. Okay. So one rank get OP at Nair Dental College. Okay. So you can get Nair Dental College till rank of 350 till 400. You can get Nair Dental College. Okay. General category. Yes. Chalo, I wish you all bestest of luck. If you have more doubts, you can just telegram me. Okay.